Okay, welcome, ladies and gentlemen. We're going to go ahead and get started. Ms. Owen will be joining us very shortly. She is on her way. Can we have a moment of silence and the Pledge of Allegiance? There she is. Thank you. That's okay. Led by Ms. Christie.
Please stand for a moment of silence. Face the flag. Pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Once again, welcome to our September 1st annual reorganization called meeting. Do we have any changes to this agenda? Okay, we have a motion to approve. Okay, we have a motion by Ms. Babb, a second by Mr. Watson. Any discussion? Okay, all in favor? Aye. Any opposed? Motion carries. Ms. Coatney?
reorganization of the board for 2021-2022.
Thank you, Ms. Coatney. The board, or the floor is now open to nominations for board chair. Ms. Bounds?
Thank you. I would like to nominate Susan Horn to a third term. Having been board chair, I know the importance of the first year, and I think that she can lead us forward with great continuity. She's aware of the issues, and she has a very good grasp of meeting rules and procedures and how to direct us. So I would like to renominate for this year Susan Horn.
Thank you, Ms. Bounds. Ms. Babb?
Yes, I'd like to nominate Christy for board chair position.
Okay, thank you. Okay. Okay, do we have seconds for both nominations?
Second.
Okay, for both? Can it be for both?
Do we need a second?
Mm,
I don't know that you need a second. Do you?
We probably should have seconded it.
I'll second.
Okay, so
Bounds
Mr. McMillan is seconding Ms. Bounds' nomination.
I second that.
Okay, and Ms. Satterfield seconds Ms. Bounds. Okay. Discussion. Any other nominations? Okay, any discussion? Okay. Go ahead, Ms.
And if you will signify your vote by saying the last name of the person that was nominated, Ms. Satterfield,
Christy.
Ms. Owen,
Christy.
Mr. Watson,
It's Christy.
Ms. Babb,
Christy.
Ms. Henderson,
Miss Christie.
Ms. Bounds,
Horn.
Mr. McMillan,
Horn.
Ms. Christie, and Ms. Horn.
Horn.
That's 6 votes for Ms. Christie and 3 votes for Ms. Horn.
Okay, congratulations, Ms. Christie. Okay, and now we will move to nominations for vice chair. Ms. Babb?
Yes, I would like to nominate Ms. Satterfield as vice chair.
Okay. We have a second by Mr. Watson. Okay, any other nominations? Okay,
Move the nomination cease.
okay, nominations are closed. And any discussion? Any discussion, Ms. Owen?
Move to accept by acclamation.
Ms. Satterfield, would you like to say
A little
something?
discussion.
Yes, ma'am.
I'd like to speak just a little bit. No,
Accept the
I do.
nomination.
Thank you. I do want to accept I do want to put it out there that I do want the vice chair position, but I also want it to be known within this vice chair position, I really want to support the chair and work collectively when it comes to setting the agenda and the stuff for the whole entire governing of our body. I think that will help the chair position, the weight that we all have within being an elected official, but specifically in the chair. But I do look forward to bringing a lot of substance to the vice chair position as well.
Thank you, Ms. Satterfield. Okay, any other discussion? Okay, we have a motion by acclamation and a second on that. Okay, all in favor? Aye. Any opposed? Motion carries. Congratulations, Ms. Satterfield, on your vice chair. All right. Thank you, board members. Okay, we will, let's see. Okay, just a note of announcement for board members. Ms. Coatney will send a list of board committees and roles to everyone later this week. And if you would let her know what you're interested in by as soon as possible, that would be very helpful. So that those can be announced at the next, probably at the next meeting. I think we usually do that during the October meeting. So I believe that is it, and we will adjourn, and we will meet back in this room for the next called meeting that will begin at approximately 5 p.m. Thank you. We've already had our moment of silence and Pledge of Allegiance, so we're going to just jump right into this called meeting agenda. This called meeting is in regard to, well, before I get into that, first I wanted just to, in case anybody's just now joining us, I want to congratulate again our newly elected board chair, Christie, and our newly elected vice chair, Ebony Satterfield, and they will begin chairing meetings next week. So they will be, they'll do that next week. So congratulations again, ladies. So before we move into the agenda for this called meeting regarding COVID matters, I wanted to start just by asking everyone here to be courteous and respectful to one another. As we've seen over the last few months, there are many different opinions and viewpoints, but we must remember that everyone is here for the best interest of our students, and the children are watching and listening to us as adults, so it's important how we treat one another and how we handle these difficult issues. We do have 60 speakers this evening, and as always, if anyone is not complying with the board's civility code, they will be asked to leave and escorted out if necessary, because we must maintain order to be able to get through our agenda and complete our work. So thank you in advance to everyone who's here. Thank you for engaging and for your passion and your cooperation. Do we have any changes to the agenda? I will just note that Ms. Babb has withdrawn her item number 10. And did you want to make any comment on that or anything?
I just felt like there was another motion made by another board member that kind of covered the same thing, and I didn't
Okay.
really see the point in the two being on
Okay,
there.
Great. Any other changes? Mr. Dupler?
Thank you, Madam Chair. I just wanted to state that because this is a special called meeting, no other motions can be added, but motions to amend or substitute a motion that's already on, or an agenda item that's already on the agenda can certainly be entertained.
Okay.
Thank you, Madam Chair. I would like to make an amendment to public forum. I move that we allow 90 seconds for each public forum speaker.
Okay, there's a motion to amend public forum to 90 seconds
For each of the 60.
for each of the 60 speakers. Okay? Any question? I'm sorry, Ms. Bounds?
Yeah, we've debated this over and over in policy review, and when we tried to move it down to 3 minutes, we were met with quite an outcry. I just think that's pretty extreme, 90 seconds, regardless of what side these people take. I think people have prepared their speeches according to the guidelines that we have in place, and I think that 90 seconds would be just really a hardship on a lot of these people. Especially because so many people that come before this board are not public speakers. They just want to share their story or their, what they believe. And it's hard enough to do that. And when you have to look down and wipe out 4/5 of your speech, then I think that would be a very big hardship on them. So, I sat here till 1:30 one evening, and, we kept it at 60, and which I think was very wise, but I don't think it's wise to change it at this point.
Thank you, Ms. Bounds. Other comments?
Board Member Bowles, would you make a friendly amendment to lift it higher than 90, but less than what we have? I'm asking. I'm open to that.
What do we have right now? Are we at 3 or 5 still?
We're at 90 still.
90 seconds.
Oh,
So,
okay, but traditional, okay. What were they expecting to be able to speak? 3?
5 minutes, 5.
5, okay. I would be willing to go with 3 minutes. I think that cuts time off and kind of halfway between yours and mine, or what we've been doing.
Did you say 3?
What?
I'm sorry.
3.
3?
Yes.
Okay,
I'll accept that friendly amendment.
okay. All right. Any other comments, questions? Mr. McMillan, did you have anything? Did you made the, you seconded
I
the
made the
motion. Are you
second.
okay with it?
I just think that most of these people have been before us before, and there are only so many points that you can make, and I think a couple of minutes, would be enough to state what you want to.
Okay.
I know
so-
there's a local, person on the radio that's doing this very same thing, and he's only allowing 90 seconds for anybody to just, it's kind of like hit it and quit it, so to speak. Just tell what your reasons are.
So
You got
we-
5 reasons, just go down through there. You don't need a big paragraph with each one of it.
Okay. Are you, Ms. Bounds, would you like to speak before I ask Mr. McMillan this
Well,
question?
I really respect both of these colleagues and agree with both of them. And we have heard multiple people, and I think the last count I got today was over 300 emails. So I do think we have allowed the public to voice their opinions on this and that sort of thing. And I do agree with Mike that we've heard over and over, but I just think to decide it right now would be very detrimental to the process. So
Okay,
I
so,
would,
Ms.
Point of order, there are people out there yelling. Are they allowed to do that?
No, they are not, and I saw a police officer head that way. Can we have order in the other room, please, so that we cannot be distracted? Okay. Ms. Bab?
Yes, I mean, I understand that we have 5 minutes. We did have a meeting recently where we allowed 3, and I thought everyone was very able to make their points eloquently. I do think 90 seconds is a little too short, but I do support the 3 minutes.
Okay, and I think we're back to Mr. McMillan. Would you be willing to accept the friendly amendment that you've seconded?
Accept 3, but I'll just withdraw mine.
Okay, so that's fine. Mr. McMillan has withdrawn his second. Okay, so Mr. Watson is seconding. So we now have 3 minutes for public forum. Any other discussion? Yeah, any other discussion? Okay. Right. Okay, all right, Ms. Coatney?
So this is a roll call vote on allowing public forum speakers 3 minutes. And Ms. Satterfield?
Yes.
Ms. Owen?
No.
Mr. Watson?
Yes.
Ms. Babb?
Yes.
Ms. Henderson?
yes.
Ms. Bounds?
Yes.
Mr. McMillan? No. Ms. Christie?
Yes.
Ms. Horn?
Yes.
That's 7 yes votes and 2 no votes.
Okay, motion carries. Thank you. And now we need to go back to the agenda. We had a motion and a second on that to approve the agenda. Okay. No, okay. Do we have a motion to approve the agenda? Mr. Watson and Ms. Christie, are you seconding? Okay. We have a motion and a second. Any other discussion on approving the agenda? Okay, all in favor?
Aye.
Any opposed? Motion carries. Okay, thank you. And now I'll refer to Ms. Babb for public forum.
Yes, we will start public forum, and Ms. Horn has already gone over some things, but just before we start, I will reiterate a little bit of our rules on public forum. Public forum speakers shall address remarks to the entire board and not individual members. Each speaker shall state his or her name and county of residence and have up to 3 minutes to make remarks unless time is extended or shortened. Members of the board and the director of schools may have the privilege of asking questions of any person who addressed the board. The board respects and appreciates the good intentions that bring citizens to speak at public forum. The board asks that speakers show the respect for the board, the staff, and other citizens by speaking in a manner that is civil and courteous. I am going to probably call 5 at a time in the order that they're supposed to speak, just so that people can get ready to come up. Okay, we will start. Kelly Wolf is first. After her is Jonathan Casey, then Mary Jane Morris, and then Maggie Schauffer. So Kelly Wolf, and just state your name, county residence, and you will have 3 minutes to speak.
So I'm Kelly Wolf. I live in Knox County. I'm a board-certified pediatric nurse practitioner in the community who's working in private practice and also in the urgent care setting. I'm a mother of a student in Knox County Schools. I'm also a product of Knox County Schools. And I'm here today just because of the safety of our children is my highest priority. And I want our children to be in schools where they have the best chance to learn. I want to present facts from the American Academy of Pediatrics, the CDC, and well-known epidemiologists that outline the severity of the situation and the steps that we can take to ensure safe learning. The AAP released a set of guidelines for safe return to school for the 21-22 school year, which strongly advocates that all policy considerations for school plans start with the goal of keeping students safe and physically in school, and that is my goal as well. The recent rise of COVID-19 in our community and schools presents a challenge that we must face. In the first 2 weeks of August, there were 2,646 active cases of COVID-19 in Knox County, and in the most recent 2 weeks, there have been over 5,000 positive cases. This amounts to a daily increase of 36% over that time. As of 8:30, there were 816 active student cases and 107 active staff cases in our schools. The pediatric healthcare system is overwhelmed. Our offices are struggling to maintain phone calls and just getting everyone scheduled. This has just been, we're overwhelmed. In 2020, our children didn't bear the burden of this virus, and it was evident that has changed. The Delta variant has changed the game. It's 1,000 times higher viral load, and it's 200 more times transmissible. For every one person that is infected, they have the chance to infect 6 to 10 people on average. Our children are contributing to the community spread in their households, especially to adults that are unvaccinated. And we must consider those experiencing the most severe cases are those unvaccinated, and our school-age children, grade K through 6, can't be vaccinated yet. The current district policy to make masks optional goes against guidelines of both our CDC and the American Academy of Pediatrics. It also ignores the science of COVID-19 transmission and fails our youngest school-age population. With no other mitigation strategies in place, the current evidence-based material is limited, but it does indicate that COVID-19 will spread widely in school settings without a layered approach. And this indicates that strategies such as better ventilation, contact tracing, and universal masking are most effective. Improved ventilation is costly and not time effective, but masking and contact tracing prove mass benefit for minimal investment. It was last school year when there was a rise in cases, our school-age children were wearing masks in the classroom and didn't experience the volume of positive cases that
Thank you. I'm going to have to stop you. I appreciate it. Jonathan Casey. And then Mary Jane Morris, Maggie Schofer, and Sarah McIsaac.
Can I go?
Yes, say your name and county of residence, and you'll have 3 minutes to speak.
My name is Jonathan Casey, Knox County. Members of the board and Mr. Superintendent, I am here to discuss the scientific evidence for universal masking. I provided each of you with a copy of my noted remarks with links to studies supporting my comments. I am a clinical research scientist with a PhD in biomedical engineering and the father of an elementary child. My background demonstrates my expertise to advise the board on preventing COVID spread in our schools. I would like to start by clarifying by everyone why mask works. I wear my mask to protect everyone else in this room from infection in case I am asymptomatic. In the last 3 weeks, I sent the board studies and videos showing how universal masking with a 2-ply cloth or surgical mask effectively contains airborne particles emitted from the wearer. Videos of a person sneezing or coughing into a mask compared to an unmasked person demonstrate the effectiveness of cloth and surgical masks to contain germs. Now, this mask I wear does not protect me from airborne COVID particles because it does not fit my face tightly. However, if every person in the room wears a cloth or surgical mask, I receive protection as well as everybody else. We must rely on universal masking in schools for all students to feel safe and staff to feel safe as well. The scientific literature supports universal masking to arrest COVID spread, especially in schools. A study completed by Duke University found that universal masking in schools reduced the risk of COVID spread to less than 1%. Based on these findings, experts recommended eliminating quarantining and social distancing to the North Carolina State Board of Education. A similar study in Georgia compared schools that implemented universal masking and ventilation changes to those that did not. it showed that both interventions were effective at reducing infection rates. I summarized these two studies because they address universal masking in schools located in states similar to ours. But the board should note that the literature and clinical experts overwhelmingly support universal masking with other layered COVID prevention measures. In closing, I implore the board to implement universal masking for all students based on disease burden in our schools, to allow the district to pause or reinstate universal masking based on district disease burden. The district should educate students, parents, and staff on how masks and other COVID prevention measures mitigate disease spread to help all stakeholders understand their role in stopping the spread of COVID. We can work together to implement this simple yet effective measure. Note, I believe that universal masking with layered prevention measures can allow the district to eliminate quarantining for exposure and the need for virtual instruction. Demonstrate to this community that the Knox County Board of Education stands with science and not political narratives. Implementing appropriate prevention measures shows you value your students, their families, your staff, and the Knoxville community by establishing a safe learning environment and helping to decrease the spread of COVID in our community. Thank you.
Thank you very much. Next, we'll have Mary Jane Morris, then Maggie Schober, Sarah McIsaac, and then Barry Golden.
Good evening, members of the board. Thank you for allowing myself and other parents to speak to you tonight. My name is Mary Jane Morris. I'm a Knox County resident and a parent of a kindergartner at Cedar Bluff Elementary. This is the first time I've spoken at the board tonight or attended a board meeting in person. I moved to Knoxville 7 years ago with goals of starting my family in a city that embodied the volunteer state sense of community. Most certainly, the last few school years were nothing what we had envisioned. As a single parent, I was counting down the days until my child would attend the neighborhood school, be involved in the community, connect with her peers, reach her full potential through the Knoxville County system. For her pre-K education, my daughter attended the Trinity Learning Center in Farragut to prepare for reaching the milestone to joining Cedar Bluff Elementary. During the last school year, my daughter flourished, and her school was safe because her educators executed the safety measures identified and regulated by this board. When the Knox County registration period opened for this school year in the spring, parents like me made the decision to enroll their children in the school with the safety protocols that were then in place. This board's mission is to provide excellent and accessible learning opportunities that empower all students to realize their full potential. How did revoking the safety protocols uphold this mission? Our schools follow policies to regulate physical activity. I cannot request my child is given screen time instead of PE. I cannot opt her out of the well-balanced lunches and send her a lunch filled with fried foods, sugary snacks, and soda. These are only a few of the regulations that were set in place by the field experts who today this board is turning their back to. The CDC, AAP, your local healthcare champions who are here tonight, you look to them on all other topics but this one. When my daughter asked me why her kindergartner teacher is not wearing a mask, what should my response be? Her principal, the elementary school is only enforcing the policies that are set in place by this board. What should my response to a kindergartner who's been accustomed to masks as a safety precaution all but to this point of entering the 21-22 year? How should I explain to her that the same policies that we had in place last year to keep her safe are no longer relevant? How does this reflect the Tennessee volunteer spirit that being a citizen of our society is not only looking after yourself, but the person next to you? If the pandemic has taught me one thing, it is that far too many of us, when asked what you will do for the person standing next to you, it's very little or nothing at all. And for this board what does it say? And what will you do for our children and our educators? My kindergartner understands this. She wants to see this from her teacher, and in order to do so, we must have the support of the volunteers that are on this board. Please reinstate the safety guidelines you put in effect in April. Thank you.
Thank you. Maggie Schober, and then Sarah McIsaac, Barry Golden, and then Vera Dygert.
Hi, Maggie Schober, Knox County. Thank you. If it weren't for my privilege, I wouldn't be standing here today. If it weren't for my family's privilege, my son would likely be battling COVID. Thanks to parents communicating, we found out that a child in my son's class tested positive for COVID-19 recently. Without my ability to keep him home because the schools are not safe, my son would have contracted COVID. thousands of families across the district do not have the ability that we had to keep our son home, to keep him safe. And they are not learning about exposure in time. The schools are not a safe place for our children right now. The virus is spreading like wildfire, and the schools are not safe. A North Carolina State University study, which I emailed to you all on Monday, found that without masks or preventative testing, at least 75% of students in a school will contract COVID within 3 months. 75%. KCS has 60,000 students. So that's 45,000 cases of COVID among students alone. That does not count the staff, the families, the community members. 1% of children require hospitalization from COVID. That's 450 children in our hospitals for days or weeks over the next 3 months unless you do something. Our healthcare system cannot handle that, especially when you consider the burden of seasonal flu and RSV. We know that while the death rate for children is lower than adults, it is not zero. 0.01% of children die. That means over the next 3 months, without masks, 5 children would die from COVID. At least 5 children's lives. Countless more with long-term symptoms. I've already lost 1 family member from this virus. I will not lose one of my children due to your negligence. Think about Austin East for a minute. 6 students have been killed by gun violence this year. If you could go back to January 1st and prevent those deaths in a way that does not harm others, wouldn't you do it? And these statistics are just for the kids, not including the countless staff, family members, and community members that your decisions impact. We are asking for common sense measures, masks, testing, contact tracing, support for staff. We are asking you to make our schools safe. Thank you.
Thank you. Sarah McIsaac, and then Barry Golden, then Vera Digert, and then Heather Glossop.
Thank you for providing me the opportunity to discuss my thoughts regarding the health and safety of our children while they are in school. My name is Sarah McIsaac. I'm a critical care nurse and a mother of 2 children who currently attend Knox County schools. I work the front lines of the COVID pandemic in the emergency department and ICU, and I personally struggled with the fear and anxiety that I could bring COVID into my home and infect my family. I cared for extremely sick COVID patients for over a year, at times with merely a simple face mask, and I managed to protect myself and my family from the COVID-19 virus. Sadly, it took less than 3 weeks of sending my child into a Knox County school without a mask mandate or social distancing protocols in place for COVID to make its way into my home. Our children have now become the front lines of this pandemic. The Knox County School District is doing nothing to provide children with adequate protection from this virus or a safe environment to learn. While at school, my children have experienced similar fears that I had as a critical care nurse caring for COVID patients. My 11-year-old son expressed his fear to interact with unmasked peers and educators because he doesn't want to get his family sick. My 6-year-old daughter has taken it upon herself to eat lunch with her back turned to her classmates because there are no social distancing protocols in place in the crowded cafeteria. Why is it that a 6-year-old and an 11-year-old have the moral compass, compassion for their peers and family, and the wherewithal to attempt to implement effective control measures, but the Board of Education and Knox County School Board does not? My daughter's school currently has a policy that children must wear tennis shoes during PE. This policy limits my right to choose what shoes are best for my child to wear during PE. Should we stop enforcing this policy because my daughter feels anxious when wearing closed-toed shoes? School policies are adopted because they have the safety of all students in mind. We trust our schools to make these decisions and enforce these policies to keep our kids safe. A mask mandate, like what we had in 2020, is no different. It's a safety policy that may be unpopular to some, but is fundamental for the safety of the children, teachers, and staff. As a parent and a nurse, I urge you to look at the science. Listen to the recommendations from doctors, hospitals, the health department, and the CDC. Please implement a mask mandate and social distancing guidelines and actively participate in contact tracing. Please help keep our children safe from this dangerous and deadly virus. Thank you.
Thank you. Next, Barry Golden, then Vera Dygert, then Heather Glossop, and then Wendy Brindley. And please state your name and county of residence, and you have 3 minutes to speak.
Hello, my name is Barry Golden. I live in Knox County. I'm a longtime science teacher in private school and public school sectors, and also I've taught science in 2 different universities, including the University of Tennessee. I have brought some visual aids, by the way. So I'm here to recommend that the board adopt some measures to include some basic science that's really common sense concerns in terms of keeping our kids safe in Knox County schools. One of my main focuses today is just to inform you that because of the KCS policies, you're actually undermining what students in KCS have to learn in terms of the Tennessee state standards. I want to point out one aspect that as of elementary school health standards, this may surprise many, but as of 4th grade in health standards, one of the main strands of health standards is titled disease prevention. And as of 4th grade, students are asked to identify prevention strategies for not spreading pathogens. For example, vaccines, staying home with fever, etc. So we expect 4th graders across the state of Tennessee and in Knox County schools to discuss how to keep everybody safe from pathogens. Why can't you institute policies that do the same? Also, in terms of science standards, we have what are called the scientific and engineering practices, and these are the practices and behaviors that we expect students to engage in as they learn about science. I'm going to call attention to 2. The first being analyzing and interpreting data, and the second being engaging in argument from evidence. So let me give you an example of what that looks like. What I've spent a career doing with my students. Here's a graph made from data from the Tennessee Department of Health. This shows Knox County COVID cases per 100,000. The first date over here is July 1, 2021. On the far right is August 30th. These data are already out of date because these lines would go off the chart literally. But one of the questions that I would ask my students typically would be something like, what patterns do you see in the data? 5th and 6th grade students are able to derive patterns from data like this. And they can come to conclusions that are consistent with scientific consensus in terms of saying, well, these 2 lines diverge from each other. This line is going up. What line is that? It's the line that says school-age kids in Knox County. What's the key event there? Kids in Knox County schools are smart enough to put that together too. The key event is the first day of school, right? As of the time we put kids back in school on August 9th, cases started skyrocketing because we were putting them back in a situation where no safety requirements were in place. So I beg you to do something about that. Thank you.
Thank you very much. Vera Dygert, and then Heather Glossop, Wendy Brindley, and then Cecily Fishman. And please state your name and county of residence, and you'll have 3 minutes to speak.
My name is Vera Dygert. I live in Knox County. I have a son who attends public school here. We have 14% of the student body that is out of school because of your utterly disastrous lack of leadership. If your plan was to continue with in-person learning and make up some of the learning loss from last year, let me tell you, your plan doesn't seem to be working very well. While the rest of the country is implementing mask requirements and following the overwhelming consensus of healthcare professionals, we're sitting here watching slides of football games where no one is wearing a mask and listening to the board use that as a justification for not protecting our kids. Let me tell you something. The Tennessee Secondary School Athletic Association just canceled over 30 football games because of COVID concerns. The National Guard has been called to help staff hospitals here in East Tennessee. The board is complicit in these problems. We are in a situation today where over 9,000 kids are out of school because of your stunning failure to protect our kids and your callous disregard for their health and safety. When the board fails to follow the overwhelming medical consensus, Not just the CDC, but the Tennessee Health Department, the Knox County Board of Health, the American Academy of Pediatrics. When the board is blinded by its own political views in a public health crisis, there is something fundamentally wrong with the system and its leadership. Let me explain something to you. You're not a political arm of the state, and you're not a political arm of the local government. Your primary obligation is not to the parents, but to the student body, and to ensure that they are able to attend school in a safe environment. When it comes to discussions around masking, all I hear is the words me, myself, and I, and my rights. Me, me, me. I am a parent. I care about parents' rights. But we all give up some rights to live in a decent, civilized society. And as members of civil society, we have obligations toward the sick, the elderly, toward our neighbors, which means there has to be some trade-off between personal self-interest and the welfare of our community. There have to be reasonable limitations on our rights so we can all live together and function together as a society. We don't have an unlimited number of hospital beds or doctors or nurses or hospital staff. And so when kids get sick and go to the hospital because you fail to take reasonable health precautions, you are using precious resources and taking the bed of other kids that need it. No man is an island unto himself. We all know this. Among the values that I am trying to teach my boys is that the world does not revolve around them. And sometimes they have to do things not because they are fun, but because they are important. I don't see the board's commitment to these values. The board needs to show some leadership and release school-level data, not district-level data regarding school absences. Parents can't make decisions based on COVID infections at the district level. This data is not protected, and if the board so much as drags its feet on this issue, we will obtain this information through open records requests and publish it on social media. You don't have the power to withhold this information from the community. And more importantly, the board needs to show some moral conviction, show some common sense, and require that all students and staff wear masks with no opt-out options and socially distance so that we can stem this mass illness.
I'm going to have to stop you. Thank you for coming tonight. Heather Glossop. And after that, Wendy Brindley, and then Cecily Fishman. If you'll state your name and county of residence, and you have 3 minutes to speak.
Thank you. I'm Heather Glossop, and I live in Knox County. Board members and KCS leadership, I want to thank you for your time. I know each of you are here because you have a heart for serving our community, and I can only imagine that yours is a hard seat to be in right now. Last year, you responded to crisis by implementing a multifaceted mitigation strategy that protected teachers and students. You did this even though statistically children were at less risk of contracting the virus. As we face the Delta variant and its exponentially increased spreadability, including to children too young for vaccination, you have chosen to pull back on the mitigation strategy. You have declined to act on your April 2021 vote to follow CDC guidelines in the future. We're sitting at a record number of active cases in Knox County schools with an incredible lack of transparency and leadership from you. You have not prepared our teachers to support quarantined students effectively. Contact tracing by the health department is grossly delayed, and you have not implemented a mask mandate. Please follow the guidelines of the doctors, nurses, scientists, and epidemiologists who have dedicated their careers to science, medicine, and public health. We are not and cannot all be experts in every field and industry, and therefore it's imperative to heed the advice of the people who are the experts. We have the resources and knowledge to implement the CDC guidelines as evidenced by our performance last year. Our school administrators and nurses, they know how to contact trace. Our community knows how to mask up, even if we don't like it. We know how to improve our data analytics and dashboards, how to social distance, and how to provide asynchronous learning. We know how to do better. We just need you to vote to do it. Knowing that it is most beneficial for children to be in school and understanding that we saw a decline in standardized testing results last year, we can reasonably infer that without mitigation tactics in place, we will continue to see increased absences, furthering learning loss and declining test scores. As a worried mom, I implore you to be transparent and honest. Add recovered cases and statistical breakdowns by school to the COVID dashboard. Implement a mask mandate. Even if parents opt their children out in accordance with the governor's EO 84, we will have more people masked than we currently do. Expedite contact tracing by handing it back to the schools, and implement virtual learning wherever and whenever needed. It's unfathomable that we would waste our learnings from 2020 and fail to use our technological resources. Friends, the children are watching us, so rather than admonishing experts and saying our hands are tied by this entity or that, let's teach the next generation to be compassionate leaders and to face challenge head-on with facts. Let's do our part to protect others.
Thank you. I'm going to have to stop you.
Thank
Appreciate
you.
it.
Thank you all so much.
Wendy Brindley, then Cecily Fishman, then Paige Brown, then Debbie Stafford. And if you'll state your name and county of residence, and you'll have 3 minutes to speak.
Good evening. I'm Wendy Brindley, resident of Knox County with 2 children in Knox County schools. I worked for the United States District Court for 9 years. I support public education. Right now, what you're dealing with is extremely challenging, so let me get to the point. Failure to enforce COVID-19 mitigation is counter to the mission of Knox County schools to address learning loss. We're in the 4th and worst wave of a pandemic. Your job as school officials is to reduce the risk to children and staff by following public health guidelines, whether you personally agree with it or not. The job of setting public health policy falls to public health officials, and they are loud and clear that business as normal right now is not safe for children or for our community. Your mission right now is twofold. 1, comply with public health measures to mitigate the risk to children and staff in public school buildings and on school buses. 2, provide access to public education that is equitable to all students, including those who require accommodations. Those tasks are not mutually exclusive because complying with public health measures is required to retain access to the ESSER funds from the American Rescue Act, which are allocated to provide a safe learning environment and address learning loss. Further, the record absences we have recently experienced directly correlate with the lack of mitigation efforts on the part of Knox County schools. Failure to enforce COVID-19 mitigation is not supportive of maintaining in-person learning. KCS should re-implement COVID-19 policy it had in place last school year immediately, and that policy must remain in effect until public health guidance, not a politician's tweet, directs otherwise, and until 6 weeks, not 3, 6 weeks after the vaccine is approved for ages 5 through 11 to allow this age group time to be fully vaccinated, should parents choose this for their child. The entire Board of Education, in your official capacity and as individuals, and Mr. Thomas, you all are legally obligated to comply with public health measures in school buildings and buses to ensure equal access to education for all Knox County students. This is another difficult year, but you all did a great job protecting our students last year. I believe you can do it again. Thank you.
Thank you. Cecily Fishman, and then Paige Brown, Debbie Stafford, Angel Jones, and then Dr. Overholt. Please state your name and county of residence, and you have 3 minutes to speak.
Hello. Good afternoon. My name is Cecily Fishman. I live in Knox County. I am a mother of 2 children who go to Knox County schools. I chose my specific neighborhood because of the schools that were in there. My husband and I had moved to Knoxville in 2015 and were very purposeful about where we decided to live. The elementary school we chose, we both looked at each other and said, this is where we want our children to go. I am Cecily Fishman. I am a mother of 2 children, and my husband is a brain cancer endurer. He is currently battling brain cancer. He is going through treatment on a regular basis. In 2020, during the pandemic, I purposefully kept my children at home. I kept them at home so that way I could see how the pandemic played out, understand what Knox County schools were doing to protect the children. During this time, I added stress to my life. I had a teacher come in who was afraid of teaching in the school systems last year and helped teach my children. The thing that could not make up for was the experience of going to school. It was a very hard decision for me to make to send my children to school this year. They blossomed within the first few days of being at school. It was remarkable. I am Cecily Fishman, a mother of 2 children who are vulnerable because they cannot be vaccinated, to a husband who's immunocompromised and cannot handle getting coronavirus. I am also a friend to neighbors, to other people in the Knoxville community who have babies and young children, and they too cannot protect them without this choice of pulling their children from school. At this point, it is my children's right to an education. It is their right to have an education from their elementary school that my husband and I decided to move to be near them and to be with them. I tell you this because the hardships of not having a masking policy, of not having contact tracing, means that after week 1, we found out through a friend that their child was exposed and had coronavirus, and I had to put my children and pull them from school, quarantine them. My husband had to go stay in a hotel. I had to endure these expenses. By the way, I'm also a full-time employee. I work full-time and had to take care of my children during quarantine while this happened. I come to you today to ask you to please protect those who are vulnerable in this community. Children are massive spreaders of coronavirus. They are impacting the immunocompromised. They are impacting people like me and the stress that I have to endure just to keep my family safe, to work, and to provide for them. And finally, in my last 4 seconds, please stop referencing HIPAA as a reason you cannot share the COVID dashboards. My formative years, I was also a privacy specialist, and I know that's false.
I'm sorry, I'm gonna have to stop you. Thank you. Thank you for coming. Paige Brown, then Debbie Stafford, then Angel Jones, then Dr. Overholt. Is Paige Brown here? If not, then Debbie Stafford.
Hi, everyone. Thank you for having me. I'm Debbie Stafford. Some people know me as Nurse Debbie. I'm here to tell you first and foremost that COVID is a treatable outpatient condition for almost all patients. The reason so many people here in East Tennessee end up hospitalized is the failure of our healthcare community as a whole to treat COVID. We are denying our community outpatient protocols. The outpatient protocols that I follow are from a Critical Care Alliance. I tell you some of the expertise of these people. One is an MD, Chief Division of Pulmonary and Critical Care Medicine, Eastern Virginia Medical School, an MD who is Pulmonary and Critical Care Specialist, an MD Professor of Medicine, University of Tennessee Health Science Center, Medical Doctor, Chief of Staff of Chief of Critical Care at the United Memorial Medical Center in Houston, Texas. These are not what some people want to call quacks. These are the cream of the crop. And they're telling you, and I'm telling you, COVID is largely a treatable condition. In this community, COVID is no more dangerous for children, and in fact is less dangerous based on the current statistics than RSV or influenza. RSV is normally a wintertime thing, but for some reason it hit this summer and it hit hard. We've had way more children hospitalized for RSV than we have COVID. Yet in the history of our school system, no one has ever made this kind of a deal over RSV. Influenza is more dangerous for children than COVID, but you've never seen these people carry on like this. People that were standing out on the street protesting for masks, I watched pull down their masks to move in close to talk to each other. This is not about severe, real concern. I do want to tell you all about a bona fide medical condition called mesophobia. It's a pathological condition, and it's a fear of germs. People with this condition may feel compelled to engage in excessive and ritualistic compulsions against contamination. Unfortunately, for these very tortured people, living life means sometimes encountering dirt, illness, or even pathogens. But for these people, this fear of coming into contact with any of these significantly interferes with their lives. People with mesophobia struggle to evaluate which situations are dangerous, and they feel worried or panicked when encountering daily scenarios which will always involve germs. They will take extensive measures to avoid contamination or decontaminate themselves in the spaces they inhabit, and they try to reflect those pathological fears on other people. It is vitally important when encountering people that have this medical condition that we extend love and patience while not engaging in this pathological behavior. Thank you to the 5 of you who have been loving, logical, and refuse to engage in this behavior. Thank you very much.
Thank you, Angel Jones. And then we'll have Dr. Overholt, April Tipton, and Helena Rago. Please state your name and county of residence, and you'll have 3 minutes to speak.
My name is Angel Jones, and I am a Knox County resident with 2 children in Knox County schools. We need mask mandates in schools to not help ourselves, but to help others. Masks have proven to be effective at reducing the spread of COVID-19. We need spaced seating to help, reduce the spread. We need to contact trace, so that way parents know and can be notified that their child was potentially exposed, so they know to get tested and to quarantine, which will help reduce the spread. I chose to send my kids back to school this year in person because of a policy passed by our school board in April that said that the school board would follow CDC guidelines. That policy has not been rescinded. I wanted my children to have some normalcy and some stability. Even though they are wearing masks, they wanted to see their friends and teachers. My children think masks can be bothersome from time to time, but they know masks help protect others, and they say it's another way they can also use to express themselves, and they wish that more students would wear them. My children have seen their fair share of tragedy. They have lost their father, their granny, their great-grandma, their great-pop-pop, and upon recently learning, I have a compromised immune system, and I don't know how I would react to COVID. Do you really want to put my children through another tragedy? Not to mention all of our students and staff and families that have compromised immune systems that we could lose to COVID. There are complications after having COVID that we don't know the full extent of yet. Do you want to take that risk with our children, especially with the Delta variant? I hear about learning loss and lower test scores, but what's happening with so many students out? How many teachers are we going to lose? And what's going to happen if we start to lose students? You can't legally drink and drive. There's a law about that. Seatbelts save lives, so there's laws made to help protect the public. Car seat laws are made to protect children. Speed limits, drinking age, driving age, etc. is all about safety of our communities. Your rights end where another's begin, and our children and teachers have a right to a safe and working environment. Because COVID has a long incubation period, people can be asymptomatic and spread it unknowingly by not wearing a mask. People do not have a right to spread COVID, knowingly or unknowingly. Laws and mandates are made to help protect people because people don't always know what's best. As a parent, I can say I've made my fair share of mistakes thinking I was doing what was best for my children. Parents make mistakes. We don't always know what is best. Masks aren't 100%, but it's about mitigating the risks. Last year, schools didn't close once for flu or strep, unlike the previous 5 years that we had children. My children have been in school. Plus, COVID numbers were lower. Mass contact tracing and space seating will help reduce the spread. I feel hopeless, and
Thank you. I'm going to have to stop you.
Please follow what you guys promised.
Thank you.
Thank you for your time.
Dr. Overholt, April Tipton, Helena Rago, Alistair Elliott. Thank you. If you'll please state your name and county of residence.
Virginia Overholt, Knox County, and thank you for this opportunity. I'm here to present to the board an alternative technology and treatment to help you eliminate COVID from our schools. The technology is based on hypochlorous acid, which is a product that's already in our white blood cells. It's what our white blood cells use to fight bacteria and viruses and kill them when they enter into the body. We have found a way to make that product stronger and better and to aerosolize it in a room through a humidifier. We have found with scientific studies and data that the aerosolization of hypochlorous will eliminate COVID-like viruses and other viruses, including flu, from the air, and it will do it safely. Safety is a huge issue here because people are going to be breathing this. We have acute studies that show no toxicity to lung or to other tissues. We have chronic scientific studies that show absolutely no injury to human cells that have been cultured outside the body and exposed to chronic exposure of hypochlorous. Totally safe, safe as air. What we would like to propose in this short time is that we work with Knox County Schools to outfit them with this system of hypochlorous aerosolization to help safely and effectively remove COVID virus from the air and from your system. We can do it safely, protect your schools, protect your teachers, protect your students, and do it safely. The technology is available. The decision is yours. Thank you.
Thank you very much. April Tipton. Is April Tipton here? Okay. Helena Rago, and after that we'll have Alistair Elliott and then Murray Clemston. Hi, just state your name and county of residence, and you'll have 3 minutes to speak.
My name is Helena Rago. I'm gonna move this back because it's really loud out there. My name is Helena Rago, and I'm a resident of the 4th District of Knox County. First, I want to acknowledge our amazing representatives. We know that you're under tremendous pressure, and we are here to thank you for supporting our rights as parents and our children's medical freedoms. We, the evident majority, ask you for your continued support in keeping the policies the way that they are. The board does not have the authority to institute a mask mandate, yet here we are again. Last time we were told it was because of Delta, and with references to the American Association of Pediatrics and overrun children's hospitals. Just last week, the vice president of the AAP stated that there's no evidence that the Delta variant is causing more severe disease. And East Tennessee Children's Hospital is now publishing weekly updates to provide truth and transparency to our community. But even with these numbers, it's not exclusively Knox County children. Our TCAP scores show us the effects of our district policies last year. To some in this room, it might be statistics, but that is my child that has always excelled, yet failed to meet the benchmarks last year. I spent 12 years building my children's immune system because the CDC explains that the immune system is the body's natural way of protecting itself from infection and disease. Taking care of yourself helps your immune system take care of you. And that active immunity is the result of exposure to a disease that triggers the immune system to produce antibodies, resulting in natural immunity that is long-lasting and sometimes lifelong. It's from the CDC in 2017. I don't support taking your vaccination card to now get 2 free donuts from Krispy Kreme, and I don't think that people who do support that should choose to have a say in my children's health care. To our representatives who believe that they do have a choice in the medical options of my children, we see you fundraising maskless, we see you instigating in Facebook groups, and we see the comments about your constituents. But every difference in opinion is not a difference in principle. We were told that this district would not tolerate harassment, yet we have parents screaming at cars outside of the schools and threatening violence at school board meetings. Our students are still being harassed and pressured by teachers and administrators and subjected to backhanded comments daily. Children get sick at the beginning of the school year every year, and every year we cancel school during flu season. Less than 1% of children are currently positive, and only 8 children in our region are in need of some extra support to recover with antibodies. Our children are virtually zero risk of COVID, a far less chance of severe illness and disease than RSV and the flu. Yet we are trying to rely on failed methods of mitigation and testing to prevent natural active immunity. We are done listening to those who have gotten it all along. Thank you for your time and dedication to our children.
Thank you for coming to speak. Alistair Elliott, then Murray Clemston, then Adina Clemston, and then Drew Kenmere. Please state your name and county of residence, and you have 3 minutes to speak.
I'm Alistair Elliott from Knox County. Did you skip over, I was following along, did we skip over one?
Somebody wasn't here. Somebody wasn't here.
Ms. Tipton was not here.
No, I didn't hear the name of Helena Rego, was that?
That's just who spoke. I'm sorry.
Okay,
Yeah,
sorry,
no, but,
missed her name.
no, I don't want to skip anybody. Yes, I'm sorry.
All right. Alistair Elliott, Knox County. I keep wondering how we've gotten here. I'm looking on Facebook, seeing these groups with parents contact tracing themselves. I'm seeing them scared, frustrated, and not because of a thin little mask that their kids have to wear. It's because these kids are getting sick. Everyone keeps saying, oh, it doesn't affect children. We have 11 kids in the hospital. 900 Friday had COVID. That's clearly affecting our kids. And I know the defense for kids being in the hospital is going to be, oh, well, they have pre-existing conditions. And they're still a part of our community. They are still children that we should be caring for and we should be concerned for. To dismiss it, it blows my mind that there are people dismissing it as, oh, pre-existing conditions. It's unacceptable. The other thing that I keep hearing about these kids in the hospital is, we have way more with RSV. You know, RSV is a respiratory illness, right? It's probably spread the same way as COVID. If you're concerned about RSV, I bet masks would help cover that too. Cut down the numbers some. Yeah, overall, I think this has been a real fun little experiment with our kids' lives and their families' lives. It's not going so well. 900 kids have COVID in our schools. Those kids are going home to their families, to their uncles, their grandparents, their brothers and sisters that may have pre-existing conditions. This is affecting the entire community. I know that the other thing is going to be this executive order. First of all, it goes against the Tennessee State Constitution and our state charter. Bill Lee does not have the authority to make policy for our schools. That's on you guys. All that they can do is fund our schools. If it was vice versa and he issued a mask mandate, I bet many of you up here would be like, he doesn't have the right. But now that he's saying parents should be able to opt out, we got to follow this tooth and nail. All of this is unacceptable. You guys need to start following the CDC, mask, the cleaning, do everything that it takes to cut down these cases for our children and this community. Thank you.
Thank you. Murray Clemston, and then we'll have Adina Clemston, and then Drew Kenmere. Please state your name and county of residence, and you have 3 minutes to speak.
Hello, my name is Murray Clemson. My wife and I was going to be here, but she can't be here, so I'm going to try to talk about what she wanted to talk about also. I'm from Knox County and Dogwood Elementary School. I have three kids, 11, 8, and 5, going to be 6. And he was going to be in kindergarten this year, but we just couldn't do it. We couldn't put our kids in the school one more year with just the lack of transparency and application of common sense in Dogwood Elementary. Now, I hear about considering putting masks back on kids in the schools. I just can't believe how ridiculous this is. If anybody does any research outside of CDC, Fauci's favorite, Bill Gates' favorite, you're going to know that the virus is very, very small. It's like trying to stop a baby with a chain link fence. So I'm really unhappy. I'd like my kids to go back to Dogwood. Caleb and Sarah, they're top of their class. Caleb's an ambassador, never got into trouble, perfect marks. But one of the things that is the straw that broke the camel's back is Miss Lana Lowe and, Renee Kelly.
Excuse me. We don't talk about individuals. You're just addressing the board in general, please.
Okay, well, I just wanted to let you know that I brought it up, that they're giving my kids sexually implicit videos, sexually implicit music, and I brought it up. I brought it up to I brought it up to the principal, and this is just something that needs to be addressed. And they don't consider my needing to know what they're teaching my kids a big deal. I'm called an extreme conservative. Well, thank you very much. I do care about what my kids are learning.
Okay, we need to stick to COVID protocols during this public forum, sir.
Yeah, so the point I'm trying to make is this lack of transparency, lack of application of common sense. When the virus is so small, there is no way that the mask is going to help them. Anybody that's really doing some research here is going to know this is what the experts are saying. Even the N95 mask will not stop the virus, period. So why are we doing it? Why are we putting the masks on the kids? It makes no sense. So I hope that people are going to do a little research outside the CDC and Bill Gates and George Soros funded organizations. Thank you.
Thank you. I think you said Adina Clemson is not coming. Is that correct?
Yes, she could
Okay. Drew Kenmere, and then Heather Carroll, and then Tina Shields, and then Emily McBee. Please state your name and county of residence, and you have 3 minutes to speak.
Good afternoon. Thank you for allowing me to be here. My name is Drew Kenmer, veteran, father of 3, and new resident to Knox County from Indianapolis. I will tell all the students that want their masks back on, parents that want their students' masks back on. I came from an area that reissued it just now, last week, and what happened next is they all went back into virtual learning. Virtual learning is a complete failure. I guarantee it is. I firsthand witnessed that last year. I'll preface this with between the ages of 0 and 17, the age range of, published on 8/26 by Knox County Health Department, out of a population of 97,000, there were 0 deaths among our young children. So I appreciate and respect all of your positions, but we have literature on both sides, and there's a lot of literature out there that masks do not work. What bothers me is I don't hear the propaganda machine out there calling, and our leaders informing us of the harm that these masks cause to our children. How about it weakens the immune system? Stack that with the death shots, and they want to mandate that next, by the way, too, and we'll have a perfect compromised immune system storm. The mask option must remain in place. It is 100% parents' decision, not the government, not the state, and not the school board, respectively. And stand your ground, school board, because the education secretary just was tasked with investigating Republican states that have banned mask mandates in schools. This includes Tennessee. The justification for this insidiously states that it is in order to determine if allowing mask freedom is a violation of students' right to a free public education. Listen carefully. They want to investigate our schools to determine whether allowing mask freedom is a violation of freedom. That's unbelievable, but it doesn't surprise me this day and age. I'm going to continue on real quick to the last study because I want to talk about how I think these masks harm our students and our children. It should be about the children. There's a doctor by the name of Margaret Risen, PhD, consultant neurologist. This is what she has to say about face masks and their effects on our brains. The re-inhalation of our exhaled air will without a doubt create oxygen deficiency and flooding of carbon dioxide. There are acute warning symptoms that are headaches, drowsiness, dizziness, issues in concentration, all those things my kids told me when they got home from wearing masks. Now picture your child wearing that mask all day long, and those of you parents that put 2 masks on them. I know firsthand when my sons describe these acute warning symptoms, when you have a chronic oxygen deprivation, all of those symptoms disappear because you get used to it. Your efficiency will remain impaired and the undersupply of oxygen in your brain continues to progress. While you're thinking that you have gotten used to wearing your mask and rebreathing your own exhaled toxic air, the degenerative processes in your brain are getting amplified as your oxygen deprivation continues. The second problem is that the nerve cells in your brains are unable to divide. Once they're gone, they're gone. Oxygen deficiency inhibits the development of the brain, and the damage that has taken place cannot be reversed. We don't need a clinical study to tell us that. Our children need oxygen to function, they need oxygen to learn, and they need oxygen to avoid damage to the brain.
Thank you. I'm going to have to stop you. Thank you for coming. Heather Carroll, then Tina Shields, then Emily McBee, and then Paula Hancock.
I'm back. That's a little humor for the board. Heather Carroll, Knox County. Albert Einstein famously said, the definition of insanity is doing the same thing over and over and expecting different results. How many times have the COVID protocols been a part of this board's agenda? When was the last time a board member walked the halls of the 94 schools in Knox County? Because if you did, I think you would see the majority of students and staff are not masked. Their parents are choosing to send their kids unmasked because you have left it as a parental choice, which is the right choice. Everyone has been affected by COVID in one way or another, and I do not diminish anyone's experience, but I am not here to speak from emotion or experience. I'm here to speak about facts, because facts don't change, and facts are not concerned with our feelings. In Shelby County, there's 121,000 students. They've had 17,508 positive COVID cases, comes out to 15.6%. Mask mandate. Davidson County, 84,654 students, 10,757 positive cases, 12.71%. Mask mandate. Knox County, 60,500 students. We've had, as of yesterday, 9,036 positive cases. That comes out to 14.9%. No mask mandate. If masks are so effective, why are our numbers paralleling with Davidson County and Shelby County? I understand those are bigger populations, but if masks are effective, there should be no cases, right? Last week, we had 8,150 positive cases. This week, we have 9,036 positive cases of the age group between 0 and 17 years, our school-age children. That has increased by 886. Yet our hospitalizations went down from 0.40 to 0.38. Higher cases, lower hospitalizations, mortality, 0. These are important numbers to remember when we're making decisions. According to the Tennessee Department of Health, there are 97,087 kids in Knox County. And of those 97,000, we've had 9,036 positive cases. There have been 34 hospitalizations, 0 death. What's more, if you look at the total cases in Knox County, according to our Department of Health, the highest age group that has the highest case count are our children, but they also have 0 mortality rate and the lowest hospitalization rate. Our kids will get sick, our kids will get COVID, but they will recover. According to Dr. Jordan Vaughn, who's a physician who specializes in internal medicine and was trained at UAB, who owns 6 locations in Birmingham and has personally treated over 70,000 patients in Birmingham for COVID. He went before the Board of Education in Birmingham and he said the following. Regarding masks, surprising to many but not to medical professionals, they have been researched and debated since the onset of modern disease theory. There is no reliable and controlled data in favor of masking to prevent respiratory pathogen spread from the past 100 years.
Thank you for coming. I'm going to have to stop you.
Okay, thank you.
Tina Shields, then Emily McBee, then Paula Hancock, then Laura Branson, then Sabrina Slade. Please state your name and county of residence, and you have 3 minutes to speak.
My name's Tina Shields. I'm a Knox County resident. I have 4 students in your schools, including one with special education and an IEP. The people in front of me have done a very good job hitting statistics and stuff, so I'm just going to hit a couple of points. First of all, anybody's fear does not give you the right to take away our rights, our liberties, and our freedoms. We are guaranteed those as Americans. And at this point, this is still America. They're working on it, but it's still America. The East Tennessee Children's Hospital numbers say that very few are needing hospitalization. They've even put out a video yesterday saying these kids are treatable. We're seeing them, lots of them, and we're sending them home to get well, which is what kids do. They get sick, they get treated, they get better. And COVID's here to stay, guys. It's not going anywhere. And I'm kind of surprised that anybody's surprised that this is happening. When you put masks on people, you hinder their ability to continue their own natural immunity. So now we take the masks off. What did you expect was going to happen? People are going to get a little bit sicker.
more often because their bodies aren't used to fighting. We've got to give our bodies the chance to be exposed to things so that they can fight, and the masks hurt that ability. People say you're not following the CDC guidelines. You are. The CDC says we recommend that you wear a mask, and I'm pretty positive that that's exactly what you have said. When you put in a mask mandate, you do not give half of the group, or more than a half the group, a choice. They have to wear a mask. When you allow it to be parental choice, the people who want to can wear one. If you don't think your one mask is effective, then wear two. Wear my kids. I don't care. Wear 100 masks. If you're really scared, do what happened last year when the essential workers were going to work and being exposed. They would come home and take a shower. Take a shower. Take a bath. Instead of bathing your kid at 8, bathe them at 4. Okay, if you have someone in your home that's immunocompromised, there are options for them to be able to deal with the things they're dealing with. If you put us in masks when we don't want to be, we have no choice. I found out yesterday that my son, who's in a special ed classroom, his teacher is begging for no masks. I did not realize this, but my son apparently did not speak hardly at all last year when he had the mask on. Now, when he wears it on his head, he'll talk. So he wears it on his head, pulling his ears up half the time. It's really funny, not real clean, and not real effective. But then again, masks don't work anyway, so what's the difference? But he's not getting the education that he's guaranteed when he can't see his teachers' mouths, can't see their expressions, and they can't understand what he's saying because he's either not talking or he sounds like he has a bag full of marbles in his mouth. I think it's ironic that people, oh, sorry, I'm out of time.
Thank you. I'm going to have to stop you.
Thank you very much. I know y'all have a hard decision.
Emily McBee. Please state your name and county of residence. You'll have 3 minutes to speak.
I'm Emily McBee. I'm from Knox County, and this is my first time speaking at the school board. I was born and raised here in Knox County. I went through the Knoxville public school system. I also graduated from the University of Tennessee, and I have been working at a local nonprofit serving low-income families. I'm also a foster parent for the children in our community. I'm a Tennessee volunteer. I did not need a mandate to wear a mask or stay home or get a vaccine. I volunteered, and because many others have not made those same commitments, the Delta variant is out of control. We all have a common goal at the root of this debate. We want safe, in-person learning. I'm not here to argue if masks work. The scientists, doctors, and public health officials all agree on this. I'm here to speak to my local school board about the situation in our public schools. Our children are getting sick. There are measures you can take to keep them well. We can't control what goes on outside of school, but we can use best practice in the schools to keep our kids safe. If you follow the science when you decide on curricula and when on creating other school policies, why not follow the experts on keeping them healthy? For weeks, children have been getting sick with COVID at our schools. They're taking this new variant of the virus home to their families, resulting in children not attending school, families making work, and some people having to go to the hospital. This is not sustainable. Our local hospitals are at capacity. There are more people hospitalized in our state than ever before. The National Guard has been called. This is an emergency requiring emergent action. Inaction is no longer an option. We need masks, social distancing, and contact tracing in our schools now. Your action can save lives in this community and keep our kids in school. Thank you for your time and your service.
Thank you. Paula Hancock, and then Laura Branson, Sabrina Slade, and then Kim Sprague. Please state your name and county of residence.
Paula Hancock, Knox County Education Association, Knox County. Today I want to share with you that educators know that they have a duty of care towards their students. And we as educators should always promote the welfare and safety of those students. We know that for students to learn and achieve their fullest potential, it is critical that they are in school and engaged in the learning process. We know based on research that student absences impact the student's ability to succeed, that absenteeism is a primary cause of low academic achievement. We know that our students benefit from in-person learning, and by law, Tennessee Code Annotated 49-5-1003, An educator is obligated to their students to make every reasonable effort to protect students from conditions harmful to learning or to health and safety. In times like these, educators are finding themselves in uniquely challenging positions with an extremely vulnerable population. So how long must educators be faced with record child hospitalizations, overwhelmed health departments, covering the classes of other educators during their planning time because of teacher and substitute shortages, collapsing classes that do not allow social distancing in classrooms, challenges of teaching both virtual and in-person simultaneously, which allows educators to be ineffective to two groups of students at the same time. Children coming to school sick anyway. Use of personal sick days for yourself and your school-aged children to isolate. Possible school district closings that can possibly use educators' much-needed fall and spring breaks. Educators are overwhelmed, overworked, exhausted, and exasperated beyond the pale. So how long? How long? It is my hope, not long, because the moral arc of the universe always points towards justice. We need moral justice for our students, educators, and education support professionals in times like these. In times like these, we are asking our Knox County School Board to take a stand and make every effort to protect our students from conditions that are harmful to learning or to health and safety. Every student, and I mean every student, deserves a great public school. We're asking that you vote yes to move forward on today's agenda items. We need the moral arc of the Knox County School Board to point towards justice for every student, educator, and education support professionals, health and safety in the school environment. Thank you, and I yield my time.
Thank you. Laura Branson, then Sabrina Slade, Kim Sprague, and then Hillary Godsey.
Before I start, I'm going to hand this letter to Renee to give to the board. I'd like to have it put on record that it was turned in to you guys. My name is Laura Branson, Knox County. Remember when you swore an oath upon taking office to uphold the constitutions of the state of Tennessee and the United States of America? Our constitutions protect our inalienable rights. We elect you and provide consent to you to protect those rights, rights that do not end where school property begins. Article 6, Section 2 of the U.S. Constitution is the Supremacy Clause, which states the Constitution is the supreme law of the land, and any state law, including Governor Lee's executive orders, your school policies, health department recommendations, and edicts that is repugnant to the Constitution is void. The Fifth Amendment of the U.S. Constitution requires due process of law to be part of any proceeding that denies a citizen of life, liberty, or property. The Ninth Amendment protects citizens' unenumerated rights. That is, we have additional fundamental rights protected from governmental infringement that exist alongside other fundamental rights specifically included in the first 8 amendments. The 14th Amendment provides that no state shall make or enforce any law abridging the privileges or immunities of citizens to the U.S., nor deprive any person of life, liberty, or property without due process law, nor deny any person within its jurisdiction the equal protection of the laws. If you act in an arbitrary manner, depriving citizens of rights protected by the 14th Amendment, your actions are void. You board members who vote for mask mandates in our schools are acting arbitrarily and punitively. We know this because only some Tennessee schools force children and teachers to wear masks. You have no authority to force children and teachers to wear masks. No governor, no union, no government education or health agency can vest you with the authority to force children and teachers to wear masks. If you believe you have this authority, please show us where, how, and when Tennessee citizens gave you public servants authority to force medical interventions on healthy children without parental consent. Explain how a school policy repugnant of the 4th, 5th, 9th, and 14th Amendments of the U.S. Constitution or Article 1, Section 3 of the Tennessee Constitution can deprive a child and parent of their rights. You are elected officials, and you cannot impose your personal beliefs onto school children or teachers. To do so is a violation of Article 1, Section 3 of the Tennessee Constitution and a violation of the Free Exercise Clause of the First Amendment, which embraces two concepts: freedom to believe and freedom to act. Believe what you wish, but you cannot force others to believe it, nor can you act on your beliefs in a way that violates others' rights. We do not elect you or pay you to push your personal agendas or beliefs. We elect you and pay you to uphold your oaths of office. Bullying, pressuring, coercing, bribing, and threatening students and staff to wear masks are violations of every school's bullying policies. Segregating mask wearers from non-mask wearers, isolating and punishing non-mask wearers, and signaling out non-masked students for contact tracing and quarantine while masked students are allowed to stay in school are punitive and discriminatory acts.
Thank you for coming. I'll have to stop you. Laura Branson. Oh, I'm sorry. Sabrina Slade. And after that is Kim Sprague, Hillary Godsey, and Matt Blackman. Is Kim Sprague here? I'm sorry, I'm Sabrina Slade. Is Sabrina, okay. We're gonna move forward. Kim Sprague. Is Kim Sprague here? Okay, Hillary Godsey. Is Hillary Godsey here? Okay, please state your name, county of residence, and you'll have 3 minutes to speak.
Okay, my name is Hillary Godsey. I'm from Knox County. I hope I'm going to be the quickest one tonight. I just want to point out, everybody that's come in here that's been scared of COVID and wanting to mask kids have come up to a podium that is not sanitized, taken their masks off, put them down, and put them back on their face. So just be careful, you might take something home. But pretty much I'm just here to say there's no legal leg to stand on. My daughter will never wear a mask again. And please continue to allow the parents their authority to do what's best for their children. Thanks.
Matt Blackman, and then Angie Gothert.
Good evening. That brevity was a welcome change, wasn't it? I'm sorry, I'm going to disappoint you. Matt Blackman, Knox County. On August the 11th, I came and I visited you, and I finished with this statement. Indoor masking is still the best tool we have to slow down to allow us to continue to be in school. It was true last year. It's true today. If you are serious about in-person schooling, you will allow the superintendent the ability to institute what he needs to do to allow us to stay in school. You know, I had said at the other end, within the next 3 to 4 weeks, and I'm repeating from last time, when the hospitals and the ICUs are full, but the schools are closed, you will remember tonight and missing the chance to make a different decision. The ICUs are full, about 70 beds left across the state as a couple of hours ago. Hospitals are full. The schools aren't closed yet, but it does not take a genius to know that there are discussions ongoing. I have no special knowledge, but when we have 20% absence, when we have students who can't be covered by teachers in classrooms, when we have combined classrooms, we are on an inevitable trajectory. So let me ask you the question, who should you listen to? When you require polio vaccines, you listen to the doctor. When you require educational standards, you listen to the educational doctors. When it comes to healthcare and informatics, you should listen to those who know what they're talking about. Many of the people who are YouTube watchers, online researchers, 18 months ago did not know how to spell mRNA, let alone understand it. Many of us have invested our lives in this material. We don't care about control, otherwise we wouldn't be scientists. I don't know many scientists who are in control. That's politicians, and I appreciate you guys. But what we do ask you to do is listen to those who have been correct. Are the ICUs full of people who are wearing masks? No. Are the ICUs full of people who have hypoxia from wearing masks? No, otherwise our surgeons, who've been masked for 70 years or so, would be dropping dead left and right. So what should you do? You were elected and tasked with leading us. Oh my goodness, am I glad I'm on this side of the podium, because I can talk about all the things I know and think is right. You guys have a difficult job. It's hard, I know that. However, we need decisive action. We need immediate action. I'm going to support you guys regardless. Why? Because you are my people. Will I like it? Probably not. But I encourage you, do the right thing. Thank you.
Thank you. Angie Gothert. Please state your name and county of residence, and you have 3 minutes to speak.
My name is Angie Gerthert, and I am a resident of Knox County. I had hoped that the next time that I spoke at public forum, it would be to make improvements to our schools, but that was not to be so. So here we are. I would like to thank Ms. Horn, Ms. Henderson, Ms. Bounds, Mr. McMillan, and Ms. Christie, who stood for parental choice. Parents should be able to choose what is right for their children, and I appreciate that you did that. In regards to the agenda items tonight, I would like to share what the children are saying. At our church last week, our student pastor invited our students to come to the altar and pray. As leaders, we walk around and make sure they don't need anything during this time. Many of them were repeating the same things. They never want to hear the word COVID ever again. And when will the adults see us? Our children are still waiting. For 3 weeks, things in our school were pretty close to normal. Things started to change when the 3-foot rule was introduced again, and as well as seating charts. We then started to hear from teachers throughout the district that principals were pressuring their teachers to wear masks again, strictly enforce the 3-foot rule. In that same time, we heard from parents of children that were coming home in tears, asking what they had done wrong, that their teachers were now wearing masks and yelling at them all day. Also, teachers that do not want to wear a mask, that fear for their jobs. What will they do if they hug their children? Again, the adults have forgotten about the children. The adults screaming about all of this want to saddle the lowest risk of severe illness or spreading the virus with the strictest restrictions, when all they want to do is just be children. They also say it's only for a little while. 2 years to us is nothing, but 2 years to a 6-year-old is almost half of their lifetime. While many other countries are confused by the way we're treating our children, as young as 2, here we are. Vaccines are readily available. We cannot allow the fear of the adults to crush our children. Thank you.
Thank you. Okay, we are now halfway through speakers. Do we need a break for 10 minutes, or y'all want to keep going? Keep going? Okay, we'll keep going. Okay, I just want to make sure nobody needed a break. Okay, Christine Parker, Felicia Outsey, Justin Arft, and Brad Horner. So is Christine Parker here? Please state your name and county of residence.
Hi, my name is Christine Parker, and I'm a Knox County resident. Members of the board, my sweet first grader, who has been wearing her mask to school every day to protect her classmates, contracted COVID her second week of school. At this moment, Knox County schools are no longer a safe learning environment. Your inaction is putting our entire community at risk, so now is the time to act and put into practice the CDC guidelines to keep our schools safe. We need speedy contact tracing, we need social distancing, we need sanitation, we need improved ventilation, and most of all, we need masks. What about the governor's executive order, you say? If we have to follow it and a parent wants to opt out their child of mask wearing, we can do what other Tennessee counties are doing. They should be required to quarantine their child anytime there is a positive case in that child's class, and if their child shows symptoms at school, they should be required to have their child tested. Freedom of choice does not mean freedom from responsibility. We are all responsible for the health of this community. Please listen to the doctors and nurses of our community. They are begging you to require masks. We are begging you to require masks. Please do what is right for our children and the community. Thank you for your time.
Thank you. Felicia Outsey, then Justin Arf, Brad Horner, and then Meredith Hayes. Is Felicia Outsey here? Okay. Justin Arft. Just say your name, county residence, and you have 3 minutes to speak.
Hi, I'm Justin Arft, and I live in Knox County. So good to see you all. I know you got a lot to do tonight. You got a hard job, so I'm just going to try to keep this simple. I don't know if I have a lot to add, but one thing I do want to talk about is contact tracing. Last week, a group on Facebook, you may have seen it, Knoxville Parents Against COVID. It was about a week ago they started this group, and within days there were close to 4,000, there might be more than 4,000 members. And the tone on this group was exasperation. Parents were scrambling to find out if their kids had been exposed to COVID, what to do if their kids had tested positive for COVID. Can they send them to school? Under what conditions? And I've been following this group pretty closely, and what I can tell you, kind of on behalf, what I'm sensing, is just there's a lot of confusion, there's a lot of frustration, and there's a lot of fear. I personally have no way to know if my kids have been exposed to COVID. I know the health department is doing contact tracing, but the system is overwhelmed. The system as it stands is broken. So I'm urging you all tonight to bring contact tracing back to the school level so that it can be fast, so it can be efficient, because we deserve to know whether we are at risk or not. Which leads to another point, which is I'm hearing a lot that kids are going to be okay. I know the statistics are in our favor. I'm pretty sure my kids would be okay if they got COVID. I don't know that for sure, though. Parents might not be okay. Aunts, uncles, grandparents might not be okay. My immunocompromised mother, who cannot move to Tennessee to enjoy her grandchildren now, will not be okay. Somebody I know recently, an acquaintance who's part of an organization I'm involved with, just found out the father is currently in the ICU on a vent. That child may not have known how or under what circumstances they were exposed to COVID. So I think that at minimum, we need to tonight talk about how to inform parents, how to be transparent, and how to let us know so that we can make good choices for our kids' health and safety. Beyond that, I'm just going to say the situation has changed dramatically. I think we can look at last year with mitigation, we can look at this year with no mitigation, and see the absolute clear difference. I think that's very hard to argue against. The numbers have gone up dramatically since school has started, and I think that we need a layered approach. I think that we need multiple ways to mitigate COVID, and I think it's absolutely undeniable that COVID is spreading quickly in our schools. And I'm hearing a couple voices. I'm hearing a voice that says, well, I'm not hearing it right now, collectively, hearing a voice that says, let this spread through the schools, kids will be okay. There's another voice, though, that thinks collectively and says, you have an obligation to protect everybody in the schools, and I leave you with that. Thank you.
Thank you. And I'm sorry we overlooked or somehow missed Sabrina Slade, so I'd like to call you now. And if you just say your name and county residence, and you have 3 minutes to speak.
All right. My name is Sabrina Slade, and I'm a Knox County resident, and I'm also a citizen of the United States of America. And this question that we're asking, mask or no mask, it's not that question. It's going to be the detrimental answer to that question. History repeats itself. I know you've heard that. It's not who's right or who's wrong. It's our choice of freedom. Brian Canas, one of our own, he fought for our freedom. If you want to wear a mask and cover your face, go to Afghanistan where they want our freedom. They want their girls to go to school. What's coming down next is the vaccination mandate. The Tennessee Health Commissioner, Ms.
Piercy, or I can't, and the CDC director, they stand firm on this, and this is a quote from the Washington Times. The COVID-19 situation in the U.S. is becoming a pandemic of the unvaccinated. Well, they're already selling the mask people out because it's not even about that. Behind the scenes here, there's already a coalition that's begun. And they're called the Compassion of Fatigue. And you know what they say? The vaccinated must now reckon with the feelings like they've already done everything they can and everything they are supposed to do to quell this pandemic, while seeing others squash their hard work and sacrifice by refusing the vaccine. Are we the land of the free? I pledge allegiance to the flag. Do you? Do you? That's Ryan's mother. My grandfather, World War II, frogman. This is how it goes. Mask, yes. Vaccine, yes. Females, no school. Then they separate. History repeats itself. And pardon me for the insensitivity. Genderism people at this school, you go based on your gender. Color people at this school. This has to be looked through a different lens, with eyes wide open. We have become so narrow-minded that we have forgotten the very blood of the people in this community in the United States of America who fought that we could have the freedom to choose not just a mask, everything. Once that is chipped away, where do we start? Because let me tell you.
Thank you. I'm going to have to stop you. Brad Horner, and then Meredith Hayes, and then Kathy Murphy, and then Lisa Taylor. If you'll just state your name, county of residence, and you'll have 3 minutes to speak.
Well, before I get started, I'd like to request an extension on my time to the original 5 minutes. This is my first time speaking, and I do have valid points that have not been made this evening.
We're not extending for anyone tonight, as far as I know, unless someone would like to make the motion. Okay, well, you have 3 minutes.
Brad Horner, Knox County. I have one kid in Knox County school system. First, I'd like to lead off with sharing my compassion with the families represented here by saying that mask or no mask, we've all been impacted by this virus in negative ways, be it financially, spiritually, emotionally, or grief over loved ones that we have lost because of this virus. We've all been impacted either directly or indirectly. My heart breaks for each of the families impacted by this, but we must not lose sight of our individual rights and freedoms that all parents and citizens have. We have to choose to set our feelings and emotions aside in order to approach this problem rationally and not forget to love and respect each other's differences along the way. Crisis shows character. Last Friday, I learned that my son's school, embedded within Sequoia Elementary Schools, implemented a mask policy for the children in their after-school program. Pursuant to the executive order number 84 by a governor, I let the director know that my son would not be masked. Since that day, I've been threatened to lose privileges utilizing their services. I've actually received a disciplinary action in the form of a write-up and hand-delivered to me by in the school's office for refusal to mask my child. It's completely absurd that children go to school without a mask all day, and a very small group of people are able to implement policy without any oversight that children must don a mask before they're able to go back to the cafeteria where they're unmasked just hours before. It's even more absurd that everyone I've talked to in a position of authority to intervene won't. Everyone that is aware of this should be embarrassed to allow a very small and private entity to have a very bigger voice and more power than all of you. And you should be ashamed to call yourselves a leader. If this is the first time you're hearing this, I hope that you're infuriated as I am that this has impacted families you're elected to serve. I had no problem looking into this myself. When the quick search, there actually is some recourse that you guys could take. To those taking the position of my hands are tied and sitting back and watching, you're allowing this entity to send an indirect message to our children that this aftercare program cares more about their health and safety than the parents, the school board, the principals, and their teachers. However, I'm no fool, nor will I stand in silence or be coerced by this board or contracted service providers now or in the future to comply with requirements or mandates infringing on my rights as a parent. Using this virus to justify abuse of power, overreach, and invasion of privacy ends right now. Hiding behind it's a private entity is a cop-out, and I will never accept that. Otherwise, when does it stop? I have a background in data science and analytics. I'm good at what I do because I ask a lot of questions. Here's an interesting piece of information that's available on the website, all to you. Taking the reported number of cases in the 0-17 age demographic, 9,036, and dividing it into the reported population of 97,080 students in that same demographic, only 9.3% of this group had contracted the virus. Knox County has been tracking these numbers for 18 months. So the rate in which the children under your purview are contracting the virus is only 2% of new cases each month. If you extrapolate that out, we've been having this conversation for 16 years, roughly. Be smart. The data is available. It's time to start making logical decisions with the information available to us and stop pretending it doesn't exist. What doesn't exist is a mortality rate amongst our children. It's literally killed nobody. No kids. Praise God. Masks were once a solution on the table, and now they're not. They simply
Thank you.
don't
I'm gonna
work.
have to
There are
stop
other
you.
solutions to this problem. Be the board that be's an example. Be a board
Meredith
that be's an
Hayes.
example. Thank you.
Then Kathy Murphy, then Lisa Taylor, then Margaret, I can't read. Margaret Nakora. Yes, if you'll just state your name and county of residence, and you'll have 3 minutes.
Meredith Hayes, Knox County, Tennessee. I've been to many school board meetings. I know many of you guys on a personal level throughout my years in Knox County. I'm usually known as the silent prayer warrior that's over in the room praying for every single person in this room, you know, for the things that are going to take place, the kids' lives that are going to be affected. I wasn't sure if I was going to speak tonight, but I decided that I have specifically been praying Psalm 46 for you guys, Ephesians 6:12, and 1 Peter 5:7, if you would like to know what I've been praying over you guys before we go forward in this meeting. I have a long history in the county. I've been a PTA president. I've held about every position you can hold on a PTA board, between secretary, school carnival chair. I'm a nurse. I've been a nurse for 22 years, 18 of those years in pediatrics. My mom was a Knox County teacher for 41 years. I say all this to say that I am passionate about children. I'm passionate about the care of children, and I'm passionate about every single child, just not one over here or one over there. As we go forward, I just would like to ask you guys to continue on the path that we are. Historically, every single thing we do in education, you have to have parents' permission. Go on a field trip, sign a permission slip. Any choice that they make, think about all the paperwork that comes home, with your kid at the beginning of the year. We allow parents a choice. We allow them to choose what is best for their child. Throughout all of that, historically, parents have been able to make that choice for them. I'm not going to quote statistics. I'm not going to quote studies, because there's studies on this side of things. There's studies on this side, other side of things. You guys know, because I know you look at the dashboards. I know you know what's going on in the county. I know you've surveyed what's going on in the schools. I'm just asking you to give parents a choice. I don't want to talk about wearing a mask, not wearing a mask, getting a shot, not getting a shot. That's not what this is about. Everyone needs to be able to make the choice that is best for them and for their child within the health system. I do have 3 children. My youngest is the only one that is still left in the school system. So I've been here a while, and I'm not going anywhere. I will always fight for kids. Still teaching. I work with youth at my church, and I've been involved, as I said, in some form of children's lives via healthcare or the outside world for the greater part of 25 years. So my platform tonight, I didn't really have anything prepared. I just wanted to ask you guys, I wanted to first of all thank you. I know that when you guys took this board position, you didn't really know what you were in for. and to be honest, you might not have if you'd known what this last year and a half was going to be like. So I thank you for your service. And I would really like to see us get back to a place of just loving people again. The great division in the community, that we have had, it absolutely breaks my heart. So how do we come together to really focus on our kids again and not discuss this again in a meeting? Thank you.
Thank you. Kathy Murphy, Lisa Taylor, Margaret Nakora, Noah Chitty, and Patty King. Please just state your name, county of residence, and you'll have 3 minutes to speak.
Kathy Murphy, Knox County. Thank you so much for letting the parents make the decision to mask or not mask their children. Your job is to educate our children. Parents' job is their children's health. Teachers do not need to spend the school year this year being mask monitors. They need to teach. Our children are lagging behind in their education. We do not want them to fall farther behind. Masks are harming our children mentally and physically Masks contain harmful amounts of bacteria, which children are constantly breathing in, and they constantly touch their masks. Children need to see smiles and to read lips to be able to communicate. There is no science on masking a child 8 hours a day. No benefit in reducing infection, no different in schools who've masked or unmasked. Our children are now being raised in fear. Fear of each other, fear of the world, fear of illnesses, viruses, even the air they breathe. They're being taught to fear everything. Prolonged fear is terror, and terror becomes trauma. The psychological damage being done is irreversible. Thank you.
Thank you very much. Lisa Taylor, then Margaret Nakora, then Noah Chitty, and then Patty King. Please state your name and county of residence. I'm sorry, is Lisa Taylor here? Okay. Margaret Nakora? Noah Chitty. Oh, I'm sorry, okay. State your name and county of residence.
Margaret Nakora. Sorry, Margaret Nakora, Knox County. I have 2 kids in Knox County schools. I'm not here to discuss the fact that the president and CEOs of all of the nation's children's hospitals signed an open letter saying, among other things, that masking should be in all schools. Nor am I here to talk about the fact that Tennessee may be sued for violating laws that protect students with disabilities by putting them in unsafe situations at schools. I'm here because I first want to agree with what some parents are saying. I also believe that we all know what is best for our children. What we don't know is what is best for the entire school population of Knox County, for each child with special needs like my own daughter, or serious medical issues also like my daughter. That should be left to the medical experts to decide, and they have spoken time and again saying the same thing, that masks help to stop the spread of COVID. This isn't a debate, it's not open for interpretation. The mandate would be there to help all staff and students, including those that may not be able to recover if they got infected, not just healthy students who would bounce back. To the parents that are fighting the mask mandate, I ask you this. If there is a peanut allergy in your child's class, do you abide by the no peanut rule to protect that vulnerable child? Or do you teach your child that they should do what they want to do, that they do not need to do all that they can to protect that child? No, because schools are communities. As it says on the signs lining the hallways of schools, you protect me, I protect you. As a mother of a child with severe special needs who would not recover well from COVID, I implore you to do everything you can to protect children like my daughter who cannot wear a mask. Thank you.
Thank you. Noah Chitty.
Thank you for giving me the opportunity to speak with you today. My name is Noah, and I'm the father of an 11-year-old in 6th grade in Knox County School System. I've come here today on behalf of my family and also to speak for a friend and fellow parent of 2 children in KCS, one with type 1 diabetes. I've come to speak in full support of the motion to require universal masking for all students, staff, and visitors, as well as for the motion of a school-based COVID dashboard. These proposals on the table are the only path I currently have to protect my child without removing her from KCS. It is unacceptable to me that I would be presented with either sending my child to school or pulling her out to protect her from danger, not when this board has the power to protect my child by voting yes on these 2 proposals. We're not allowed to smoke on airplanes and restaurants and in most confined spaces. Why? Because science and data showed us that secondhand smoke can harm others, and it became regulated that while I have the freedom to smoke, my personal freedom does not give me the right to negatively affect the health of others. Clearly, this is precedent that one person's personal rights and freedoms do not and should not ever supersede the health and safety of all. I'm imploring you, begging, pleading to you as board members, the Delta variant is an extremely infectious mutation of COVID that is infecting, harming, and killing all ages, including our children, in ways the earlier variants did not. When the science changed course and told us to do something different, it didn't lie to us, it just learned more. That's what science is. You have in your hands right now by voting affirmative on these 2 proposals to give some level of comfort to the tens of thousands of parents you are elected to represent. Alternatively, voting down these proposals comes with a very strong possibility of extremely sick and/or dying kids and teachers, shut down school, as well as mutations that none of us might be protected from. If we want to keep our kids in school in person, this is the way. There is no other way. Please don't pretend there is. 60,000 unmasked children in KCS schools with a highly contagious variant spreading rapidly is exactly the opposite of what it takes to keep our kids in school. Get community spread under control and stop our hospitals from being overwhelmed. If we all want to get back to some normalcy of life before COVID, KCS has to be a contributor to this fix, not a contributor to the problem. The number of students in the system is too large to not be a relevant factor and contributor to either the solution or the problem. All ages of people are currently getting sick. Hospitals are overwhelmed. You need to act tonight. Please make the decision to vote in support of the proposals for a universal mask mandate and a school-based dashboard. Be the hero to so many families that would like to go to bed tonight, knowing that this board took steps before it's too late to protect our kids. Thank you.
Thank you. Patty King.
Hi, I'm Patty King, Knox County resident. I'm here to speak against the mask mandate and every other mandate that is on this speaking today. I am an immune compromised person, okay? I've had COVID. I'm tired of hearing that people say that the immune compromised people are going to die. I didn't die. I didn't end up in the hospital, okay? I took precautions that I needed to take. I am a music instructor as well, as many of you know, okay? These students that had to wear masks last year, they hated it because they could not breathe. They couldn't understand the teachers in their class. It's time to end this debate and get back to teaching our kids. Thank you.
Thank you. I'm going to recommend that we take a 10-minute break, if that's okay with everybody. Thank you. Okay. We're adjourned for 10 minutes, and we'll come back at 7:10? Or what time is it really?
It's really 6:51.
Okay, how about we come back at 7:05?
Is that okay? So 10 minutes on that clock. It's really 7:05. Well.
Okay, I'm going to continue with the next few names. First, we have John Meal, then Chrissy Stevens, then Rebecca Reeves, and then Sherry Garrett. So is John Meal here? They might be talking too much out there. And the last name is M-E-L-E, so I'm not sure if I'm pronouncing it correctly. Okay, if you're here and just not hearing your name, please walk in and let them know. Chrissy Stevens. Please state your name, county of residence, and you'll get 3 minutes to speak.
Hi, my name is Chrissy Stevens. I'm a Christ follower, a wife, a mother of 3, and a Knox County resident. As I was preparing for tonight, it occurred to me that you've probably already heard it all. And you've already heard so many impassioned speeches, I'll keep this short. I'm simply going to thank the board members that respect medical freedom and that took a stand to support the rights of parents to choose for themselves how to best care for the health of their own children. My children will never be masked. We do not consent to contact tracing. And my husband and I do not co-parent with any governmental entity. Thank you for your time.
Thank you. John Meal.
Yes, my name is John Mealy. I have a granddaughter in 11th grade at West High School, and I'm mostly here to speak for her because I've been raising her since she was 5 years old. And I've heard a lot of talk here, 50-50, I guess, between mask or unmask, and I'm not here to give a scientific evaluation because you've heard a million, but we have these and we want to believe they're safe. I wish I could tell you they were. I can't tell you they're not. It's just the science isn't really good on either side, and you can hold this up and it's basically a mask without strings. And you put this over your face and it changes you. The minute you put this over your face, you don't talk properly, you don't communicate properly, and you don't even act properly. After a while, your arms aren't moving. I'm Italian descent, so they're always moving, but you stop that, and you start talking like this, and you talk less, and you talk little, and you do not communicate correctly. And that is what's happening in school. First, you had an idea that we'd keep everybody home. We tried it. Everybody tried the mask. Everybody's tried everything in the world. The science is out on it. There is no science. They're still figuring this thing out. All over the world, we've tried everything, every protocol, and this thing is still spreading. The children are being brought up in an element of fear. Total fear is all they hear. I've raised my granddaughter now, and I can't believe what her generation is going through. It makes me so upset. No child should have to be brought up in fear. You're supposed to bring your children up to face the world as much as they can. And in school, they need to have communication. They need to have a visual connection with their teacher so that they can talk, they can hear, and they can communicate properly. It's how we all communicate. Yes, some people are going to get sick from this, and some people are going to die, but that's what any sickness is, any pandemic is. The mask has become nothing than a mask of tyranny. And tyranny starts in small steps. That is something I learned a long time ago. It starts with a very small step. And the first step, in this case, is a mask when we know it doesn't work, when we know it doesn't. If people think that that it does work, that's their prerogative. You do have a good idea. Does not require a mandate. It requires agreement. It does not require force. When we all thought it was a good idea to wear a mask, I told my granddaughter to wear a mask. When I learned it didn't, I said, take it off. It smelled when she brought it home. You think these kids are keeping these things in their pocket and everything else. Let's be real about it. You are a school board. You are not a medical authority. In medical, your decision is how best to educate these children. You need to keep these schools open. The depression that these kids are suffering through is unbelievable.
Thank you.
I know you wish to stop me, but I will keep speaking, and that's why this hat is on, and I will speak until I'm done.
Sir, I'm going to have to stop you, please.
I don't care. I have a couple of words to say, and I will finish.
We are going to have to stop you, sir.
I understand that. Anyway,
sir,
start with a mandate.
Please stop.
Of mask. Yes, ma'am.
Rebecca Reeves, then Sherry Garrett, and then Jordan Kimmett, and then Christy Carter. Rebecca Reeves not here. Okay, Sherry Garrett. Please state your name and county of residence, and you have 3 minutes to speak.
Good evening. My name is Sherry Garrett. I live in Knox County. I'm not going to take up much of your time. You've heard all the statistics, all of the data. The simple fact is there is no authority here to require masking. It has already been determined by the law department. This country was founded on individual rights as a constitutional republic, not a democracy, as some may claim. Each parent has the right to determine what is right for their child. Let's try this. Let's make a policy that no one is allowed to wear a mask. No children, no teachers, no one. We can't do that. That would be wrong. That would take away the parental choice of those who choose to put their children in masks. But apparently, some of the members of the board think it's okay to take away the rights of parents who would choose not to mask their children. That's not okay. In this country, you do not take away the rights of some to protect the rights of others. And on this last note, I wanted to make one little comment. When you're looking at epidemiologists and specific experts, look at where they're getting their paychecks from. Follow the money. Thank you.
Thank you. Jordan Kimmett, and then Christy Carter, and then Jennifer Mendoza, and then Robbie Poteet. If you'll just state your name and county of residence, and you'll have 3 minutes to speak.
Hi, I'm Jordan Kimmett, and I'm a resident of Knox County. My name is Jordan Kimmett. I am a mother of a kindergartner in Knox County schools and a family nurse practitioner. Throughout the pandemic, I have been working at Duke University Medical Center in outpatient cardiology. Since my family moved to Knoxville in July, I continue to see patients via telemedicine. I'm here today to express my concern about the lack of measures to prevent the spread of COVID-19. My son is too young to be vaccinated. He is one of only 4 children in his class who wears a mask. He tells me his teachers do not wear masks indoors. Students sit close together in his classroom, and multiple classes eat together in the cafeteria at a time. I get regular emails telling me of cases at his school, but it's unclear to me if my son has been exposed. While I'm also anxious for things to return to normal, I believe the exponential rise of cases in our schools makes it impossible for us to safely continue as we are now. We are lucky that most children fully recover from COVID, and that long-term effects of the coronavirus are less common in children than adults. In my practice, I have seen patients who were previously healthy struggle with the after effects of COVID months after their initial illness. They've experienced palpitations, shortness of breath, lightheadedness, and brain fog. Some have had difficulty even walking down the hall. I want to shed light that even in patients who do not die from this virus, there can be long-term lingering effects that profoundly impact a person's quality of life. Masks, social distancing, improved ventilation, and timely contact tracing can help protect our children, teachers, and communities from these complications. I understand that implementing these measures is not easy, but it is necessary. I understand the discomfort and inconvenience of masks because I have worn them shift after shift in my clinic, but I wear them to protect my patients. Please protect our children. I believe that the best thing for our children is to attend school in person. The percentage of absences of both students and teachers in our county proves that in-person learning will not be possible without changing our current strategy. We need a plan in place to manage our current crisis. I urge you to honor the commitment you made on April 14th to follow guidance from the CDC and the State Health Department. Failing to do so is negligent and endangers our children, teachers, families, and our community at large. Thank you.
Thank you. Christy Carter, and then Jennifer Mendoza, Robbie Poteet, and Cynthia Finch.
Hi, my name is Christy Carter. I'm a Knox County resident. I'm a board-certified pediatrician in West Knoxville. I'm also a mom with young children in the Farragut schools. I've dedicated half my life to taking care of children, my own babies and yours, and tonight I want to speak on their behalf. Last fall, I was skeptical when Knox County Schools announced their pandemic response, but you rose to the challenge. The distancing, contact tracing, and masking measures were difficult, but they worked. Children were protected not only from COVID-19, but I also saw they didn't catch strep throat, common colds, the flu. I went 13 months without seeing a child diagnosed with the flu. Most who did become ill from coronavirus caught it at home or from their sports teams or community. Even young children adapted to masking beautifully. Sure, they wore them incorrectly, but somehow even poorly executed masking prevented illness and kept our children in school where they belonged. I think we can all agree Knox County students should be in class, in person, for as many days of the school year as possible. COVID really did go easy on our children last year, but this Delta variant doesn't play by those rules. It's twice as contagious, and it's infecting our children as never before. Less than a month into the school year, kids make up almost 40% of all new cases in Tennessee, with more daily cases in children than ever in this pandemic. Children under 12 are both too young to vaccinate and too young to qualify for life-saving monoclonal antibodies. Without the layer of protection community masking provides, these children are sitting ducks. Optional masking does not count here. With a virus this contagious, masks only protect against spread in our schools if everyone participates, if we all do our part in true volunteer spirit. Without masks in the classroom, attendance and instructional time will plummet. Standardized test scores will suffer still more. Extreme staff shortages will hinder day-to-day operations or worse, cause school closures. Are you excited about football season? Your best athletes could be on the bench for weeks after COVID-19 due to the risk of sudden cardiac death. We can't afford to lose another school year to this pandemic. We have allowed politics, social media, conflicting advice, and stubborn pride to cloud our decision-making, and it's catching up with us. But we are not at war with each other. We have a common adversary. There was a brief, shining moment last year when we all came together against this pandemic, when we each took pride in doing our part. That is the spirit in which I asked the board and this community to enact temporary universal masking in schools while the stakes are high. Let's put aside our differences and choose the hard thing to protect our most precious resource. It doesn't need to be forever, but it does need to be now.
Thank you. Jennifer Mendoza, and then Robbie Poteet. Please state your name and county of residence, and you'll have 3 minutes to speak.
Okay. Good evening. My name is Jennifer Mendoza, Knox County resident. I have an elementary age student in Knox County Schools. My comments tonight are regarding the proposed attendance revisions and COVID protocols. I have 4 main points. 1, right now, absences are one of the best indicators we have about the impact of COVID in our schools. To redefine absences at this point obfuscates the spread of COVID among our students unless KCS performs their own timely contact tracing and quarantines and reports those numbers along with the absences. We need to be transparent about what is happening. With over 15% of our student body missing school on a daily basis, we need to do more than just change the metric. Number 2, if our students are not physically in school or in a virtual classroom, they are not present for the day. They are completing makeup work. This work is important, but it is not a substitute for being in school. Having survived a year of virtual school with a then first grader, thanks to an amazing teacher, I can tell you that asynchronous learning or posting assignments online coupled with a phone call from the teacher is absolutely not the equivalent to being physically in a classroom or even to live virtual instruction and should not be counted as such. Elementary students cannot complete 6.5 hours of work by themselves and will fall quickly behind without instruction. This brings me to point number 3. Inflating our attendance data without actually teaching students will not help learning loss. Trying to make the situation look better than it is will not help students or teachers when it comes time for testing. You may say we have fewer options this year. Let's use the ones we have and fight for the ones we need. Quarantined kids need to have access to live virtual instruction. Push back against the state. Why can't we have live virtual instruction for quarantined students, or when classes, grades, or even schools have high number of COVID cases? Please stand up for us. We need our kids to stay healthy and safe, and we need them to learn. Virtual learning is better than nothing. And number 4, the most important point of them all, manipulating the data or simply changing what counts as attendance does nothing to address the root of the problem. We need to keep our kids healthy to keep them in school. We need COVID mitigation efforts, and we need them now. The public health measures we are advocating are not always popular, but they work. We need these measures to prevent more kids, teachers, and staff from becoming sick. We need to do our part to reduce community spread and not overwhelm the healthcare system. We owe it to our children, students, teachers, staff, bus drivers, families, healthcare workers, and community. Please do not change what is considered an absence unless you will be providing live virtual instruction and timely, detailed statistics on quarantines and absences. A phone call and a worksheet are not enough. Please do more than just track how many of our kids are becoming sick. Please help keep them healthy by going back to the COVID measures that worked last year. Thank you for your time.
Thank you. Robbie Poteet, and then Cynthia Finch, then William Wilson, and then Kevin Hill. Please state your name and county of residence, and you'll have 3 minutes.
Robbie Poteet, Knox County. On Monday after work, I did not know what to do. I just felt like sitting in a corner. I wanted to cry. You were told that masks can be opted out by the governor. Your commissioner of education says districts cannot close completely and go virtual. Legislators are threatening to pull our funding if they don't agree with our choices to keep our kids safe. Your local board voted months ago to follow CDC guidelines and all kinds of other things, and now we're not. Your district leadership is saying one thing to us. Across all of our schools, is it really happening effectively, consistently, or even at all? After work, I was thankful just to be home, inside the 4 walls that are my sanctuary. And I am thankful today that I am still healthy because I have worked tirelessly, wearing this 3-face face shield, wearing a microphone so my students can hear me. Yet, I still want to cry. No one is stepping up and taking the reins, no matter the percentage of deaths in kids, however low or high the stats are. Some parent or grandparent or aunt or uncle or brother or sister is going to lose a child. And that makes me want to cry. Why? Because Americans will not wear a mask and just simply look out for each other. We are too worried about politics and being on one side or another or taking a vaccine. It's our children, my kids, my children that I teach every day that we're talking about. It makes me want to cry. Kids and adults are dying, and they're going to continue dying, and I want to cry. When I go through my day, it is a fantasy. It is a farce. I know kids are getting sick. I know it's coming, and I try. I'm told to keep it normal. I'm told to keep going. Last year was not normal. This year is even harder because we are even more limited, and our hands are tied. We cannot keep going like this. We are caught in the middle for our kids and your kids, Knox County. We are caught in the middle, and I want to cry. There is nothing that I can do right now, not enough hours in the day to pray or to write or call. All I can do is protect my family, my 4 walls that is my sanctuary, to try and keep what is staring at us all boldly in the face. And I have family members that can be harmed severely, or even myself. I still want to cry. But parents, know this. Know that I am trying. Know that we are trying. We are trying to protect your children. No matter what is said here tonight or what is decided, we are still going to be there for your children, and we are going to fight for them. And I am here to fight for them and their safety. Your kids are my kids when they come in that building. And I'm just really sad at how we have behaved as adults, because children will listen and they learn from us. Thank you.
Thank you very much for coming to speak. Cynthia Finch. Okay, I think Ms. Finch had to leave early. William Wilson, and then Kevin Hill, and then Elias Atia. Please say your name and county of residence, and you'll have 3 minutes to speak.
My name is William Wilson. I live in Knox County, 37914. On August 9th, I wrote a letter asking you all to please ensure that you followed the CDC's protocols and keep our children safe. You failed. At that time, anyone who was paying attention could have seen what was coming. And some of you chose to listen to political pressure and conspiracy theories rather than science. You failed to protect our children. My son has autism. For him to get COVID would be much more dangerous. He cannot communicate. If his head hurts, he can't say, my head hurts, okay? Last year, we kept him home all year long, and we made a lot of sacrifices to do that. We lost work days, we lost time with family. The virtual school didn't work. It was worthless, basically. But we thought it was worth it to keep him safe, to keep our family safe, our immunocompromised family, and our community safe. These are sacrifices that we made to keep everybody safe. We don't have the means to send him to private school. We can't keep him home, and the virtual schooling isn't working. We had to send him back to school this year. We kind of hoped that somebody would make a responsible, intelligent decision about keeping our kids safe. Yesterday, my son tested positive for COVID, and I can't really express to you how I feel, like fully. I can't really say it. But I do blame you all for your failure and your cowardice for not listening to science. It's science. There's a loud vocal minority, and you chose to bow to them instead of science. Your job is to protect children. Your job is to ensure a free and fair public education for everyone, including those who can't advocate for themselves or who can't make decisions for themselves, who need accommodations, all right? You have failed. Not all of you. Some of you did the right thing no matter what, and I thank you for that. But I just want y'all to know I do blame those of you who stalled and voted against measures to protect our children, and those of you who haven't done anything. And I will be holding you accountable. You think that this loud vocal minority of people who's been coming to every school board meeting is the majority? You're wrong. All these parents thought you were keeping their kids safe, and they're now finding out that you all are a bunch of incompetents. And they're going to be coming. So if you're politically worried about your future, maybe you should think about passing some safety measures in schools and stop listening to arguments. You know, I drank and drive as a teenager. I survived. Everyone should be able to drink and drive, right?
Thank you for coming to speak.
This
I
shit is
appreciate it.
ridiculous.
Kevin Hill, then Elias Atia, and then Gordon Gibson.
Since we had someone from a COVID-positive home just come speak to us. Kevin Hill, Knox County. Regarding the issue of masks, has this board considered the differences in quality of the various studies on mask efficacy and how that should impact the KCS policies? Allow me to explain why I asked this question. Scientific knowledge is information, because we keep hearing science, 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 of understanding that we acquire from engaging in the scientific method. In the pursuit of this method, there is a hierarchy of evidence. In the hierarchy of evidence, there are 3 tiers of quality. The lowest quality of evidence is observational studies. The next highest quality of evidence is experimental research, such as randomized controlled trials. The top quality and gold standard of evidence are research reviews where they analyze across multiple random controlled trials. So when people begin throwing studies around, we must first stop and confirm of what quality those studies are to know the strength of one study as compared to another. As of to date, the top tier evidence all suggests masks are ineffective. As the evidence that suggests masks are effective all comes from the body of evidence called observational studies at the bottom. One of the reasons these studies are of the lowest quality of evidence is because these studies are the most subjective and most easily manipulated and corrupted in terms of viewpoint. Why are members of this board and people with degrees and higher training coming before you and not acknowledging that? It's because they are being driven by an agenda. The reality implies an agenda that is not health or science, but instead control. The members may be themselves manipulated into these positions, but that changes nothing. A person promoting a conclusion based on evidence of lower quality in the face of higher quality evidence is not engaged in scientific reasoning, but dogmatic reasoning. A new religion has been born in America. Spreading fear and wearing masks are the sacramental expressions of this religious dogma. Well, if I can't, nor should I, require your child to say a prayer in the name of Jesus Christ and take the Lord's Supper at school, then you should keep your dogma of fear and masks away from other people's children too. You are free to practice your religion of fear in your home, and your children are free to practice as they choose at school, so long as the proselytizing that religion does not become policy of the schools or violate anyone's right to not be subjected to this new religion of fear. Thank you.
Thank you, Elias Attia. Elias Attia. Please state your name and county residence, and you have 3 minutes to speak.
It's Elias Attia,
I'm sorry.
Knox County, sorry. Members of the board, I'm a proud UT graduate student at the College of Social Work, and I work with the College of Public Health. I begin by bringing up something now distant, but at the time was also a point of calamity. In August 2019, a single Knox County student became ill after vaping. He ended up being okay. But in January 2020, KCS implemented a zero-tolerance policy with a 180-day suspension and a fine for any student caught with e-cigarettes. Later, it would be posted on the website that across the nation, 2,300 illnesses have been attributed to vaping. This was alarming, yet meanwhile, across the nation, that crisis now pales in comparison. Despite the massive disruption from COVID-19, we've decided that a simple safeguard, masks, are a personal choice. This has led to parallel rhetorical questions like, should doctors or nurses have a personal choice to treat an unvaccinated patients in their critical care? Of course not. That would be unethical. And despite personal frustration, the reason why they should do everything in their care to treat these patients goes beyond their personal values and into their professional code of ethics. Alternatively, it has been supposedly clear-cut that for decades, the personal choice for students to wear what they wish, be it spaghetti straps or sagging pants or short skirts, has been punished in schools to prevent distracting learning environments. Yet nothing has been more distracting and disrupting than the number of classrooms with 6 students and staff in the last few weeks of school starting. Considering the parents and guardians making accommodations, the many who rely on schools for social services, or the school staff themselves, who cannot afford to take time off of work, this disruption to our school system goes beyond our personal attitude. Since transparency is a key to tonight's discussion, I want to bring attention to how schools have a professional code of ethics to protect our communities from any personal attitudes. And in the case of masking, seemingly political polarization that endangers the health and safety of the classroom environments. I also preface in that we need to humanize what's going on. To come to alarming portrayals in media, we've abandoned our ability to form relationships and stop trusting each other. I won't speculate why. People are infinitely complex, yet we let our personal beliefs get in the way of making large decisions. And virus or not, this is truly devastating. When we take off our masks, we realize the complexities of choice, liberty, human dignity, and public safety is more than just my right or his. And yet it is so easy to say no to masks. It is just as easy to say yes. But the complexities of consequences beyond today of these two seemingly simple decisions could be incomprehensible for the larger community. So, members of the board, I thank you for listening, and I urge you to consider our schools as they continue to struggle to maintain
I'm sorry, I'm going to have to stop you. Thank you.
Thank you.
Gordon Gibson, then Harvey Whitehead, then Meredith Reddington, and then Neil Schwartz. Is Gordon Gibson here?
I am Gordon Gibson, Knox County resident. Thank you for holding this meeting and considering proposals this evening. I've heard a great deal about individual rights. I do want to remind everybody, I have a right to swing my arms around. That right ends where your jaw begins. So let's concentrate on the community standards that are important here. I'll try to keep it very brief. Masks and social distancing work. Remember how awful the flu season was? Last year, there was virtually no flu season because we wore masks and social distanced. Masks are safe. We've heard some tonight about masks being dangerous. They cut off breathing and so on. Medical people wear masks, well, in the pandemic, been hearing about 10, 12-hour days masked. It hasn't made them incompetent. And so, in order that Knox Community Schools aren't the epicenter for COVID in this county, and so that there isn't further learning loss beyond what happened last year and prior, let's implement masking again. Let's do contact tracing to nip infections. Let's keep me safe, because a COVID infection that starts in the school spreads to the community. I would like to be safe. So, yes to an improved dashboard. You'll be talking about that. Item 8, yes to required masking. Number 9, and yes, please, to contact tracing. Number 11. Thank you. I wish you well.
Thank you. Harvey Whitehead, then Meredith Reddington, then Neil Schwartz, and then Rob Malcha. Please state your name and county of residence, and you'll have 3 minutes to speak.
I am Harvey Whitehead. I'm a resident of Knox County, and I'm just going to be winging it. I'll be brief, but for those of you who are still awake, I appreciate your service. I wouldn't want to be in the roles you guys are in, and I could argue either side of this that's before the board tonight. But for the record, I'm 63 years of age. I helped raise 3 kids. I have grandkids. Most of them live in Knox County. And I'm a Liberty guy, a big-time Liberty guy, but I'm not going to make my 3 minutes here about that. I'm just going to try to talk about reality. You've heard statistics on both sides of the aisle tonight. It's become a political issue, sadly. I mean, it is a political issue, whether we want it to be or not, and that's unfortunate, but it is. But I would just submit that I'm going to speak from my own personal experiences. I am not a medical professional, but there are medical professionals in my family, and some with many years in that industry. And they recognize COVID to be a real malady, and I believe it to be. I believe people get sick from COVID. I believe they die. I believe the flu makes people sick and people die. I believe car accidents kill people, plane crashes kill people. We live every day with all kinds of risks. Every time we get out of bed, we assume the risks of living today. It's just what we do. We can get off the life train anytime we want, but most of us want to keep living. So we assume risks, and we live with those risks. As far as my own personal experiences with COVID, I don't have any. I don't know anyone who's died of COVID. I've known a few people who got sick with COVID, but they recovered. But I would submit to you, regarding the question that's before you tonight, I'm more interested in addressing the social costs of the distancing and the mask mandates and whatever, there's a huge cost to the mitigation practices that many school systems and governmental bodies have put in place to protect us from COVID. And I get that there are vulnerable ones among us, mostly the elderly, and we want to protect them if we can. But we don't just stop living to protect a small, vulnerable portion of our society, or at least in my judgment, there's no wisdom in that. I'm confident in the years to come, when all the costs of the COVID response are added up, they will be monstrous. The lost marriages, families, the depression, the alcohol abuse, suicide, it's all in the news. You don't have to look hard to know that there's a huge cost to distancing and masks, and you have to be vaxxed, and you don't have to be. There's a huge emotional cost to society and a financial cost to our future generations, trillions of dollars in spending, because we mandated businesses closed, people who...
Thank you, I'm gonna have to stop you.
Thank you very much.
Appreciate it. Meredith Reddington. Please state your name and county of residence, and you'll have 3 minutes to speak.
Hi, I'm Dr. Meredith Reddington. I'm from Knox County. I'm an emergency medicine physician, and I'm mother to 2 young children. Our county and our state has rapidly increasing numbers of COVID infections and hospitalizations. Hospitals in our area are already under significant strain. Several hospitals have called in the National Guard for support because we are so overwhelmed and so understaffed. We need everyone's help to slow down this virus, so I'm here to request that you consider a temporary mask mandate for the Knox County schools. Imagine yourself sitting in a hospital waiting room with your spouse or with your child. Maybe they're in pain, maybe they have a fever, maybe they can't breathe. If your family member is not the sickest person in that waiting room, they may wait for hours to get back to be seen and treated. Some people are currently waiting 8 to 10 hours in the emergency department waiting room to get back and be seen and treated. Our hospitals are full. Now, it's not all COVID. People are still having heart attacks and strokes. They're still having car accidents and appendicitis. But the rapid rise of COVID patients has pushed us to the edge. I recently took care of a young man who had been in an accident and was bleeding from his head and his arms. I evaluated him in the hallway in a wheelchair because there wasn't anywhere else to do it. His father asked me if there wasn't a better place for me to take care of his son. And I had to tell him, no, I'm sorry, there isn't. It's hypocritical to say that we want kids to be in school, but take away all the layers of protection that will help to keep them there. There is no evidence that masks are harmful to children. Few children have medical conditions that prevent them from being able to wear a mask, and those children should be offered exemptions. Some of you may have heard that a fabric mask doesn't do any good because the SARS-CoV virus is too small. The virus is incredibly small, but viruses travel on tiny drops of water that come out of your nose and mouth when you breathe, speak, sneeze, or cough. Masks are most effective at preventing spread of a virus when the infected person is wearing one. This is called source control. Universal masking is so important because it helps to stop the spread before a person even starts to show symptoms. Yesterday in the state of Tennessee, there were 79 children hospitalized, 16 in the ICU, and 9 on ventilators, all due to COVID-19. While the risk of hospitalization and death in children is very low, there are still 200,000 new cases of COVID among pediatrics last week in the United States. That means we can expect about 2,000 children to require hospitalization. During this pandemic, we have hospitalized mothers and daughters, husbands and wives. Even if you are able to overlook the personal medical risk to children, how are you going to console a child who is now an orphan because both of their parents died?
I'm sorry, I'm gonna have to stop you. Thank you for coming.
That they brought home from school.
Neil Schwartz. Please state your name and county of residence, and you'll have 3 minutes to speak.
My name is Neil Schurtz, Knox County resident.
My family and I moved here from Washington State in July. One of the reasons why we moved here was because of the decisions that the school board made. And we thank you for that. So I'm a professional engineer. I work in construction, and I've got 2 kids that go to the district. And the question I want to ask the board is, where's industrial hygiene in this discussion? Where's OSHA? Because Title 21 CFR is Food and Drug Code. That's the code that the emergency use authorizations are under, okay? When it comes to respiratory protection devices, those are defined under 42 CFR, Public Health. On top of that, 29 CFR are OSHA standards for airborne, bloodborne pathogens, contaminants in the air. So we talk about science. If you have a airborne pathogen, assume like a virus, right? You know, the anatomy of sneezing consists of solids, liquids, and gas simultaneously. It's therefore reasonable to characterize the anatomy of breathing to be very similar, maybe less solids. We know that the primary liquid from sneezing, coughing, and breathing is saliva. The human body uses plasma as a basis for saliva. Through years of worldwide research, we know that saliva can contain blood cells and even the HIV virus. So let's say someone sneezes, coughs, or breathes, and COVID logic tells us that COVID must be in the air. And what is that assumption making? That assumption is that we are in cohabitated environments, everyday workers, students, general public, that are characterized to be equivalent with surgical operating rooms where there are biohazards present. Tell me where in 42 CFR Public Health does it allow for a 8-hour continuous use of a mask? Okay? There's special procedures that have to be done when, and all the health professionals know this. They're required by 29 CFR to know and comply with all the entry and exit procedures. They're also supposed to be advised of the potential hazards, okay? Before they dispose of all the waste, they have to either incinerate it or decontaminate it with methods such as autoclaving. Autoclaving is when you stick something in an oven and you heat it up for a long time so you can reuse it again. We're not employing or implementing any of those when it comes to public health. But we're listening to the FDA make recommendations and use whatever language they want to put in their EUAs to guide our public health policy. Well, just looking at the title of 21 CFR,
Thank you. I'm going to have to stop
they're
you.
not in their, they're not swimming
Thank
in their
you for
lane.
coming.
So just think about those things, please.
Excuse me, Rob Malcha, and then Dominique Oakley, then Ann Barber, and then Glenn Stafford. Is Rob Malcha here? Okay, thank you. Dominique Oakley?
Yes, I am Dominique Oakley. I am from Knox County. Good evening, members of the board. My name is Dominique Oakley. I live in District 7. I am both a parent of children in the public school system and an educator. I am concerned about the lack of transparency regarding COVID in our schools, as it has proven itself to be a deadly disease that does not care what school district your child lives in or political party that you vote for. The death of even one child is too many. I say this as a parent who has lost a child. Many parents, myself included, are concerned about the opportunity that you as the board have to protect our children and dedicated staff. Tonight, I want to give a voice to a parent who cannot speak for himself, Dr. Eric Moore, who is unable to be here because he is quarantining, having been exposed to COVID by his daughter, whose only possible point of exposure was Grisham Middle School. Dr. Moore is a parent to 7 children. I now quote Dr. Moore. Knox County schools have continued to fail to follow the guidelines as set forth by the CDC, the American Association of Pediatrics, and the Knox County Board of Health. This continued failure to respond to those calls from people who know much better than us is a dereliction of duty. Let me be clear, members of the board, superintendent, members of the central office, governor, and state representatives, none of you are qualified to make health decisions for our children. That is not an insult. It is a recognition of the fact that you do not hold medical degrees and are neither scientists nor health experts. You are, however, critical members of our school district, and we need you to lead. Leadership in this case would be listening to those who are knowledgeable about school safety and doing the hard work of making those guidelines a reality in our schools. Passing the buck among other school leaders and worse, to parents, is not leadership. It is a failure to lead in a time of crisis. I'm not calling for mask mandates or any such measures. Rather, I'm calling for you to go back to your wise commitment that you made on April 14th, to follow the guidelines set forth by the local Board of Health. In addition to your commitment to follow Board of Health guidelines in our schools, which currently include universal masking, advanced cleaning, and transparent contact tracing and reporting, we call for you to make a plan for teachers and children who must be out due to COVID illness or exposure, and for potential short-term closure of schools or even conversion to a virtual option if needed during times of extreme spread. In doing so, you have several models to follow from school boards in surrounding counties. As a parent of children in Knox County schools, I want to see that you have a plan for the sake of our community, our wonderful teachers, school administrators, and staff, as well as our children. Thank you. Those are the words of Dr. Moore. I respectfully yield my time to the chair.
Thank you. Ann Barber. Is Ann Barber here? Glenn Stafford. Please state your name and county of residence, and you'll have 3 minutes to speak.
My name is Glenn Stafford. I live in Knoxville, Tennessee, and congratulations, you made it to the end. So, the downside of being the last one to speak is I've had 30 people use my material ahead of me. So, of course, this is about as useful as some of those masks you guys are wearing. I don't have any kids in the school system. God didn't see fit to award me any. So, but he did guide my hand into opening a medical practice. Some people, you recognize me, you've seen me before, but don't know who I am. I am Mr. Nurse Debbie. I am the other half of Nurse Debbie's Health and Wellness. So we opened up a practice where we can actually take care of people. Not talk about it, not pass mandates, not make them wear a mask, but take care of people. We do that, we do it with health, we do it with wellness. It's in the name of the business. Okay? These masks, you're forcing things on people. Why do we force anything on anyone? We shouldn't be. We're Americans, we're volunteers here in Tennessee, right? Why are we forcing things? I've heard people bring up the argument about seatbelts. Yeah, you know what? I know there's a law about seatbelts. And as much as I love and respect Sheriff Spangler, he does not ride with me on a daily basis to make sure I wear one. I do so by my own accord. I've heard EMTs, first responders, law enforcement agents tell me some of the gruesome deaths that were caused by people who were actually wearing seatbelts. Now, that doesn't happen to everybody that gets in an accident. Usually a fender bender saves you from hitting your head on the steering wheel, great. But you know what? Even seatbelts can kill people. So it's supposed to be, you know, a protective measure. I understand that. Masks are supposed to be a protective measure. But they don't all work. They don't work for everybody. They're not going to work for me. I've got a breathing problem. I can't wear a mask. Just like the vaccination, I'm not taking that. I've got a factor 5 blood clotting factor. I'm not taking any vaccination. If you come at me with a shot, I'm going to give you one of my own. I don't think there's anything else I could say that you haven't already heard. I'm sorry, you guys. I'm not going to be crying. I'm not going to be yelling at you. I'm not going to be submitting you to anything else. You guys have a great evening.
Thank you. That concludes public forum.
Thank you, Ms. Babb. And now we will turn to Mr. Superintendent for the superintendent's report. Mr. Thomas.
Okay. Thank you, Madam Chair. First of all, I'd like to just take a moment to recognize the significant efforts of our teachers and all our staff who continue to work hard for our students. Today marks the 18th day of the school year, and I know they've all been given their all, actually, to educate our students and try to make up lost ground caused by COVID. While we're currently experiencing higher absences, I'd like to acknowledge that nearly 50,000 of our students are receiving important in-person instruction. And my report this evening is based in part on a request from Board Member Daniel Watson, and I'm not sure we've captured everything that Mr. Watson wanted us to capture, but we've tried to do our best given the time that we have. So Mr. Watson asked us to share some comparative student and staff attendance data that's available from 2 years prior and this current year. We actually sent this information to you this afternoon. I think we were working on it pretty much nonstop today. So just in looking at 21-22 school year, 2021, and then 19 and 20 school year. So if you look at the chart, certainly you can see that the staff, that our attendance is down, our staff rate attendance is down. So if you looked at 19, 20, 96%, 20 and 21, 96.2%, and then 21, 22, 93.8%. Now that represents one 20-day period actually. So, and we're not quite through with 20-day period. I think it ends this Friday. So, we can fill in that chart as we go with the 20-day attendance period. So just looking at that just gives you a snapshot on staff attendance and what that's been over the last 3 years and up to date for where we are this year. And there are several factors in looking at that information that's take that into consideration. You'll see that those notes that are in the section there, it includes counting last year's isolated quarantine teachers present when they could provide virtual instruction from home, or isolated quarantine students who were counted present due to the availability of synchronous and asynchronous instruction. So again, I don't know any questions about that. Also on that slide, and again, you've got this information, we've sent it to you, also some additional data with student attendance rate for the first 17 days at the bottom of that chart. And again, it's 17 days, obviously not 20 days, and not counting today, which is the 18th day. This shows that our attendance rate is lower than the first 2 years, and as is typically the case, attendance at the school at the start of school is high, but over time you see more absences, and yesterday's attendance was up slightly more than the day before. So just to give you a snapshot look at that. Along with the information that Mr. Watson requested, we wanted to provide you with some additional data, and Mr. Watson didn't ask for this, but we thought it was pertinent. First is the student attendance rate for the first 17 instructional days shows that our attendance is lower than the first 2 years, obviously. Again, start of school, the attendance is usually higher, but yesterday attendance was up slightly more than the day before, so we'll be looking at what happened today in comparison to the chart that you're looking at. Okay. See, for staff attendance, the same period looks very similar with attendance down from the previous 2 years, but up slightly over the day before. Okay, then we looked at one more chart, just looking at absence numbers over the last 5 days in terms of percentages. You'll see that absences directly related to active cases range from 6.2% to 8.7% for students and 11.7% to 17% for staff. And you can also see the percentage of absences that not related to active cases, which represents the majority of absences. Okay, and then staff absence is similar, with the majority of absences being outside of COVID-related illnesses. Any questions? I know Mr. Oakes, if it's student attendance, can speak, probably address the questions. Mr. McPherson on staff attendance data, so.
Mr. Watson.
Thank you, Madam Chair. Thank you, Superintendent. I really appreciate all the work that went into pulling together the charts and also the extra information. I want to make sure that I heard one thing correctly. On the, it's not up right now, but on the staff, or on the, sorry, on the student data, for last year, those who would have been virtual would be counted present in that graph. Is that correct?
Right, that's correct.
Okay. And that's also true then of the staff graph as well, that if they're teaching virtual, then that would be represented as well?
Yes, sir.
Okay, thank you. One of the questions that I've gotten a lot, and I don't know the answer to it, is folks have asked, and I know there's a lot of factors that go into this, but in general, when we make a decision to close schools relative to flu, what attendance rate would that typically be at? And again, I know there's other factors, but that's one of the questions that I've been asked a ton.
Again, it would typically be higher than what's reflected right here. But again, when we close schools for flu, we would use inclement weather days, staff development days, things of that nature, which certainly we could use inclement weather days now.
Right.
That's a possibility. We have 10 inclement weather days. In terms of what the state will allow, and the commissioner talked with us the other day about this, they will, there's a waiver process, but she really indicated that process, there'd be no possible way you have school in order to get one of those waivers. So it really sounds like it's going to be a difficult process. I know a few of the systems that have closed, I think, have begun to use some of their inclement weather days. And but typically, percentage-wise, Mr. Bolton, too, you can probably talk to it if there's more specific questions, but our percentage of absences has generally been higher when we've closed than what they show right now.
Right. Thank you. And I'm sorry I did not get a chance to look at it yet. I've received over 1,200 emails related to COVID, so that one got buried, but I'll dig into it more here soon. I know Ms. Babb has been advocating for maybe a second email address so we can keep our stuff straight, but I appreciate the work on that. So, and when Commissioner Schwinn said you've got to have no possible way of having school in person, did she benchmark that? Is there data? She said, is there any data that she said you got to hit for that?
No, she did not benchmark that.
Okay. All right. Thank you.
Yes, sir.
Ms. Christie?
Yeah, I think that some of the absenteeism we're seeing now, I see it more as a positive sign because we are telling people to not send their sick kids to school. We are saying, be extra cautious. I've heard from parents this week that have said, I never thought I would keep my children home for a runny nose, but here I am. So I think some of that's a good sign. I did have a conversation with Dr. Childs today at Children's, and he kind of validated that a little bit in terms of what they're seeing in the pediatric practices and the urgent cares. The kids aren't sick enough to be hospitalized, but the parents just want to know and come in and get those COVID tests just to make sure so they can safely send their kids back to school. So I don't necessarily see the high absentee rate as being a really, really bad thing. I think part of that is people are doing exactly what we have asked them to do.
Great point, Ms. Christie. Anything else? Any other questions for Mr. Thomas? Okay, thank you for that update. We appreciate that. That's very helpful. Okay, and I will refer to Ms. Coatney for the reading of the items.
Item 6, approve Knox County Board of Education Policy J120, attendance as amended.
Is there a motion so we can discuss it?
So moved.
Thank you, Ms. Christie.
Second.
Okay, we have a motion by Ms. Christie, a second by Ms. Babb, and now discussion. Do we want to have maybe some explanation, or Ms. Babb, would you like to have a question, or maybe we can just ask
Really,
for some explanation
I need an
first?
explanation. I am a little confused about this one and what it's trying to achieve, and just, anyway, hopefully your explanation will answer all my questions.
Okay, let me give it a shot again, and then John can jump in and help me if I fail to communicate adequately for this. But prior to this policy and looking at attendance, it would be an unexcused absence, and it would be students would be able to make up their work. But if we can approve this policy, then those absences for quarantines would be excused absences. I know a lot of, not even counted absence. So really, this is a way to count kids present if they're quarantined, if they do their work. And otherwise, it would be an absence. Some parents really want, their child's attendance to be perfect if it could be. And also with chronic absenteeism, this would help us with that as well, so.
I guess I am a little concerned. I mean, would we totally lose numbers of how many kids are out of school with this? Because that does seem like it's, and I don't know who can answer that, because I do think that's where I'm a little confused about this. And as someone spoke to, doing a worksheet or something, is that the same as being in school? So I just, if there could be a little bit more flesh out of this, because I still am a little confused.
Thank you, Mr. Oaks.
Okay, I don't know who's the best.
I'm going to start.
Okay.
And then I'm going to let Freddie Cox and Dr. Ryswick and Mr. Hartzell, bail me out when I get in over my head. Let me back up for just a second before I answer your question on this, because I need to give you a little bit of context. The data that you just saw, the attendance data that the superintendent was talking about, when you look at that, I can say that data from year to year is similar. I can't say that it is comparable, because the way that we have taken attendance and measured attendance has changed in each of the last 3 years. So 3 years ago, we were taking attendance based on the rules and coding that had been in place for years. And then last year, with all of the various mitigation steps that we had to take and the virtual instruction, how we coded that had to change, because we had to capture kids that were in virtual instruction. We also had to capture kids who were in virtual instruction simply because they were quarantined, or because maybe they were in isolation because they were COVID positive. So we captured those in our attendance data, and they were considered to be present if they were virtually doing their work, either synchronously or asynchronously. Well, that changed again this year, and unless we adapt or adopt this policy, kids who are out of school and doing their work in a virtual, synchronous, or asynchronous manner are counted absent. And that's a big chunk of the difference in the absence for the first 17 or 18 days of school that you see right now, and the first 17 or 18 days of school that you saw last year. Because first off, we had 18,000 kids that were in 100% virtual instruction all year that were largely present. Then we had kids who would come in and out of virtual instruction, either synchronous or asynchronous, based on whether they were COVID quarantined or whether they were isolated. So we had all that going on. We were able to capture that, and we were able to count the ones present who were doing their work and that were keeping up. That is not the case right now. So what this amendment to the policy does, or this piece of the amendments within the policy does, it allows us to capture that information similar to the way that we did it last year. And I guess we all know what we dealt with COVID last year, and the COVID numbers that we had, and the high number of folks that we had who were quarantined who were not positive. And that would have driven our numbers down. But if you remember last year, our attendance numbers were steady right around 95%, which is better than in a normal year. And that, I think, is the virtual effect that we had. So that's why those numbers are there. I think if you could capture the absence numbers this year the same way we captured them last year, you're going to be looking at similar numbers at that point. So we'll be much closer to doing what we did last year as far as calculating the absences are concerned. Does that make any sense?
It does. I guess what concerns me, and honestly, I guess it concerns me even about how we tracked stuff last year, is we're really saying we had 95% of kids not absent. That doesn't mean we had 95% of kids in school, it sounds like.
We had 95% of kids getting instruction in some form or another.
I guess where I'm going with this is a little bit of, we look at our TCAP scores last year, and I mean, I'm not somebody that is just gonna be driven by that, but we look at the fact of, when we try to look at kids that really got instruction in the classroom versus the kids that don't, if we're not keeping up with that somewhat, how do we sort of know how many kids really got in-person instruction and did not get in-person instruction? And this year, we're really not offering virtual the way we did last year. So, if, for instance, say this got really bad, say 50% of our kids weren't showing up for school, but they all did a worksheet at home, are we now saying we've got 95% of the school kids getting instruction one day?
It depends on what they do with that worksheet and how they turn it in, and if it is, and I let Dr. Ryswick is much more, able to talk about, the classroom mechanics of it than I am, but
And are we gonna, I guess, are we also gonna show at all that we actually, how many kids are out of school? Or if we pass this, there will be no sense of knowing how many kids are in school.
Oh, we will know exactly how many kids are receiving instruction virtually, because they will be coded for virtual instruction. Right now, they can't be coded for virtual instruction because they're doing makeup work. They're absent. So that's part of our challenge right now. We need to know who's receiving virtual instruction and to be able to code it that way. We also need to know it for purposes of our food service program, because we have to report that to the state every month in order to help them calculate our reimbursement rates.
And maybe this leads, and I don't know if this goes right with this question, but I know from the state, they have changed back and forth, and I mean, I don't know how we're keeping up with it, because it seems like on a daily basis, what we're allowed to do and what we're not allowed to do. So to me, that somewhat goes along with this virtual instruction and what we're doing. I mean, can someone speak to what we are planning on doing for kids that are gonna be at home?
Is that? It's your turn.
You're up now, John. And I mean, this might be on something else, but I think it really ties into this. And I think it's what a lot of people are asking is, what are we really allowed to be doing for the kids that are not coming to school?
Thank you, Ms. Babbitt. And let me say this, and Russ did a good job explaining the attendance part of that. So really what you're getting at is what the state board policy that they passed in July was trying to get at. So last year there was kind of this hold harmless type of thing where we could code any student who was isolated or quarantined or on virtual instruction, or a school that went to virtual instruction. They all had a certain code. Freddie's great on the codes. It was a VL code. But anyway, so you knew a kid was virtually getting instruction as opposed to an in-person student. The state knew it was kind of loose around that about in the middle of COVID how to do that. So they knew the attendance numbers weren't super accurate across the state, right? So this year, to try to tighten that up, that was the action that the state board took in July. So a lot of people think that's when they defined virtual programs and virtual schools. That was done like years ago. All they did was brought that same policy up, and they added this attendance piece for students who were quarantined or isolated. They leave the word isolated out, but that's what they meant. Quarantined or isolated, so that there was a way to track their attendance. That's what this whole thing is. So in order for us to be able to move to put students who are quarantined or isolated into temporary virtual instruction, we have to have a policy change in the board according to the state board that allows it for that reason. So this language is lifted straight out of the state board, and it really is to say they lay out 4 different ways and you have to meet 2 of those 4 to track attendance. That's the state's way to get back to a more accurate way of tracking students' attendance, so it's not just a free-for-all. All of these kids are VL coded and they're all getting instruction. There are some requirements, and laid out in those are either teachers have to make contact, visual or phone contact every day with students, synchronous instruction, which would be extremely expensive for us to do. We'd have to hire a bunch of teachers to go do that. And then there's the 3 and 4, the ones that we're looking to do. One is students complete work, and we're saying via Canvas, which is a learning management system. Canvas isn't laid out in the state board, but learning management system is. And then 4 says that students have to be able to submit that work on a daily basis through their learning management system or in person. So for us, we're meeting 3 and 4 by our plan, getting to your question, Ms. Babb. So we have said from the beginning, and let me try to be clear about this, even this summer before COVID made its resurgence, our expectation was something Mr. Watson had asked earlier, what did we learn at the end of last year that we want to carry on practice-wise? Well, one thing we learned is that our teachers were trained in Canvas. We were able to shut down for a week to go fully virtual, and all of our teachers use Microsoft Teams, and all of our teachers use Canvas. We were trained in that. We continue to offer training. We continue to do it now and did it all summer. It's an expectation now of us that Canvas was not a COVID response. Virtual and Chromebooks that we all spent millions of dollars was not a COVID response. It's actually an instructional tool that we have moving forward. So we started through the summer expressing through the Principal Institute from the very beginning that our expectation for strep throat, flu, orthodontist appointments is going to be that teachers post their assignments in Canvas for makeup work. That's a muscle we learned to use, and we don't want to stop using it, or we're going to have to go into this massive retrain again, right, and retrain everybody to do it. That continued. COVID obviously is making somewhat of a resurgence, and so we've continued to say that asynchronous posting of those lessons, right? Continued support from the school level and/or our Department of Technology to help support and train teachers who need that at the school level to be able to get that done. I think teachers have a knowledge base of Canvas. I'm not saying everybody is, you know, a master of that, but we did it enough last year where we were able to go virtual in many schools using that, as well as close the week before Christmas and use that. So our plan will be no different than what we were saying before. And my hope is, you know, we see this COVID resurgence leave, and we still have this expectation that you post your makeup work in Canvas. Sometimes that's a PowerPoint with a worksheet. Sometimes that could be a video. We're not asking teachers to do 10 more things than they're already doing. We're asking them to move it into electronic format. My time in schools last year, I know our team out in schools last year, most of the in-person classrooms were using Canvas for submission of work and all those things too, so they weren't making all their copies. I'm not saying everybody's doing that across the board. So our plan is for all students that their asynchronous assignments are posted. If you need support, Danny and Julie both have different plans working with the elementary PAC or Principal Advisory Council and the Secondary Advisory Council. They may do it a little bit differently, but right now our plan is we're working through that, is that we'll potentially provide dollars to each school for them to be able to pay teachers kind of in a tutoring format where they could either during the day or have kind of office hours after school to be able to support the students who are in that mode. That's actually a requirement of the state board policy that you have to have, one, the work available, and that there has to be some, you know, support in there for that. So, so our best way to do that now, not to have teachers teaching on 2 platforms and, you know, having a hybrid class where you have 15 kids in session and 5 logging in from the outside, is to try to stay true to what we ask teachers to do. Teach your class in person, put your makeup work and your assignments on Canvas asynchronously, and then we will be providing dollars and support to each of those grade levels based on principal input of how they want to provide support for those teachers and families in off hours or during the day if that's what they decide to do.
Thank you, Dr. Isaac. I think Ms. Owen has a question.
I do. I'm not sure who would be best to answer this question. Looking at it from a data perspective, would it be accurate to say that using this policy change, we would be able to use attendance to consider whether the student received instruction, but not necessarily to determine district-wide illness?
I think to your question about instruction, we talked a lot about that too, because there is this kind of daily, because it says students must submit work via hard copy or virtual formats. You know, we talked about some of that. Our thought on that is asynchronously, you know, a student could be sick and not able to participate in 2 or 3 days. Probably not going to hold that against them. If he or she is submitting sometime during that 10-day period and doing that, I think, you know, our thought would be show some grace and let the principal and teacher, you know, say the student's trying in best interest to do that. So I think as far as instruction and attendance based on that, I think we would, you know, again, allow the schools to make that call, but allow them to count the student present if in good faith they were working toward that, even if they weren't able to every single day.
I think I'm getting more toward the other way around.
Okay.
If the student is sick but able to do the work,
Right.
we have no way to know that, really.
Well, if they were submitting the work, we would be able to, again, count them from that side. If the question, and I may not be understanding your question, Ms. Owen, if the question is, could we tell that kid was doing that virtually versus in person, we could off of coding. I may be missing your question, sorry.
What I'm looking at is when we're thinking about attendance as a way of determining how much illness there could be in the district, that this may not allow us to do that.
Oh, you're saying this could mask an ill
Right.
student who would be at home by showing they're present?
Yes, thank you.
Yeah, I'm gonna go back to Mr. Oaks on attendance on Cody.
No, I was just talking to Freddie about that. I think the way the policy is written is we would be coding you, and I'll just use the term VL because that was the code that we used last year. We'll probably continue to use it. If you're coded VL based on this policy, it means you're receiving some type of virtual instruction because you're quarantined or you're isolated, and that would be an indicator that you had a COVID illness. You know, so it would capture both of those to some degree. Is it going to be absolutely perfect? Absolutely not, but it is a step in that direction.
Right. Thank you.
Thank you, Ms. Owen. Okay, I think Mr. Watson, and then we'll go to Ms. Henderson.
I think Ms. Henderson was actually first. I saw her
Okay.
pull it. Yeah.
Thank
Yeah,
you,
go
Mr.
for it.
Watson.
Thank you.
So John, sorry you had to sit down. This is something I'm actually really passionate about talking about because, you know, these kids getting behind and everything is something that happened last year, and I think that we can come up with things in place to help alleviate that a little bit this year. So what happens if a student, let's say a student is out on quarantine, and they have a test after the week they get back, and they've missed 2 weeks already? I mean, I just think that it's a good opportunity to beef up our virtual options. We saw what worked last year, what didn't work last year, and we can constantly be working on that, changing it, making it better. And I've talked to several teachers who really need time to get their virtual instruction kind of up and ready. If you guys thought about maybe taking a couple days off, giving everybody a reset, and letting teachers get that up and running a little bit better?
Good question, Ms. Henderson. I think two parts on that where number one, I'm sure that there will be teachers again who need to be thinking through that. We're trying to continue to grow to think about them not being as two separate things, like how I teach in person and what I have to do to convert over to digital, because we've tried to avoid that hybrid teaching, right? Instead, trying to talk about how do we bring the virtual into the classroom as a tool so that you're doing, you know, some assignments and doing those kinds of things. With that, still, we know, you know, 1 year doesn't make us masters in it, so we still need to improve on that. We are a little bit limited in the second option about having that virtual. You know, I would say last year there was flexibility in districts to kind of say, hey, let's practice virtual for a week or do those kinds of things. We don't really have that flexibility now. I mean, I know superintendents explain the waiver process and or, you know, snow days or inclement weather days. So I think it would be a little harder to do that. I mean, we could, you know, burn a day or burn 2 days. You're kind of gambling there's not going to be snow or you're not going to need those, you know, those kinds of things later in the year. So we don't have the flexibility to say, you know, tomorrow, the next 2 days are virtual days to work on that, because those would count as against our 10 days for inclement weather days. So I think that might be a little harder to work in, not impossible, but I mean, there would be a cost to it. Thank you.
And can I just ask a question real quick as a follow-up to that? I think one of the issues that I've heard from teachers and principals is that they are concerned about what the expectation is, because they don't, you know, they are trying to teach their class in person. And so I think that there's a lot of concern around that. You know, what is expected to be on the website? Are they supposed to have, or what's available to students? Are they supposed to have videos for the kids to watch and that kind of thing? So I think is that kind of what you're hearing as a concern? Yes. I think that's the big concern, is that teachers and principals understand that teachers are stressed about that. And so that's, I think, the big question for them.
Sure. I would just say this. I mean, I think it's been expressed over and over. Virtual has a place, and I think the virtual schools and the academies that the students have enrolled in, I mean, those teachers are fully working on that full-time with caseloads. That's probably a little bit of a different virtual experience. Obviously, it's synchronous, and those things are happening in real time, than it's going to be for a student who's on a 10-day quarantine with a teacher who's teaching in person. Last year, what we saw, Shannon did a great job and her team looking through that. What we saw is teachers would kind of overdo, if you will, because they really were, you know, they're so used to teaching with their students in person, they can go touch them and be kind of, you know, over their shoulder and looking at those things, that they tended to kind of like create these mega assignments that were bigger and bigger and bigger, trying to make sure they could have kind of the same experience there. I don't know that we'll be able to replicate that. I mean, our expectation is not to create more things, or record a video during your plan time for every one of your classes that puts that over. Our expectation is, you know, if these were my slides for a PowerPoint presentation, or this was my worksheet, I'm pulling those over into Canvas. There's even some, Shannon and her team have worked with folks to create some Canvas Commons, some classes and some lessons that like apply for all first grade or all second grade. There are some schools that will be looking and thinking about that too. You know, if we have 7 English 1 teachers, maybe we can create kind of a series of lessons and we can share those around. So I'd say, you know, again, even though we learned a lot, it's probably not totally perfected in how we do that, but I think there's opportunities to grow. But I mean, I would say that for the record, our expectation is not for teachers to do dual on that at all.
Okay, great. That's wonderful. Thank you. Mr. Watson.
Thank you, Madam Chair. I appreciate you all clarifying the question around coding. A quick follow-up. Well, since you're up there, John, let me get some questions for you real quick. And so the support for students available on asynchronous instruction, you know, I think we have to recognize that submitting assignments is different than instruction, right? It's a very different thing. And so students who are quarantined or isolated, who might be submitting assignments asynchronously, what type of support are we able to provide? I know we're not going to provide a teacher live the whole time, virtual instruction, but what's the other options that are on the table, and what are we considering to provide for students during support during that time?
Yeah, so we started talking to our principal advisory councils for that, and I know the secondary principal advisory, because they're kind of two different situations. What those principals have asked for are some funds to be able to either pay their teachers to teach on their plans or be available. Some have talked about like a hotline to be able to do that. Like it may be the core subject areas where you're saying we kind of have math help, you know, and you can call in if you need those supports or that sort of thing. It may be after school hours or tutoring that's offered at that point that they can, you know, when parents come home, that they might be able to call and have somebody. So the idea of having somebody live in real time specifically for that would be very difficult without hiring a bunch of extra staff. So I think it's more availability for extra like specific supports. And that's not to say that the base teacher, you know, they're not, you know, waiving all responsibility. They can still answer emails and stuff. We're just really trying not to overload the current teachers in there, you know, as they teach in person.
So it sounds like there's going to be opportunity for each school to be creative about how to provide that support and do it as they need in their school. How can we, which I love creativity, how can we ensure that each student has an opportunity for support when we're doing it that way, school by school, and a lot of creativity?
It's a good question. I think there'll be the expectation that that's happening. I do think we did have a conversation with the principals about this. You know, there is a level that you want to be creative, but you also want to have some level of district consistency. So we were saying, you know, you don't want a student who goes to West to say, oh, we're opening this up and we're doing Teams calls and you're coming in live, but then you have a kid, same family at Bearden Middle who's saying, my teachers aren't doing that. I'm not getting the support I need. So, you know, we're really want to try to stick to the asynchronous so that teachers don't feel compelled to have to do, you know, what some chose to do last year and be, you know, hybrid and, you know, juggling all those people at once. We think it's probably going to be more, and again, they'll help us with the models, but more kind of support as needed, and it may not, again, be your teacher of record, and sometimes it may be. It just depends on how the schools build that out for that support.
Okay. And when will they, so this last item, number 5, or number 4, it says students submit work via hard copy or virtual formats. How much time is a student going to be allowed to do that? You might have said it earlier, I think you said something about 10 days. Is it within that 10-day window?
Just assuming that typically, you know, an isolation or a quarantine would be a 10-day window, then, you know, we do have makeup policies. I'm sure there'll be some grace within that around kind of a 3-day from return to school. The idea would be, in the way the state board wrote the policy, was that there's kind of a daily submission of work if you're, you know, healthy and able to do that. But again, some of that's going to take some grace on kind of the family situation and the student situation. If a student were to be positive and asymptomatic and processing through, they probably could submit those on a regular basis.
Yeah, one of the concerns I've heard from administrators with this policy is teachers having to go back retroactively and mark a kid present. Because let's say they were quarantined and they chose to turn all of their work in toward the end of that period instead of each day. And so now the teacher's like, oh man, they were present, they did everything that was expected, and now they got to go back and mark them. How will that be? I think
it's actually opposite the default. Well, I'll let Russ take it.
Yeah. It's exactly the opposite.
Okay.
The way we work attendance every day of the world is if everybody is defaulted to present.
Okay.
And then you go in and change those who are not present to absent. That way, you don't have to touch everybody in the district. You only touch those that are absent. With, and to clarify a little bit on our virtual coding, it is virtual instruction, but you can be absent from virtual instruction so that, so that you're virtual present or virtual absent, and it works the same way. So if I'm out for 10 days and I'm coded virtual during that 10 days, and I don't turn in any of my work or I don't do any of that, then you have to go back and code them absent, as opposed to going back. You've counted them absent, now you're going to go back and count them present. So it's the same process, it's just not as iterative. It's over a longer period of time.
Okay, and to add to Ms. Owens' point, I want to make sure I'm clear on this. So the current COVID dashboard that we have shows absences related to active cases. This attendance policy would not hamper our ability to be representative in that with the data. I just want to be clear that the way we're coding kids present, even if they're present but they're not in school because of COVID, that's will still reflect in the dashboard.
That is an illness status. That's not whether they're present or not.
I understand. I think there's a lot of concern about that in terms of will that still be accurate, and I just want to make sure it's clear.
Yeah, I don't think Freddie, correct me, I don't think we're giving up anything in our ability to track any of that. We're actually adding to our ability to track with this.
That's correct. It actually gives us a little better clarity about the status of the students. So it can be virtual learning and present to the state as present. So it's not one code to us.
Right.
We would be able to give a better, view of the district, even though to the state, it may say present or absent.
Sure.
Yeah.
Okay. Thank you. And just two more questions. So it says for isolation or quarantine due to COVID, is there a way to ensure that people aren't taking advantage of this who are just not present for whatever reason, but they're not really isolated? Like, how do we confirm that you're actually on isolation or being quarantined?
I think if somebody wants to take advantage of anything, they can figure out a way to take advantage of it.
Sure.
So I think we just have to work it to the best of our ability. And a minute ago when I said, is it absolutely perfect? And that it's not, and
right.
that's one of the challenges that we face with it. But I think it'll be more accurate than not.
Yeah. And the last question, so of the four things, I just want to make sure I'm reading this right, they have to do at least two of those things to be counted present?
Correct.
Okay, thank you.
Can I ask a follow-up question to that, Russ? This may be for Dr. Isaac, I'm not sure who it would be, but so really to Mr. Watson's point, if they're treating this as a vacation and they don't check in with their teachers and they don't do any of those things, and then they come back to school and then they're wanting to take the test they missed and they're wanting to be counted as present, but meanwhile they have to be actively engaged really on a daily basis is what you're saying, right? And so I guess my question then is, to Mr. Watson's point, if they're treating it as a vacation and then they're wanting the teachers to catch them up, that's going to create a lot of extra work for teachers that they wouldn't be having to do. So I think that could be a concern, to his point.
Thank you, Ms. Horn. I do think on the isolation is probably going to be a little clearer. I mean, that's a diagnosis and a way that, there could be documentation for that. And we have, confirmation through the health department on that. So that one's easier. To Mr. Oaks' point, it's a little tougher on the quarantine, right? I mean, we know the way things are, so that could be difficult. But there is a requirement even in the state board's policy that, that they have to be submitting that work. So you couldn't go dark for 10 days and then come back and say, I want credit for all those days. Like, there has to be some work and communication with the teacher, and like those kinds of things taking place in order to do that. So one of the requirements of that state board policy is that there's 6.5 hours of work, that's for that student every day to be doing. So if they haven't done any of that over those 10-day periods, I think they would just be absent at that point, especially if there was no, documentation of them being in isolation.
Okay. And if they're truly sick, then when they come back to school, then they would just be given their work as normal as you would with any absence now?
Right, and again, in most of these cases, sometimes for that 10-day period, you know, there's something, and there'll be communication with the teacher, so it's not 100% foolproof. If you just went dark for 10 days and then came back and didn't have any documentation, there'd probably be a conversation there, but, you know, typically, again, we're gonna have to walk that out as it goes, but those things could happen, as Mr. Oak said, there could be some folks who took advantage of it, and we'll try. We would probably never, when Mr. Myers was said, he goes, we wouldn't do that on tests. Definitely, I mean, we don't want to jeopardize their academic career. We want to make sure they've got every chance to be able to do those things, and it's not punitive. But we also, you know, need to make sure they're following some kind of guidelines for that.
Okay, thank you. Were you finished?
Yeah,
I would like to speak, Madam Chair.
Oh, yeah, go ahead.
If you don't mind.
Yes, please go ahead, Ms.
So a lot of the information, the question that I had kind of came up, but what I'm really, so I don't really have a question, I have a statement maybe. I understand that this policy is for attendance only, but there's not really a clear understanding from the district level on the grading aspect of it. And I understand what Board Member Horn said, putting the work on the teacher for when they come back. I just don't want us to have a mindset of punishing the student, regardless if they're sick or not. If they don't have the means or the ability to do the work every single day to upload it, that's a concern. And if they're quarantined and at home and they can't come back till 10 days, but they don't have the support at home to do the work every single day, then they come back to school. What is that grace? I know you talked about a grace period to get the work. So I would like to see, when we finally vote on this for the next week, a district level consensus of that grace period across the board for the whole district of how much time they will actually get to submit the work afterwards. And I think that we have to, as a district, think about when will the teachers have the opportunity to upload this information. And so really, before I vote, because I understand where it's coming from, I understand this policy, but I think we need a district level accountability and a district level planned on when the teachers will have the opportunity to create what needs to be on the platform, as well as that district level grace period when it comes to submitting the work.
Okay, so, Ms. Satterfield, this is a called meeting, so the intention is to vote on these items.
Today? Oh, then y'all better come up with some answers then.
So,
Because that's
I
a
think-
concern.
and I mean, I know, was your question answered?
I just want to piggyback on Ms. Satterfield that I do think that the teachers need time to build this
Yeah,
out, for sure.
That was going to be my next comment as well. I'm very concerned that that this is going to put additional pressure. And I know that, I heard you say that the expectation from summer was to continue in, but a lot of teachers weren't teaching in the summer, so it is kind of new. And so I'm concerned that it's going to be a heavy lift for teachers, and, you know, especially if we're voting on this right now, tomorrow, you know, students are going to have expectations that teachers may not be able to fill. So I think we need to be realistic about that. So, Ms. Satterfield, do you then have is there something you need an answer to on regarding that?
Yeah.
That and the grace period. And I understand you said like the 3 days. If that's what it is, that's what it is. But I want it to be like consensus about across the board.
Okay.
So I'm happy to try to address some of that.
Okay,
So,
go ahead.
So I would say, first of all, I mean, I hate to say, and I get it, there's that whole tight loose, right? How do we lay down exactly what needs to happen, but then there's going to be 16 exceptions to that. And that's why, like, to leave that at the school and the teacher to be able to have some ability to do that, because every situation is going to be a little bit different. We currently do have the 3 days, you know, to make up work when you've returned. Most schools will give extended grace beyond that. I mean, there may be a teacher or two out there that's going, nope, you know, kind of letter of the law, here's what happens. But the whole idea in this is that students aren't causing this to happen. It's something that they have happened to them, and that almost all the schools that I have been in understand that, toward graduation rates, toward all those kinds of things, that they're working to help the students make up and catch up those things. So, you know, I would say if there's a situation where that's not been fair, you know, they should call their grade level director, they should talk to their principal, talk to their teacher, like go through that process to have that happen. That's what would happen now, take COVID out of the situation, right? And if a kid needed more than their 3 days, and they usually talk to the teacher, and 99% of the time, the teacher's fine with that. If there's a reason that the teacher's not, they talk to their principal, and then work the way up to where we get to Danny or Julie to have that conversation and us do that. So to me, it's not that much different than that. And if we lay, 4 days out instead of 3 days, and then somebody's going to need 5. So I'm saying there's some of those kinds of things that we go, we kind of trust the school level administration and teachers to do that. For the letter of the law, for what we have to do for the state board, this gives us that flexibility that the board's acted so that we could do that. To me, that's where it's probably better across all the schools that we have to let them try to do that. To address where we are with creating like virtual lessons, I would say, again, we don't want teachers to feel like they need to stop, drop, and load, 10 makeup assignments in there, because the truth of the matter is that's not going to solve it. When you've got kids who are going to be out at different times during the year and they may be on different units of study, like you would have to load your whole year up on that, right? So the idea is not a makeup assignment. The idea is a continuation of what you're doing. So if I'm teaching this novel or I'm teaching this math concept, what I'm doing, I'm loading into Canvas, and it's not, I'm not going to say it's no big deal, they can just do them. So there's some effort in that for sure, and there's some planning that has to be done. But we're not expecting them to recreate a whole different lesson than what they did in their classroom that day. We're expecting them to be able to move some things over that make sense electronically for students to be able to do. So, so I guess I'm saying if we paused for a day and said, okay, everybody load up, it's like, what would you load up? Because somebody might be out in 3 weeks, and it may not be what you're on at that point. So, so I think that's where it gets complicated, knowing this may continue over the course of the year. To do that. If they needed extra training or they didn't understand something in Canvas and that sort of thing, we've continued to have that available. And again, everyone's not a master of it, but there are people at every school who are, and we would ask them first to look at your school level, and then we offer district trainings and supports through Teresa Nixon and her staff, and have done that pretty much for the last 2 years. So we would continue to do that. So, I'd love to give them time to do that. I'm just not sure that helps us in 2 or 3 weeks. Does that make sense?
It does.
Okay.
Yeah, I know, it does. Anything else?
Yeah.
Go ahead.
So what's the alternative to not putting the pressure on our teachers? Because our teachers they're looking like it's April, and it's only 18 days in. Mm-hmm. So what's the alternative to that? And could that be, and I don't know, right? I don't know the curriculum, but could it be that the assignments that they have to do on Canvas is mirroring what's already in place with our virtual platform that we have?
So the virtual, so we only have the virtual school staffed for, and they're held to the same requirements as far as class size and all of that. So the school that Ms. Hahn and Ms. Garrett have set up to run, we held them on staffing. We didn't staff them fully. Once we knew we had about 700 people who were interested in it, we cut off the staffing at that point and staffed them to handle that. They have a little capacity, but we've had some medically fragile kids that have been moved into that. So they don't have the capacity to hold,
Okay, I wasn't clear. Can we mirror the work that is in that virtual, those for the grade levels? So the student that's quarantined in 6th grade at one particular school, can they do the work of that week that is of the calendar curriculum from that?
That's a couple assumptions with that. And Shane,
Yeah.
if you might want to jump in and help. I would say, one, not everybody's at the same place in everything, so it might not be, or there may be a course that's not offered in our virtual school that a student has. That could be a challenge, but I think there are some things we can do in the Canvas Commons. But before I mess it up, I'll let Shannon talk to you.
Good evening, Madam Chair, members of the board. Our team has created common courses that are based on our curriculum. They're in the Canvas Commons, and what we've heard this week is that we need to reshare where that material is and help our teachers to find it, because that is a simple copy from the Canvas Commons to put in their Canvas courses. We can't do that for everybody. We can't roster every child to the same courses, but what we can do is make those courses available to our teachers and let them pull what's relevant for them, where they are in their pacing, and make it available to their students. So one of the things that Canvas allows us to do that I think once we get really comfortable with this is that it gives us also that timestamp of when students turn in their work. So I remember as a classroom teacher, when I had students turning in things late and it wasn't in my stack of papers that everybody else was turning in, keeping up with that is really hard, especially when you have 100, 125 students in a semester. When it's in Canvas and the students are submitting it at inconsistent times, you have that record that it was submitted, and it's easier for you to go back and find it. also easier to have that documentation to show a parent when things were turned in or not turned in. So it really, in the long run, will make it easier for our teachers to keep up with all of that.
Okay, while you're there, I think Ms. Fab has a question.
Yeah, so it sounds like there are some kind of core classes already set up. It's almost like we just need to remind teachers how to use it. Another thing I was wondering about, because I just listened to something the other day about like Khan Academy and things like that that are out there. Are our teachers taking advantage of things like that that are established educational things that are already, you know, pretty good at instruction to maybe send their kids to, that they're not having to recreate the wheel?
So teachers are using different materials such as that. I think we do have quite a few who rely on Khan Academy. We at one time had that connected on our math page, but our math department actually has gone through and created, for elementary math, they have created instructional videos for every one of the topics that they study. So there is a math video using the materials that our teachers use and that our kids can see, so that it's very connected to that material. So that's also available in the Canvas Commons and in the YouTube page. I recommend everybody check out our math YouTube page.
So a lot of this that we're kind of talking about right now, and why it seems like we're sort of a late start, is because of changes the state has made to us. Is that correct?
That is correct.
As of last week, we did not think we could do this. We didn't think we could do this last week, and all of a sudden the state has changed kind of the rules again.
This is correct.
Okay, that's very helpful.
Okay, thank you, Ms. Jackson. Okay, I know Ms. Owen has her mic down, and so if we can go to her next.
Thank you, Madam Chair. Do we have a timeline for when teachers would be expected to have things up and ready? Like at what point are their principals going to say, why aren't your classes up and ready?
Thank you, Ms. Owen. I would say back to what our expectation was in July, was that Canvas was going to be our backup for makeup work, right? I think it could be varying degrees of that, but the expectation from the beginning, I know I myself communicated that in the Principals Institute. I know Mr. Trent and Ms. Thompson have followed up at least on 2 other occasions to that expectation to principals. So I think to some, you know, again, when you have as many employees as we do, people are going to hear that at different ways in different schools and that sort of thing. But that expectation has been there already that that's happening, and I know there's been conversations in the last 2 weeks. So that's not to say you wouldn't find a teacher who would say, I didn't know that, but that has kind of been our expectation all along. So we hadn't really set anything out there to say by September 15th, all this needs to happen. It was just always kind of an expectation of that. I think since there are more COVID cases, I think people have been more tuned into that, understanding that this is a real possibility, and especially this latest thing we've heard from the commissioner on the waiver this week, I think now people are really tuned into that. So if it was kind of a thought that I should probably do it versus an expectation to do it, which was clearly laid out from the beginning, we still know people might need catch-up time. So again, I think principals will have grace with their teachers understanding this is year 2 of us trying to do that. But I would say the expectation exists now and has since this summer that they should be doing that.
I'm concerned that there may be a breakdown in communication there somewhere.
Okay.
Because I'm hearing you saying that that's been the expectation with principals. And what I've heard for the past several days are teachers in tears because they've been told everything's normal, we're not doing all this. And so they're extremely distressed to suddenly be changing everything that they thought they were doing. And it's not coming from 1 school or 2 schools, it's coming from everywhere.
We can continue to, you know, support that, put that out there. I think, you know, I mean, obviously we're not trying to cause stress. I mean, and unfortunately the situation we're in, you know, I don't want to paint it, I don't want to overpaint the picture of, oh, it's no big deal, because it is a big deal. And it is work and it is effort on teachers' part to load that. And we don't have, nor does anyone have that I'm aware of in the state, a good plan to be able to do this. You either put teachers on this hybrid model that are, you know, had everybody worn out by Christmas last year, or, you know, you do an asynchronous model and it still requires some level of connection back to the teacher. So I would agree. I mean, it's not ideal, and so.
I think we just need to be very aware at the district level when we're looking at things, especially when they get to the point of things not working somewhere, I think we need to be really, really aware that there are some places where teachers were not expecting to be doing this. And so we need to really look at how to support that.
Sure. I think that's a good word you said, support. I mean, we'll be willing to try to do that if there are areas. And we're hopeful that the folks will continue to reach out and talk to us. I mean, there's nothing punitive for it. You know, we want our schools to be prepared to be able to support their students. And if they feel like they need that extra support, again, I know Teresa Nixon's team has been great at providing those kinds of supports. Shannon's team's been great instructionally to provide those as well. So, you know, we'll continue to gear up and try to clarify expectations. And again, not punitively, but support.
All right, thank you. Mr. Watson?
Thank you, Madam Chair. Dr. Reiswick, just to piggyback a little bit on what Ms. Owen was saying, I've heard in particular challenges with getting curriculum up in Canvas for curriculum we don't yet have. So the new ELA curriculum, math curriculum in middle school. So can you speak to that for a moment? Because we've got a lot of stuff that's late for not reasons outside of our control.
Right. I'm going to let Shannon, because she has been part of this all along. But you're right. I'll say this before Shannon comes up. It's not been lack of our effort from the district side to have that happen. But
Right.
I'll let her explain the process.
Thank you.
Thank you, Ms. Jackson.
Thank you. So we have digital access to almost everything. And those materials, actually, I was even surprised how quickly our elementary reading department was able to get material into Canvas Commons for the new reading series. So they have created it, and it's up there ready to go.
Okay.
And it is aligned to the new materials.
So the digital curriculum, we can actually move that digital curriculum into another platform?
We can,
Okay.
yes.
Great.
So, yes, it's the print material that is slow.
Okay, thank you. And then another question, and then we haven't yet addressed the whole other part of this policy, which is around truancy. So I'd like somebody to speak to that, because that's also something that's potentially changing. One of the things I'm hearing too from some teachers is they have a lot of concerns still with some of their kids having access. You know, some are day students in terms of computers, and that, you know, they don't take their computer home because their parent hasn't turned the form in, or they don't yet have internet access. So again, I don't want to penalize certain students from being able to still be counted present. So is there anybody that can speak to that, what we're seeing across the district around access?
Mr. Watson, before we get an answer to that, can I just ask Ms. Henderson if she has any other questions on the top part?
Oh, yes.
Is that okay, or are you still on?
I mean, that's about that. My concern about access is relative to the top part.
Okay.
Yeah,
All right.
thank you.
We'll come back to Ms. Henderson. Okay. No. Get back to his question about the truancy issue.
Well, no, it's not about truancy. It's about internet access and availability of computers for kids whose parents, for whatever reason, maybe have not turned in the form yet, so they're not able to take their computer home. There's those types of challenges that are present in the district.
I'll answer that one, then I'm going to let Freddie talk to you about internet access, because there's a plan for that. So, so there is a requirement for the form, you know, to be signed. And so in a situation where if a student hasn't done that to take it home, obviously the principal and the teacher are working with that family. And if a quarantine situation or an isolation situation would arise, you know, we would just ask them to sign that paper to do it. But outside of that, yeah, we continue to follow up and try to make that happen. And we're not, you know, saying, sorry, you didn't sign it. You know, no, we're trying to get that when they come to pick the student up and come and get the computer, they can still do that, and we're trying to make that happen. So on the internet, or the internet.
Hey, John, let me ask you a question, too. In absence of approval of this policy, what does it mean? I mean, what would be different? If we didn't have this policy, what would be different?
Without this policy in place, then we're not able to provide virtual instruction to students who are isolated or quarantined.
Okay, but in terms of if excused absence, how do I make that up? You know,
right.
if we don't have.
If we didn't have.
Isn't it going to be the same process?
Right. So I would go back to you know, our expectation is to continue to use Canvas and have that as a makeup piece. But you're right. If somebody's out for strep throat, or they're just out for a couple of days or doing something like that, same situation. The students traditionally have just missed instruction for those 3 or 4 days. And then when they come back, they work with the teacher to work out a makeup plan and, you know, have a reasonable time. Typically the policy says 3 days, but usually they work around that.
I guess what I was trying to get at, in absence of this policy, the makeup piece of it is still the same, the expectation. So.
Yes, you're correct. I'll let Mr.
And in light to these changes, we've kind of fired the hotspot program back up again for lack of a better option. So we started communicating that last week to our schools that this is available, and we have some funds to support that for this year, but it's still not the greatest option for our families, but we do have that available.
Thank you.
Anything else, Mr. Watson?
On the truancy, but Ms. Henderson
Okay.
has a question.
Okay, go ahead, Ms. Henderson.
Yeah, I just want to, I agree with Ms. Owen on this. I've heard this from so many of my teachers and principals that they are drowning here, and they really need a time frame on this, and they need time to get this up and running. And, you know, I'm trying to fight for the teachers and principals because they're with our kids every day, and they really need this.
I guess I'm wondering, and I know Mr. McMillan has a question. I guess so if we don't pass, back to what Mr. Thomas said, if we don't pass this policy right now, if we don't do this, then basically kids who are out would just come back to school and get their work as they normally would. Is that correct, Mr. Thomas?
Well, based on what John just talked about, the expectation is that they would still have to, the teachers, and I'm not trying to throw extra work on teachers, but again, we've always had makeup when students are absent, you know, excused absences. So this is the procedure for doing that. I don't know, John, what other, you know, I guess when the student gets back, you know, the teacher is still going to be worked to try to go back for the number of days that particular student was absent.
Right, and
to
you know,
provide the
you're
makeup.
exactly right. And again, the whole reason that this policy change has to be in place is in order for us to offer virtual instruction for students who will be isolated or quarantined. We don't have to technically. We've not passed this. They're just gone for 10 days to come back but to Mr. Thomas's point, when they return, you know, we always try to do makeup work to get kids back on. We don't hold that punitive for them. And the other part of that is we could not count them present. They would be absent for the 10 days they're quarantined or isolated, and that would go against the school for chronic absenteeism and also go against that student's, you know, 10 days. So, like, yeah, we could do nothing, but that takes out those two options because those are required by the state board to do that.
Okay, all right. Can we go to Mr. McMillan? He hasn't asked any questions.
Yeah, John, this really wasn't what I was going to ask, but I'll ask it in just a minute. You said something about the parent picking it up if they didn't sign for it. Do you still give them the material and the computer and everything, even if they refuse to be responsible?
Good question, Mr. McMillan. We would not assign the computer at that point because there are some, obviously it's, you know, Knox County school property, and there are certain requirements of things that have to be done for that. What I would imagine we would do again is just work with the principal and the teacher and probably move back to, you know, maybe there's a paper packet or maybe, you know, maybe there's some kind of something, send some textbooks home.
But the kid would not, until the parent agrees to be responsible, the kid would not be able to take a computer home.
And I would say, again, Mr. Cox probably knows how many people we have that are out there doing it. It's probably a very small number that aren't willing to sign that, and they may have good reasons not to, but he can probably give you an idea of what we have.
Did we have quite a bit of damage to those last year or computers?
So we've currently got about 55,000 students, families that have signed the device agreement. So, I mean, we're down to like 4,100 kids as of last time I pulled the report that haven't completed that yet. And regarding damage, yes, we saw damage last year, ranging all the way from very minor, you know, bumps and bruises to the Chromebook, all the way to total loss.
Well, that was to be expected, but.
Correct, yeah.
But do y'all have an opinion? I mean, I'm not talking about you personally, but did we see greater than what we had anticipated, or?
I think it was well within, since we've already had around 8 years worth of one-to-one experience in the district, it was pretty well within the, you know, range that we kind of expected.
Range.
We didn't have, you know, any big surprises to look at, yeah.
Okay, thank you.
Thank you. Okay, I don't know who was next. I have no idea. Let's go to Ms. Henderson, I think.
I have a
Or
quick
Ms.
question about coding, so maybe Freddie, sorry, you just sat down. Is there a code for COVID absences? So that way they're tracked more accurately?
Not currently. So that's why our absentee rate looks so high. And with this policy, it would allow us to add that virtual learning code. So we don't have a COVID code at this time. We can add a little more fidelity. So if we needed to track virtual learning with some additional steps, we could do that. But right now, it's
Okay,
not there.
so let's say my daughter's out for, I don't know, strep throat. She would be a virtual learner. But if she had COVID, she would also be out as a virtual learner. So there's no way to distinguish if she had flu or strep or a broken leg.
Sorry to interrupt. The policy, as it stands, is only for COVID. So if your daughter was out
Gotcha.
for
Okay, so that would just be a
strep.
normal absence.
Correct.
Okay, okay.
Thanks.
Okay, thank you, Ms. Henderson. I'm sorry, Ms. Owen.
Thank you, Madam Chair. I think I would just want to clarify something. I don't think anybody here is talking about not approving the policy. I don't think that's where we're going. I think we're just trying to be sure that everybody understands that this isn't what our teachers were expecting and try to figure out what we're going to do to be sure that they can be ready to support students. Thank you.
Thank you. Mr. Watson?
Thank you, Madam Chair. Just a question about timing. It's not in here, but I just want to be clear. Is the intent for this to be retroactive to the beginning of the school year if it gets passed?
Did you say retroactive to the beginning of the school year?
Yeah, or would it?
Mr. Oak?
I would assume not. I just want to make sure.
I don't think it can be.
Okay.
Because, that data is already sort of
Yeah.
what it is. I don't think we can go back and recreate it.
Yeah, I just want to make sure. I saw a similar policy in another school district that made it retroactive, and I just want to make sure that we're not doing that. And then the last question is, to Ms. Owen's point and a lot of the concerns that we brought up, this would need to be passed, according to current policy, it would need to be passed on 2 readings unless we forego that tonight and opt out of that. Can we, Mr. Dupler, can we pass it tonight, forego the second reading, but set a activation date in the future? Does that make sense? Could we give a 2-week window for teachers to kind of get their stuff more together in Canvas?
Mr. Dupler?
Thank you, Madam Chair. Mr. Watson, the answer is yes. According to B200 policy, that 2 readings, the policies must be considered through 2 readings at separate board meetings. That's the policy. So just has to be separate board meetings.
No, I'm sorry, Mr. Dupler. I think it's a little bit slightly different question. If we pass it tonight and forego the second reading, if we approve that, could we also at the same time set an activation date in the future where we're approving it tonight, but we're saying this does not become active until 2 weeks from now or something like that? Right, prior to the next meeting that we have, which would be in, or I guess the other question is, could the second reading be at our meeting next week on Wednesday? Does it have to be a regular meeting?
I like the second question.
Okay.
Yeah.
You didn't like my first question?
No, not really.
Okay.
Because that kind of gets into retroactive and things like that. So, I think in the past, all the board policies have become effective either at the time of passing or some date in the future.
Sure, yeah. So we could do first reading tonight, and then we could formally pass it next week and give teachers at least a week.
Correct.
Okay.
Correct.
Yeah, Mr. Watson, I'm thinking if you put it in the motion, what the effective date is, then everybody would be on the same page, and I think that would be how to fix that, would be if it's in the motion, when the policy would go into effect.
But I think Mr. Dupler's saying that's not necessarily the way that, you said you didn't like my question. I said, I don't think you like the possible answer.
I'm just offering another way to do
right.
it.
You could try that. I mean, that's, I hadn't seen that done, previously, but I'm not saying it can't be done.
I'm not saying I like it either. I'm just trying to figure out what our options are.
The other thing is, this policy needs to be specific to the 21-22 school year, which is what's in the state board rule as well.
Couldn't you do it just effective September 15th or somewhere in the middle? That would give several days for them to, you know.
Sure, if you know, conceivably, if you all pass this tonight and then pass it next week,
Right.
you could then set a date in the future.
Well, that's,
Yeah,
that'd
15th
be
or
pretty
otherwise.
simple.
Sure.
All right, thank you. Yes, Mr. Oaks.
Just one thing while we're talking about setting an effective date in the future, just the caveat that however far we set it out, we lose any data we would have collected between now and then. So, you know, you asked me a minute ago, can we go back to the beginning of school and create that? We can't, but we'll sort of be in the same position for that dead spot window.
Right. Thank you. Sorry, Madam Chair.
Yeah, go ahead,
Yeah.
that's fine.
I don't think we need to say a lot about it, but there is a whole section of this that's being possibly changed due to truancy. Can we have somebody say a word to that section about why those changes are being recommended?
Hi, I'm Heather Wellis. I'm a supervisor of school culture, and basically we're making the changes to the truancy, the progressive intervention truancy plan, because it's a new law. It was effective July 1st, so it's Tennessee new law.
So is the language that's in here basically verbatim from the new law?
Copied and pasted from the new law.
Okay, thank you.
Thank you. Thank you for asking that question. Okay, any other questions? Okay.
Yes, there's a motion on the floor made by Ms. Christie and seconded by Ms. Babb.
Okay, thank you. Okay. Yeah.
I kind of stepped out for a moment, so I got a little lost, but it almost sounded like some people maybe wanted to amend the motion. Is that, or do we want to just leave it the way it is?
So we would either need to, well, one question would be if we want to waive first reading, would be one question, so that it goes into effect, you know, rather than having a second reading. So that's one question. And then that would be, and the other question would be an effective date. Mm-hmm. Mr. Watson?
Yes, I mean, to accomplish what I'm trying to do, and I think what I've heard some other folks talk about, I think we vote on it for first reading tonight, but then we ensure that it's on the agenda for next week. So, and I don't know if that needs to be a separate motion to make, at this meeting, to make sure it's on the agenda, or if after next week's meeting, we add it back to the agenda.
We would just add it then,
Yeah.
yeah. We would just add it at that time. Okay, I think that would work. Okay. All right, so are you good? Everybody good? All right, so, all in favor? Aye. Any opposed? Motion carries, and so we'll have a motion next week to add that to the agenda, okay?
Item 7, approve COVID-19 isolation leave for employees of Knox County Schools through June 30th, 2022.
Second.
We have a motion by Ms. Christie, a second by Ms. Satterfield. Do we have, would someone from the staff like to speak to this? Mr. Bolton, maybe? Thank you, Mr. Bolton.
Thank you. This gives us an opportunity to look back and provide a little support for employees that may be under an isolation order as a result of being positive for COVID. We know that there are breakthrough cases that do occur, and this would also give those folks an opportunity to recover any days that they have used for COVID, for being positive for COVID. So we're proposing that this would retro back to the start of school.
Okay, Mr. McMillan?
I'm sure it does because it says that, but they have to show proof of the fact that they, you know, from a medical.
That's correct.
I just thought we would throw that in and make sure the general public knew about it, you know, that it wasn't just like here's 10 free days. Okay, thank you.
Thank you, Mr. Bolton. Ms. Owen?
Thank you, Madam Chair. Mr. Bolton, is there a way that our bus contractors can have any kind of relief when our drivers are isolated? Is that something we could consider?
I think because they're contracted employees, I don't think that is something that our policies would extend to, and I may have to defer to Russ about that.
The answer is yes. We did some of that last year. We've not looked at it closely this year, but let Ryan talk to the details about how we did it and what that might look like.
I think my question is really, can we consider that?
I think we can consider that. However, we want to consider it carefully because there are certain incentives that, we offered vaccination to all of our contractors and all of our drivers, and we didn't have a broad acceptance of that, and so we've offered something to help mitigate the risk, and now we want to turn around and potentially address compensating you for not mitigating the risk that we offered you. So I think we have to be very intentional about what we do and how we do that. So that's something that we have discussed a little bit. We can discuss it some more, but you understand my concern in going down that road.
I do, thank you.
Okay.
Thank you. Ms. Satterfield?
Thank you, Madam Chair. I might be the only one with this, but is a medical physician, a note from a medical physician, a mandatory from the state, and what we have are, I'm trying to not just be angry, but I just feel like that's another barrier for our teachers. Like if they might not go to the doctor to get that medical note. And so I don't know if that's a mandatory part from us, or is it from the state, or what happens if we don't have to have that in, right? Is it mandatory? Is it required?
Thank you, Madam Chair. Thank you, Ms. Satterfield. I don't think it is required locally. It's not required from the state. I would probably say that it is something we probably would want to consider, just because when we're looking at extending this benefit, a person would likely needed to have had a positive test to actually recover those particular days. And so some kind of medical certification proving or providing some evidence of that would satisfy that requirement, whether that would be a positive test.
So just a positive test, not a note from the actual medical, so just a positive test itself can verify, can work for this?
I would think that would work as long as it attaches to the person. I think that is when we're looking at it. That's certainly something that we can evaluate and look at that. I know there's a lot of different kinds of tests that are available, so that's something that we'll take under advisement.
Okay, yeah, I just don't want a barrier for a teacher that tested positive for COVID having to go to the doctor to get a note, to get their days. That's another step and another barrier that I think it's unnecessary. So if we can just have a verifiable positive test, I think from my perspective, that is something that I would support.
Thank you, Ms. Satterfield. Mr. Watson?
Thank you, Madam Chair. Mr. Bolton, is this, the thing we just looked at was done in policy. I know we have policy G590 related to leave of absences for classified personnel, and I'm sure there's probably some other policies. Is this something that needs to be done in the form of policy, or is this memo type? And I don't know, Mr. Dupler, if that's a more appropriate question for you.
I'll defer to Gary. We actually talked about a policy, and because of its nature of a sunset, we kind of, I'll let Gary talk about that. Sorry, Gary.
Yeah, thank you.
Mr. Dupler?
Thank you, Madam Chair. Mr. Watson, this can be done either way. This is an effective substance of provided it passes, the board's policy in a general sense. If the board wants this in a policy, it would have to appear in more than one. You mentioned G590, I believe there's G491 and some others. So, but I mean, it can go either way. I mean, just as long as, the sunset's in there and that sort of like the last one that we, that the board just reviewed. However, the difference here is that this is optional, and the one that the board just reviewed, a policy is required by the state.
Right. Thank you. I don't really have a preference. Just because we saw the other one in the form of policy, I just wanted to clarify. And then Mr. Oakes just pointed out, some of the potential problem with providing this to bus drivers, given that we didn't have a high vaccination rate. And does that, we're kind of providing an opportunity for vaccination, but then we're also potentially providing this benefit. Is that something that was discussed as a potential for this particular policy? I know there's other districts in the state that have done that, similar things, that are giving additional leave, but only if you've been vaccinated, or actually only if you've been vaccinated or you submit to regular testing. To me, it's the same point that Mr. Oakes was just making about bus drivers, so I'm trying to figure out what the discussion was.
So I'm going to try to handle this carefully. I think we've got to walk a tight line because we do have a state policy that prohibits us from soliciting information about a person's vaccination status. And so I think what this does do, this does protect those folks that have been vaccinated that happen to have a breakthrough case. Right. I think what is to that point would be the absence of what is not in this policy. Mm-hmm. This policy does not extend to those that are under a quarantine order. Right. Because we know in the CDC guidelines, anybody that is vaccinated does not require, anybody that is vaccinated and is a close contact is not required to quarantine. They are required to, or they're recommended to wear a mask for a 14-day period and test after a certain date. Right. So embedded in that would be that incentive. If you are vaccinated, there is no, if you're a contact, you're not going to have to quarantine. So it does have that embedded into it for our purposes.
Thank you.
Thank you. Ms. Satterfield?
Thank you, Madam Chair.
Well, I'm sorry,
Oh,
Mr.
sorry. Go
McMillan
ahead,
actually was next.
Well,
Ms. Satterfield.
this was in reference to what you were talking about. I don't want to put any burden on anybody either, as you said, but if we're going to give them the days, I think they should be willing to provide us with something, especially if they're going to use toward the higher number, like 7 or 8 or 10 days. Just from a standpoint to the taxpayers and the general public, I think that balances out because, it's depending on your employer. If you work somewhere, they might pay you for the days that you're sick. You might not get paid. Just depends. But I think this just shows good faith. Thank you.
Thank you, Mr. McMillan. Can we go to Ms. Christie?
Well, just to speak to that, and I think maybe Scott or Jason could verify, but I think you can get a note from the health department if you've had a positive COVID case to return to work. So I don't think they would have to go to a physician to get that note.
Okay, that's helpful.
Thank you. I think that's just the clarity that I need, and I think that's the understanding that teachers need to know, that the responsibility of going to the doctor. So if a positive test is enough proof, then that's what we should run with, and that's the standard that we should make. And I also just want to say my frustration isn't with what's like you all, is the fact that we're even here at this moment of having to figure something out when it ran really smoothly last year because of other barriers that have been put in place. So I'm just, I feel very frustrated, and I know a lot of people in the district feel very frustrated for things that are really out of our control. But I also want to ask, will they need to, so say they test positive and quarantine for 10 days, will they have to submit a negative test to come back to work? And is there conversation around providing rapid tests for schools?
So I want to answer the former first. The CDC does not require a negative test to return to work. Once a person tests positive, the 10-day isolation period would begin from symptom onset. So it wouldn't even date back to the date of test. If a person had symptoms 48 hours prior to a test, then that 10-day period would begin 48 hours prior to the test. It would be at symptom onset. So that would not require a test to return back to service. And I may defer to Jason because he's had some conversations, but I don't know to the extent of those conversations with some testing. So.
Thank you, Mr. Bolton. Mr. Myers?
Thank you, Madam Chair, members of the board. Yeah, so we have had some preliminary discussions with the health department about the possibility of getting access to some of the tests. I won't call it a rapid test because there's a specific name to it, and to be quite honest, I don't remember that name at this moment. But there is some conversation there about trying to provide some faster access to the test, specifically to our staff.
I would like to see, if we are able to really move that forward, I would like to see our schools be able to access rapid tests.
Thank you, Ms. Satterfield. Okay, any other questions? Mr. Watson?
Thank you. I just want to echo what Ms. Satterfield said. I was speaking to Jason earlier today about that. And I don't know this for sure, but I've heard that there's potentially different pools of money from the federal government, potentially the state government and others for us to, schools and specifically, to be able to acquire those. So I'd like to see us do anything that we can with the health department and any funders to potentially provide that access. Thank you.
All right, thank you. Okay, all right, so all in favor? Aye. Any opposed? Motion carries. All right, can we take a 10-minute recess before we come back to the next 3 items, please? So we'll meet back here at 9:35.
Item 8, consideration of a school-based COVID-19 dashboard for the 2021-2022 school year.
Okay, we have a motion by Ms. Christie, a second by Ms. Satterfield. Discussion. Ms. Henderson?
Hello. Since I brought this up, I just wanted to speak on it for just a minute. You know, the one thing that we've heard from both sides on this issue is that every parent wants more information about their schools and their classrooms. I personally believe we should have been doing this from the very beginning. And since we haven't, I believe that the board has a responsibility to step in and require some of these measures now.
Okay, thank you, Ms. Henderson. And I was going to say when we came back, if we could try to keep our comments short and sweet, so that was perfect. So, great example, Ms. Henderson. Mr. Dupler, would you like to weigh in on this issue from the law department's perspective?
I can, and thank you, Madam Chair, and Ms. Henderson. And, you know, Ms. Henderson and I talked about this before she brought this motion, and, you know, we've been, our office has been, you know, pretty clear about where we stand, that because of FERPA and corresponding state law, we've always recommended to the district and administration that numbers be district-wide, because that is a best practice. And there is some divide among school board council across the state, but there's also a significant number that agree with us that's the best practice. Now, with that said, there was, and Mr. Watson and I were just talking about, there's a statement issued back in March of 2020 from the U.S. Department of Ed that talks about, you know, COVID and FERPA, and what it talks about is that, you know, it would open the door to allowing data at the schools. However, it says, and I'll just read it, the following, and, you know, this also, by the way, comes from Knox County Risk Management, which also agrees with our office, the Law Director's office, that other information that alone or in combination is linked or linkable to a specific student that would allow a reasonable person in the school community who does not have personal knowledge of the relevant circumstances to identify the student with reasonable certainty. So what does that mean? I mean, in our judgment, what that means is that if you start releasing a school, I mean, and frankly, it doesn't matter how small or large that school is. If you release a low number, let's say it's 1 or 2 students that have COVID at that school, then the test is, can someone from that community, not another community, but that community, then figure out who that student is? Well, the answer is it's already happening on Facebook. So that's a FERPA violation at that point, you know, even though you haven't named that student specifically. So that's where we are. If this board does adopt a policy like this, our recommendation, well, again, is still district-wide, but if the board does want to do this, which the board can do with a majority vote, our recommendation would then be make this as anonymous as possible. How would you do that? By ranges instead of specific students or specific numbers. And you could also look at, you know, a threshold as well. Thank you.
Okay, thank you, Mr. Dupler. Ms. Henderson?
I just wanted to just respond to Gary, and Gary and I have been in conversations about this, and, you know, I came up with this idea, well, I thought about it last year, but, you know, there are different districts that are doing it, large districts, smaller districts, you know, Oak Ridge, Maryville, Hamilton County are a couple that do it, and we did talk about maybe putting a privacy statement perhaps at the bottom. I did bring the document that you were talking about from the Department of Education at the federal level. But my other thought is, you know, this is happening on Facebook, and that information is getting out there, but not from us. And this is a way for us to show transparency and for us to have that information to give to parents. And that way it's coming from a reputable source, not on these Facebook groups that are all over the place.
Okay. Mr. Owen?
Thank you, Madam Chair. Mr. Dupler, could it be potentially more anonymous if it were done as a percentage rather than as a number?
Yes.
Thank you.
Okay. Mr. Watson?
Thank you, Madam Chair. Mr. Dupler, as I was reflecting back last year, and I got a lot of emails from principals, and I know they're starting to send them out again this year, saying that, you know, today we have a COVID positive case in our school. How is that different than the dashboard in the sense of we're notifying that community every day potentially if there's an active case? The dashboard would retain that information and it would grow, but how is that different? I just want to make sure that, are we crossing a line too with that notification?
Mr. Dupler?
Thank you, Madam Chair. Mr. Watson. What FERPA provides is that each bit of information that you send out in the aggregate is a step closer to identifying students.
Okay.
And I would also say that, you know, as far as transparency goes, transparency in government's one thing. It's not releasing students' private data. You know, from what you're saying, Mr. Watson, you know, it's my understanding that what the district did last year and is apparently continuing to do this year is sending out a letter to parents when there's been some type of COVID case at the school.
Yeah, an email, yes.
But that's all it says.
Right.
It's just, hey, there's been some COVID case. Doesn't say how many or,
Right.
you know, whatnot. So, again, I mean, so our concern, our law department's concern is, so then what you're doing right now is what you're saying, district data and then letters to parents.
Right.
So now what you're going to do is you're going to take a step forward or further toward risking, you know, a violation by apparently still doing the letter, but now giving school-based data instead of just district-wide.
So on page 4 of that documentation, the last paragraph, starting with, for example, I know not everybody's looking at this, but
I have it.
you have it. It says, are you there, Mr. Dupler?
I got it.
So it says, for example, if an educational agency or institution releases the fact that individuals are absent due to COVID-19 but does not disclose their identities, this would generally not be considered personal identifiable to the absent students under FERPA as long as there's other individuals at the educational agency or institution who are also who are absent for other reasons. So are you saying that the letters that we're sending out would fall under that we're notifying that there's individuals being sent, but because it's not aggregated, that's when it becomes the challenge?
That's correct. And then if you go on to the next sentence, you know,
which is the one you read
exactly.
already. Yeah, right.
Yeah, cautioning to do so in a manner that does not disclose other information alone or in combinations. That's what we're talking
Right.
about, you know, with the letters and then the dashboard.
Right.
That's a combination that would allow a reasonable person.
Right.
Right.
Thank you.
Thank you. Ms. Henderson?
Yes. Can I also, Mr. Dupler, ask your opinion on one thing that I've heard from several principals is the fact that they can't, you know, they see a class and they know someone is positive in that class and they cannot notify anyone else in that class. Can they send a more specific email to say, you know, we've had COVID cases in our school in 4th grade? Can they do it by grade? Can they disclose a class where that is happening so that parents are aware and can make informed decisions for their own children?
Mr. Dupler?
It's
Thank
also
you.
addressed on page 6 of the document
Are
if you
you,
want.
Ms. Henderson, are you saying a specific class or are you saying a grade band?
Either way, I'm just trying to get more specific information for parents.
I think in our office's opinion, disclosing to other parents a student in a class would be a clear violation of FERPA.
Okay, do you still send letters for lice? Is that still a thing in a classroom? No, we don't do that anymore? Okay, because you're not disclosing the child, just, hey, in 4th grade, we've got some cases, just so parents know what to look for. Like if I have a 4th grader, it's like, okay, well, I know it's bad in my child's grade, but if it's bad in kindergarten, maybe I'm not as concerned.
Okay. Mr. Watson?
Makes sense.
I-
I don't know if that's.
No,
the
I don't
thing.
think so.
I don't think we are. Okay.
Well,
I just thought it's kind of the same thing.
I mean, I think what you bring up is a good question, because basically, let's say we have a dashboard by school, the next question is going to be, well, which grade,
Yeah,
which
what grade?
class? I mean,
Yeah.
so I think that's going to be a natural question. Mr. Watson?
Yes, this question is actually, thank you, Madam Chair, this is directed to Ms. Henderson. So, Ms. Henderson, you said in bullet point 3 of your motion, school administrators will notify parents of a possible exposure in a student's grade, and then provide them with recommended actions they can take, a link to the school-based dashboard. And so what I'm trying to figure out, I mean, even as a parent with kids in school, if I see this dashboard for the school that my kid's in,
Right.
and they, you know, I see that today, you know, there's 15 cases in that school. I'm trying to think practically what I would do with that particular information, because that information is not going to necessarily help me contact trace them myself. I mean, I'm not going
Right,
to
yeah.
know any more or less. I do think, and I'm all for transparency. I'm like, hey, let's get as much as we can out there.
Yeah.
I'm just trying to figure out what a person would practically do with the information. I think it could cause potentially more anxiety because people don't have enough information to actually pinpoint what the issue may be.
Yeah.
And so they're like almost to the finish line, and they're like, oh, but I don't know what I can do or not do. And I will tell you, I came into this, and I think I even mentioned this to others, that like, hey, I'd like to see it by school. But as I've thought about the practicalities of it and what I would do as a parent with that information, so help me understand
Yeah.
what I might
just-
do with that information.
When I see the dashboard now, as a parent, so I'm talking from a mom standpoint, when I see the current dashboard and I see, 900 children are sick, I don't really know what that means to me. Is it 700 kids at Gibbs Elementary? Is it 200 kids at Farragut Intermediate? I don't know what that means to me as a parent. The more information I have that is affecting my particular school, I can then make informed decisions. Okay, well, Molly's grade, my daughter's grade is, or her school has more cases. I can either choose to, should she wear a mask for a couple days? Should I be looking a little bit more proactively for symptoms? Maybe I keep her out for a couple days. So I just think that as a parent, me having that information, I can use to make a good decision for my family. And I've talked to a couple of the other school districts that are doing the school-by-school dashboard, and their parents are really pleased with the information that they have that's affecting their particular school.
Yeah, I did as well. I talked to, I think it was Williamson County. Yeah.
Thank you. Ms. Owen?
Thank you, Madam Chair. I think to Ms. Henderson's point, when we were first looking at COVID last year, one of the things the health department talked about was looking at it by community instead of as all of Knox County, and looking at, being extra cautious if it was spreading in a certain area. And I think that would give that information, whether something is happening in an area of the county or if it's more broad than that. I think it feels a little different when it seems like something's spread countywide, and then if you knew that 600 of those 900 cases were in your school. I think that's quite different. However, what I would really rather see is us doing contact tracing so we could call that parent and say, your child's been exposed. I think that would be the most useful thing that we could do.
Thank you, Ms. Owen. Ms. Henderson?
Thank you, Madam Chair. And I just want to say, I don't think for any of this there is a perfect plan. I don't think that there is a plan that is 100%, but I do think that we need to do something. And so I don't have all the answers, but I thought, well, here's a starting point on something for parents. So that's kind of where I'm coming from on this policy here,
Okay.
or recommendation.
Thank you. Ms. Babb?
And this is just a suggestion hearing from Mr. Watson and you is, and it would be a little less specific, but like I had a principal show me the report she got from the county, basically showing every single school that needed to make the call out that day. And I was even wondering if it was just okay, so if you're looking at our overall dashboard, you see there's, the cases have gone 100. Well, you look and there's only 5 schools that have had to make calls out that day. That would give people a sense of it's not countywide. Now, what I'm kind of getting a sense of, it's pretty countywide, but I think maybe that would sort of even help people. It wouldn't get as specific as into how many cases, but you might see on Monday, 74 of the schools had cases. They had to make the calls out to it. Because right now, all you're learning about is your school. But that might be a way where it's not quite so specific because you're not knowing cases, but you're seeing how many schools per day are actually having to make calls about cases. That's just one suggestion.
So you would see all the schools that made the calls. So you would see
Yes,
if the
I mean,
schools are
I don't
around
really
you
know
or
how,
not.
I just am trying to work between kind of
yeah, and
more
I'm just
information
trying to, like,
wanted
work on
and trying to
something.
protect the FERPA that it sounds like we're doing too. I mean, what the reality is and what we all know that's going on is we all know the parents are going about sharing everybody's business all over Facebook. But I mean, that's not our job to do that. And it's alarming sometimes that maybe some parents are oversharing, whether it's about their own child or other children.
Parents aren't under FERPA.
Right.
School system is.
Right, and that's what I mean. I mean, I know that they can do it, and that's where I'm trying to think of a way that's sort of getting more information out that's more at a granular level without getting so specific, and that was just a suggestion.
Yeah.
I don't know the answer.
Yeah, I know. I mean, I'm very torn on this because I want parents to have the information they need, but to Mr. Watson's point, I'm concerned that it's just, they're going to want more information, and what would you do with it? It would be difficult as a parent. I'm not sure if it would be helpful. I don't know, but, and then if risk management and the law department are not completely comfortable with it, then it's kind of a difficult position. So
I do have one more question for Mr. Duplar. Can you speak to the schools that are doing this, and like Maryville or Oak Ridge or some of the other schools that are doing this, and how they are doing it legally?
Yes, thank you. Thank you, Madam Chair, Ms. Henderson. So, again, I mean, school board attorneys do talk on occasion, and we've communicated on this point. And what I was told by the attorneys that have districts that are doing this is that they are using either thresholds and/or ranges for reporting this. I was a little concerned when I looked at some of these dashboards. I couldn't readily see that, but maybe that's going on in the background. I don't know, but that was the discussion we had from the ones that are doing it.
What does threshold mean? I don't really.
Threshold, for instance, let's say you've got a small school, you would set your threshold maybe a little lower than you would a large school. A percentage would be a good way to look at it, maybe 5% or 10% or something like that. That would be your threshold. You wouldn't report below that.
yeah, because we do have some very, very small schools. So if you reported a case, it could be easy to figure out which students.
Absolutely. Especially, again, the way FERPA works is that you're looking at the community, right? You're not looking at somebody clear across the county being able to figure it out. It's someone in that community.
Okay. Mr. Watson?
It's interesting trying to tease this out in my own mind, but if you have a percentage and and if you're a parent and you know the school's enrollment, you can work backward. I mean, you still get to the number, right? What's that? That assumes math? Yeah, so, yeah, okay. I think to me, the way I would feel the most comfortable with it is the range solution. Percentages, you can do the math, you can work backward, it becomes that. I'm not even saying I love it, I just think that's probably the way I'm most comfortable with it.
So then that would be, like, for instance, a range, if you had, let's say you had 10 cases in a school, like, are you saying a percentage range or like an actual number range?
I don't think we have the time to figure out all those ranges right now, but I
just
think
saying a
depending on the
range.
school, so maybe the first range is 0 to 20, and then you got 20 to 40 or whatever, and and then you just say what it is, but, I don't know that we can determine that here. And and I know Ms. Henderson provided an example of one, but I don't know necessarily that you were asking us to lay it out exactly like that, correct? If it was approved.
Yeah, just using that as an example for anybody that hadn't seen a
Right.
school-by-school dashboard.
Yeah.
Right,
Yes.
thank you. Ms. Christie?
Yeah, I think we do need to give parents more information and, to speak to, what are they going to do with it? Well, it's better than the information they're getting now, because literally there's not much at all they can do with that in a district this size. And I do think, when we talk about parents making choices for their children, we need to give them all the information we can to make those choices, be it a range or the numbers or.
Thank you, Ms. Christie. Mr. Watson?
I'd like to offer a friendly amendment, if that's okay.
Mhm.
Ms. Henderson, I'm going to offer a friendly amendment. So with your motion, based on our conversation, I would strike bullet point 2, because I think that actually tries to address some of what we're talking about. And strike bullet point 3, but keep the rest of it the same, and then have if it passes, have the administration work with the law department to figure out what's an appropriate way, what's the least likely way that we're going to infringe on FERPA in terms of how we're reporting that at a school level. That we do report it at a school level, but we work with the law department to figure out what's the best approach to do that. So.
Okay, and actually, the motion that we really have on the floor is what the agenda item is consideration of a school-based COVID-19 dashboard. So we probably really need an actual motion.
Oh, I thought the motion was attached. It's attached to the agenda.
It is. Yeah, it's
Oh, okay.
attached.
Right.
But
She
Ms.
hasn't read it in,
Henderson
yeah.
may want to actually make the motion, and then if she's agreeable to what you're saying, she can just incorporate that into the motion.
Okay. I make a motion to, help me out here, Gary. I make a motion to,
You can use your verbiage that you have here.
oh, okay.
Yeah.
I make a motion for the consideration of a school-based COVID-19 dashboard for the 2021-2022 school year, along with Mr. Watson's friendly amendment.
Okay.
So I'm making a motion to vote on it with Mr. Watson's recommendations.
Since it's my friendly amendment, can I read the friendly amendment and see if you're agreeable to that?
Yes.
Okay, so the friendly amendment would be, and I'm just going to read it verbatim, during the 2021 school year, Knox County Schools will create and maintain a school-based COVID dashboard. This dashboard is designed to provide parents and guardians and staff the tools they need to make the best health decisions possible for their children and themselves. The dashboard will sunset at the close of school on May 26, 2020, and I think that's probably where I would stop. I'm sorry, 2022. Sorry, I didn't read 2020. Yeah, just didn't come to my lips.
Yeah. I accept his friendly amendment. Is that how I say it?
Well, so what I understand is that Ms. Henderson, Ms. Watson, you're making a motion of just the first portion of what's written.
Correct.
Is that correct? Okay. Okay.
Reports, but it's up to the
Okay.
administration and the law department to work it out.
Okay.
Yeah, to work out
Okay.
the specific ranges.
Okay.
Okay.
So you may want to just say that with the motion, that you're asking the school administration and the law department to figure out the ranges or to calculate the ranges.
So I'll read that in. So then in addition, the other part of that friendly amendment would be, the expectation is for Knox County Schools Administration to work with the law department to determine the appropriate way to represent the school-based data on the dashboard.
Does it need to say in a range, or is that good? Okay, all right. Okay, fantastic. Anything else? Ms. Owen?
I would just note that Washington County has one that uses ranges. That might be a good sample to look at.
Thank you. Okay. All in favor? Any opposed? Motion carries. Thank you.
Item 9, consideration of a universal masking requirement for all students, staff, and visitors while indoors and on school buses for the 2021-2022 school year.
Second.
Okay, we have a motion by Ms. Satterfield, a second by Ms. Owen. Mr. Watson?
Thank you, Madam Chair. I'll read the motion in full is attached, and so I'll read that, and then I'll just make a comment as to why I'm bringing it before the board. So the full motion is to require universal masking for all students, teachers, administrators, staff, and visitors while indoors, including buses. Students will be able to opt out provided their guardian submits an official KCS opt-out form, which KCS would have to design. All requirements regarding masking will be rescinded anytime the community transmission rate for Knox County reaches yellow, moderate transmission, or below for a consecutive 2-week period. The requirement will go into effect anytime the community transmission rate for Knox County schools is above the moderate transmission for a consecutive 2-week period. And then there's exceptions to universal masking include teachers while providing instruction, provided they are a minimum of 6 feet from students, outdoor activities, including recess or other outdoor learning opportunities, or when a student, employee, or visitor is eating or drinking. Employees and visitors may be exempted from the mask requirement by the school principal due to a documented medical condition. So I've just got a couple brief comments. So, I'm absolutely confident that none of us on this board, when we ran to serve, ran so we could help mitigate the COVID-19 pandemic. But we don't often get to choose what we get to lead through. This is our season. I know in the last 3 weeks, I personally received over 1,200 emails, which is by far the most I've ever received in that stretch regarding coded protocols. I have not been able to answer all of them, nor would I think anybody else on the board has been able to do that. We've all been affected by this pandemic, some much more than others. I don't know what it feels like to lose a loved one due to COVID. I don't know what it feels like to lose a job or a home. I don't know what it means to care for someone who is hospitalized due to COVID, but far too many have. I, like many others, do know what it feels like to experience grief through this time, frustration, distress, and uncertainty in the midst of a constantly changing situation. And I think we can all agree that things are constantly changing. I mean, we just got more information from the state that impacted several of the things that we did tonight, which also we referenced when we did them, CDC guidance quite a bit too, as we did some of these other things. So for the 2021 school year, Superintendent Thomas's leadership and the board consistently followed public health guidance. We made our own local decisions last year. We followed the recommendations of public health leaders, which was an appropriate thing to do. KCS was able to accomplish something no other district that I know of in the state was able to do. And everyone agrees that students should be in person instruction as it provides a great opportunity for students to succeed. We also need to remember that students do not live in bubbles. A lot has changed in the last 2 weeks, and you all have heard the data tonight. I'm not going to repeat the data in terms of COVID in our communities. We also know that many people have spoken, people who have not previously spoken, have spoken to universal masking in schools. Dr. Percy, just on the 25th, said the best way to protect children is for schools and parents to mask up their students. When more kids are masked in classrooms, they're more likely to stay in school. She also referenced that, this is on the 25th, there's been 14,000 pediatric cases in the last 7 days alone, with 1,300 emergency room visits. 36% of all cases in the state are children, with the largest increase coming from children's 5 to 13. So the board chose at our board meeting on 8/11 not to give the superintendent the authority to implement a layered COVID mitigation strategy that included masks. So I'm asking for the board to consider doing that since we didn't give him the authority to do it. And I think it was really poignant the many times that people spoke tonight in emails and conversations that I've had. That one is teachers and administrators that I've talked to are absolutely overwhelmed. I mean, right now, they're saying it's worse than last year what they're experiencing in their schools in terms of overload and trying to make up for people that are out and cover all the bases and all those types of things. And I know that we all love our liberty, and I love it just as much as anybody else. And if anybody came to my house and tried to tell me I had to do X, Y, and Z, then I would probably be frustrated by that. But we're here as stewards of Knox County schools, and we have to try to set the tone for our schools. And I would like the board's consideration. And I think this is in line with what the governor did in his executive order. It provides an opt-out for anybody who requests it. So.
Thank you, Mr. Watson. Ms. Christie?
Yeah, just a couple of points. You know, I did hear a lot of people say how happy they were about last year, but I'm just going to tell you my emails last year were not any better than they were this year. No one was happy when we started back last year. And at that time it was, we can't even have face-to-face school until we go 14 days with no new cases. And if we had stuck to that and voted for that, we still wouldn't be in school. I mean, that's where we are. And just a couple of concerns. You know, the health department has not issued a mandate anywhere else in the county. You know, Neyland Stadium, there's a football game. You know, Patty's somewhat controversial, I guess, according to email pictures at the swim meet. Kids are at church, they're at sleepovers, they're everywhere else without a mask. And when you say listen to the public health officials, well, I think our local public health official made it pretty clear that she couldn't mandate one in Knox County because she knew people wouldn't follow it. You know, I did have a good conversation with Dr. Childs today. The Children's Hospital capacity is fine right now, you know, and he did say, you know, there might be a time, or if there ever was a time where it wasn't, he would definitely let us know. And the other thing is, when we talk about the overwhelmed teachers and administrators, at the end of the day, this is still an optional mask policy. I mean, it's still a mask policy that people can opt out of. I mean, it's still optional. So basically, you know, what I've heard from a lot of people in my district is that basically what we're doing is transferring that responsibility to the schools, and it's just going to be who's going to keep track. You know, and it might not be such a problem in some schools because I think some schools will embrace it a lot more than others. But, you know, if you have schools for half and half or 60-40, who's going to be in charge of keeping track of who has to have a mask on, who doesn't have to have a mask on, you know, and heaven help the subs if somebody takes off a mask that should have one on. You know, I just have heard that there might be issues there with that.
Thank you, Ms. Christie. Ms. Bounds?
Thank you, and I haven't said a whole lot tonight, so it may take a few minutes. But first, the question has, I just want to go on record with this first statement. The question has been raised, do I have children in a Knox County school? And the answer is a resounding yes. I have 15 grandchildren, 5 in Knox County schools, 2 in Anderson County schools, and 6 others in school here in Knoxville. So I am well represented. I also want to go on record that I have never made a decision based on politics in all my years on this board. And then directly addressing the COVID, I just don't understand the difference, kind of like what Ms. Christie was pointing out. We are being asked to force people to opt out when already people can opt in. And we keep coming at this from every possible angle, in my opinion, to get a mask mandate. And what I see it doing is it's further dividing our community, and it's keeping parents in a state of anxiety. Every month we listen to how many emails received, but number of emails alone does not equate to support for either side. As we listened to the speakers tonight and tallied them, it was about half and half. My emails over the last week until today were 9-1 against a mask mandate. And what I liked the most about those most recent emails were they were from grandparents asking us not to mandate masks for their children. And they were also from students of Knox County asking us not to mandate. I live life, and the majority of Knox Countyans are unmasked wherever I go. And one of our Knox County schools had 700 grandparents sign up for Grandparents' Day in a couple of weeks. So to me, that speaks volumes about my district, and at the end of the day, I work for every child in this district, but I also have to listen to the people in District 7 and what they want, and so I will vote accordingly. Thank you.
Thank you, Ms. Mounds. Ms. Bowden?
First, I just have a couple of questions, Mr. Watson. On the yellow moderate transmission, where is that coming from?
That comes from the Tennessee Department of Health data. So they update this every day, and there's so in between moderate and high is substantial, and it's based on number of inactive cases per 100,000, and also positivity rate. And so the big guidance that the CDC adjusted on August the 4th, I think, that's what they referenced. They said to universal mask, even vaccinated, due to high community transmission. That's what they were basing it on. And so I thought to be true to that guidance, which also funnels down to the Tennessee Department of Health, to use that as the metric because it's readily available. Anybody can see it publicly online.
I guess I would want to add, because like, I honestly had no idea what
Sure.
you're talking. I mean, I don't look at the Tennessee Health Department. I know some people have all got their different places they're looking.
Sure.
So I think that does need to be referenced where that yellow moderate transmission is
Sure.
tied to. And I mean, I just think that needs to be added, just because personally I didn't know. I was a little confused about that. And I guess would be another question, just thinking through all these different things, is does TSSAA things, like I know last year, basketball, the sports were not wearing masks even when we had mask mandates. And we are saying in here indoors. So I guess that is another question I would bring up to this. I will say, I mean, and I think we all come from very different districts, makeup. I mean, we have a very different district, and we're made up of very different constituents. And I do know that I've kind of looked at our emails and I listened to our speakers, and what it just confirms for me is how split our community is over this. I mean, that just, every time somebody brings this up and every time somebody tells me they've got the answer for it, I'm like, no, you have your answer for it, because I will tell you whatever your answer is going to make just as many people mad. But I'm a little bit like Patty Bounds. I kind of come from another district where, I mean, it's split and I get different opinions, but I do really have a lot of people that are asking for more, and they're asking for the mask mandate. And I have to look at who I value the opinion of, and I do value the opinion of like Dr. Childs. I know you spoke to him, but like I watched the Facebook Live, which I thought was a great thing the other day, and at the end of the day, he recommended masks at the end as the best way to mitigate COVID spread. I mean, I do value the health department of Knox County. I do value the Tennessee Health Department. So that is who I look to. I have a lot of pediatrician friends and doctor friends that have reached out to me. They all want us to be doing more. And I do look at the fact that, and I do think it is a little hypocrisy of everybody that runs around and does everything differently in their own community, and they go to church and they don't do it or whatever, but kids do not have a choice about where they go to school. You have a choice of your kids' after school activities. You have a choice of going to church or not going to church. Right now, our kids really do not have a choice as far as public education goes. And so that is why I do support it. I would like it added in here about what the yellow is tied to, just to make it clearer.
Thank you, Ms. Babb. Ms. Owen, I believe you were next.
Thank you, Madam Chair. I'd like to go off of something that Ms. Babb said. Students are required to be in school, and they're also together for a much longer period of time than they're in many of those other activities. And not just a longer period of time for the day, but a longer period of time day after day after day. And that's important when we're talking about spread. If we were asking our students to do something, when we ask them to do something, they are more likely. When we say, hey, you can do it or not, they're not. If we were asking students to opt into testing, we wouldn't be talking about test scores for sure. As far as who's going to keep track, the numbers of things that our teachers track every day is incredible. They have to know every student in their classroom, who can have their picture made, who can't, where they are in reading and math and everything else. This is a very teeny tiny piece to put into all the other data that they have. And as far as making that more difficult, there are so many ways for them to track that they already have available to them. And teachers asking us to help them please do something. I don't think that tracking piece for anyone that has talked to me has been a piece of it. And though we've heard a lot of data, we've also heard a lot of really wrong data. And so I'd like to give you some just that's posted today from the Department of Health from Tennessee. So it is the data dashboard. It's downloadable. Everybody can look at it. And looking at it over time, last year for Knox County, just COVID positive cases just for 5 to 18-year-olds. Our very highest point was 103 cases, and that was on December 17th. There was no other day that was close to that. The days around it, I think the next highest that I saw right off was around 80, but 103 cases on December 17th was our peak. Yesterday in Knox County, for 5 to 18-year-olds, we had 217 cases. So more than double, and we are barely a month into school. For the last 7 days, I want to be sure you understand that's not an anomaly, because for the last 7 days, there have been over 130 cases every day. So we are looking at exponential growth. We are looking at a huge number compared to last year. And to consider that without any mitigation that's layered is, I don't even understand that. And we keep talking about deaths. I'm not sure why we keep talking about deaths, because there's so many other impacts to children. But while we're comparing last year and this year, statewide, as of today, 16 children, and the numbers are going to be different age-wise because they're tracked differently. 16 children between 0 and 20 have died. Of those, 6 of those 16 died just in August. Those are numbers we need to seriously think about. Because for this whole time that we've been talking about COVID, there have been 16 deaths, but 6 of them just in August. Thank you.
Thank you, Ms. Owen. I think Ms. Satterfield, was next.
Thank you, Madam Chair. So I know that the perspective that, so as the individual that brought forth the mask policy last year in 2020, had no idea this was going to be the case. If we can go back, I don't know what I would do. But I really do look at last year when we were in a space of August 2020 when we had no idea of anything and we just moved forward. I was adamant against opening schools, but we did it and we did it well. Now, I know there's so many other factors outside of our outside of our control that has us in a place to where we just can't mimic last year, which is really frustrating because we had a year of evidence that worked well for us. I know this start of the school year has been more chaotic than the start of the school year of August 2020 when we had no idea about any of this. And I don't understand how we got there / why we're not trying to mitigate to get some type of level of control or just to ease the chaos. And we don't know what that looks like, but I do, my perspective isn't necessarily mask or no mask. My perspective is our teachers are wiped right now. And I'm really concerned that by the end of the school this semester, we're going to see a breaking point in some of our schools that I'm not sure if we'll be able to recover back from, like the teacher population and getting them back into building our pipeline of educators. We lose educators every single year, even without COVID. So I'm just really concerned that we're not taking care of our teachers, and if it means just a mask mandate for a mask option, call it whatever you want. You don't call it a mandate, call it option. But if that's what the teachers need and that's what they're communicating to say, hey, if I have to come into this building every day with sickly kids, I want to be able to have some type of protection. And if that is what a teacher needs at this point when we're 18 days in, I think us as a board have to give that option and see how it works. Because we did have it last year, and we don't know if it worked or not, but I do know it was less chaotic than it is now. So if we put that back to see how it flows, I think that's giving a level of respect to our educators more than anything. But I'm really concerned about the aftermath of this first month of some of our schools. Because we don't have subs. There's a lot of openings right now. There's kids sitting in auditoriums just because there's no teacher available because they're sick or there's just vacancies, and that's a real reality. So that's where I stand. I'm open to whatever that looks like to make that work, but I think we owe it to our teachers to at least try.
Thank you, Ms. Satterfield. Mr. Jen, I think you were next.
Thank you, Madam Chair. I had a whole thing prepared, but I don't think it's really appropriate now based off all the conversation that we've had. Of course, as student representative, the first thing I would like to say is that, yes, currently when you walk around schools, obviously it varies from school to school. The kind of general consensus I can feel is that you have maybe 10, 20, possibly 30% of students masked, as it currently is with our recommendation policy. But I do, again, like I said our last meeting, but I do think that if you had a mandate or at least some prerogative that suggested the board would really, really want students to wear a mask, that more students would. I was actually talking to a friend of mine, I think it was 2 weeks ago at an SGA meeting, and they were not wearing masks, but they were telling me like when they went to Kroger and they saw a lot of older people, they would put a mask on. They also told me that they had no issues with a board passing a mandate, and that if the board did pass a mandate, they would wear a mask and follow that guidance. So just put that there. And then kind of talking to Ms. Owens' point, like that's kind of what Ms. Owens was saying, like, yes, not a lot of students are wearing masks right now, but if we did put this policy in place, many more would. Yes, there's an opt-out, but even then, I think, we have 10, 20, 30 right now with a mandate in place, maybe have 50, 60, 70. Not 100%, it's much better, have a much better job of protecting students so that they don't have to go home and isolate, they don't have a lower chance of getting sick, and then that way they can stay in person in school and properly learn so that we don't have that whole virtual learning issue. We know we had issues with virtual learning last year. We don't want to repeat that again, I think. And so if we want to keep students in school, in person, then I think right now the best option is to mask mandate. And also Ms. Babb's point about the issues that Ms. Bounds and Ms. Christie brought up about students, going to swim competitions, for example, or what have you, and not wearing masks. Like Ms. Babb said, I want to reiterate this. Students don't really have a choice of whether or not they want to go to school if they've already chosen in-person school, right? But they do have a choice of going to whatever other event that they or their family thinks they should be comfortable going to. And so since the main purpose of a mask is to protect other students and not necessarily to protect oneself, then I think if we have a responsibility to ensure that all students have a safe learning environment so that they can properly learn, then we should implement practices that will protect those students. So, yeah, thank you.
Thank you, Mr. Jen. Mr. Watson, before I go to you, can I, Ms. Owen, the number that you cited, the 16 children that had died, can you give me that stat again?
They're ages 0 to 20.
And is that for the state of Tennessee?
That's for the state, yes.
And that was for what time frame?
16 since the beginning of COVID, 6 during August of this year.
Thank you. 16 in the state and 6 have been since August.
Right.
Okay, thank you. Okay, Mr. Watson.
Thank you, Madam Chair. So one of the big data points for me is, I think it was 2 days ago, the number of students out with active COVID in Knox County schools was 807, which from my understanding is 3.5 times higher than any other point last year in schools. And I've heard, I agree with Ms. Christie that, there is some management concerns about how this would be done. I spoke with Williamson County Schools, who's implemented an opt-out policy with their elementary schools since the beginning of the school year. And what they're seeing is on average, across all their elementary schools, about a 25% opt-out rate, which they said we're pretty confident that it would be, way more people would not be. And I think part of that, honestly, is, it's that peer influence, right? I mean, I'm sure that there are students whose parents say, hey, we want you to mask today. And they show up at school and they're in 2 or 3 classes and they're like, but I don't know if I want to be that kid, right? And so they take it off, right? And a parent doesn't know any better than that or not. I think we have to remember the population that we're working with, that there's a lot of social conditioning and a lot of peer influence. I spoke to Dr. Buchanan today and referenced this policy, asked her thoughts on it, referenced the Williamson County numbers, and she said, yeah, 25%, of opting out, that means you got 75% that are. And I said, would that make a difference? I said, would that make a difference in our schools likely if it's 25%, if we hit that same number? She said, absolutely, without a doubt, more students in the schools masking is going to help. And I also believe that more students present in the schools actually help some of the other things that we were talking about tonight. I mean, we just implemented a first reading of a policy for students to be counted present when they're not in school physically. And then we also passed an opportunity for teachers in isolation to be able to have additional sick days. Those things would not be necessarily on the table if we had way less infection in our schools. And also, I've heard this point many, many times in our board meetings about what other people are doing all across the county in other settings. I, for one, was only elected to help oversee Knox County schools. Like, we have no control over what people do at football games. I can't make my decision based upon what happens at the local swim meet. We don't have that purview. This is our purview as Knox County schools. And I think I would assume this is true, is that all of us have the goal of helping ensure that more students are in school, in-person instruction this year. And to Ms. Owens' point and Ms. Satterfield's point and Ms. Babb's point, what we did last year in a large degree worked, and we don't have as many tools as we used to. But this is a tool that we could implement that, again, lots of people listen to different people, but if you listen to Dr. Childs and Dr. Piercy, and even Governor Lee stated it on the 25th, if you want to listen to him, he said, hey, if you have your kids wear masks in schools, there's more likely they're going to be there. So to me, that's like the main consideration, is how do we help keep kids in school for learning, which also reduces the load on teachers at the same time, because they're in school, they're not having to build up all this material for kids who are out of school to do work. I don't know. I think that's an important consideration. Thank you.
Thank you, Mr. Watson. Ms. Bounds?
Thank you. We heard the lady present the data tonight from the Shelby County District that has the mask mandate, and we heard from what David said, I guess, Nashville area that also has a mask mandate, and neither one of those statistics were a lot different from Knox County's. To that point of Shelby and these other counties that are masking. And that holds true in studies across the United States. And to Daniel's point that there's a lot of social conditioning, I would agree. There's a lot of social conditioning with adults when you go to a restaurant and watch adults walk in the restaurant masked, take their mask off, and sit there for an hour and eat their meal and put their mask on to walk back outside. So it's not just kids that are socially conditioned. We as adults have been socially conditioned over the last year by our environment. My last point is to Ms. Babb and Ms. Owen, who made the point that school is mandatory, and yes, it is, but there also are other options. And the point I would make is that, yes, school is mandatory, and keeping students in masks for 8 hours is harmful to children in many ways, I believe physically, socially, and emotionally. The one thing I noticed tonight as I listened and observed those who came masked requesting a mask mandate was a lot of those people were gasping for breath. They could not breathe as they talked, and not only could they not breathe, they were muffled in their speech. And that transfers to our students who cannot breathe fresh air during the day for 8 hours, and they gasp for the same air. And they also are muffled in their speech, and their teachers are muffled in their speech. And having taught kindergarten and first, I reiterate what we've heard so many times about the importance of those children being able to learn to read by hearing and seeing their teachers. And so, I mean, we can debate this all night. I don't even know why we're back here again. And what my final point is, it continues to divide our community and cause parents anxiety. So.
Y'all, question, Madam Chair. We got something on the floor.
We do have a motion on the floor by Mr. Watson, and it was seconded by, anybody remember?
Did you second?
Was it you, Ms.
I motioned it.
You did, okay.
I didn't motion it, yeah, actually.
Ms. Satterfield?
Did you motion it?
Yeah.
Oh, and Ms. Owen seconded, okay.
Yeah.
Thank you, sorry about that, it's been a while, okay. So we have a call for the question, do we have any discussion on that? All in favor?
Aye.
Oh, wait, I'm sorry, I don't think we had a second on that. Okay, Ms. Babb seconds, all in favor? Any opposed? Motion carries. Okay, do we want to do a roll call vote, Ms. Courtney?
Ms. Satterfield?
Yes.
Ms. Owen?
Yes.
Mr. Watson?
Yes.
Ms. Babb?
Yes.
Ms. Henderson?
No.
Ms. Bounds?
No.
Mr. McMillan?
No.
Ms. Christie?
No.
Ms. Horn?
No.
That's 4 yes votes and 5 no votes.
Okay, motion carries. Thank you, Ms. Courtney. I'm sorry. Motion fails. I'm sorry. Thank you. I'm so sorry. Motion fails. Let me get that right. I think my brain starts turning off at 10, so it's 10:47. Thank you. I'm glad y'all are paying attention. Thank you.
Item 10 was withdrawn. Item 11, discussion and possible action regarding COVID-19 contact tracing protocols for the 2021-2022 school year.
Make the motion.
Would,
I move. So move.
okay, do you,
I'm sorry.
is there, this is
Everybody's confused at
discussion-
10:47, so.
This says discussion and possible action, so.
Correct, so we don't need a second.
Why don't you go
Yeah.
ahead? Well, we would need a motion,
Right.
but if you would like to speak to it, you can, and then make a motion, or you can make a motion, either one.
Yes, so the reason I asked for this is because the thing that I've heard the most confusion about in the community is how we're doing contact tracing. And I think it's important for the administration to have an opportunity to publicly to spell that out. And I've talked to Mr. Myers about this well in advance, so he can be prepared to do that. So I would move that we allow for that discussion.
Okay. Mr. Myers?
Thank you, Madam Chair, members of the board, Mr. Watson. Yeah, so the conversation really just sort of to outline the difference between how we went through contact tracing last school year versus what we're doing this school year. And I will keep this brief, but last school year, how he described it, of us doing contact tracing is a 100% accurate description of it, okay? Our health services staff, our nurses, did an amazing job, and they carried that burden. And we obviously worked with the health department. They trained our staff to do it. They provided us with additional staff specifically to help support us in that endeavor. So I want to be clear, we're doing it in partnership with the health department. But in terms of overseeing the investigation, determining who was a contact, who wasn't a contact, the policing of contact tracing once we identified who those folks were, fell entirely to school staff. Again, our school nurses put in astronomical hours to get that done for our district. I mean, 7 days a week. I don't know when Lisa Wagner and her staff rested and when they recharged. Our administration was involved in that as well, so school principals, assistant principals spending time during the day to go through and look at classrooms, measure desks, see how far desks were apart, review video to see who was sitting next to whom during lunch, even trying to see if there was video maybe of practices to see which athletes were standing next to which athletes so that we could go through and contact trace and do all that work. Then, of course, we would reach out to families and inform them that their child was going to be placed in quarantine because we've gone through the investigative process and they had met the criteria to be quarantined. And you all remember very much what that was like last year, which is where I think that part of us placing folks in quarantine, acting as agents of the health department, essentially placing folks in quarantine. We know the burden that placed on our student attendance, their ability to participate, not just in school, but in their extracurriculars. And we also know how that impacted our staffing in terms of having to place teachers in quarantine, whether it be because they had a meeting or just a close interaction with a student, whatever the case may be. So last year, the biggest difference would be that investigative piece of truly contact tracing, determining who was next to whom and for how long, and then making the determination that that individual needs to be placed in quarantine, and then again making that contact with family to place them there. How that contrasts for this year is that the Department of Ed and the State Department of Health sent out joint communication to schools. Contact tracing is the responsibility of the Department of Health, and our role in that is to support them through providing them with information. We are constantly in ongoing communication with the health department. Dr. Buchanan and her team have been great partners over the last 2 years as we've worked through this pandemic. I don't know that I've ever called her team and they've not answered, and I don't know that they've ever called us and we've not answered. So we continue to work closely with the health department and collaborate on the best possible ways for us to provide them the information they need in order to contact trace. Is that process perfect? It is not perfect. That's why we continually work to improve that process so that we can get the information they need in their hands as quickly as we can so that they can go through the process of contact tracing however they see best fit to do it, which means, again, they would have ownership of making contacts to families of students who they have identified as being a close contact. So that, I think, makes fairly clear the major difference, right? The biggest difference is that ownership piece of conducting the full investigation, determining that Miss Christie and I have been too close for each other for too long, so she's going to have to get quarantined, and then we're going to call her guardians and say, hey, this is such and such from Knox County Schools, your child's being quarantined. That is to me, the biggest difference. And then this year, sharing that information.
Thank you, Mr. Myers. And I spoke with some nurses, and I just asked for their opinion. And it sounds like you mentioned that they worked just astronomical hours. I mean, basically my conversation with them, went something like this. We did it last year. They predict a mass exodus of nurses if we require that again this year. And, I think about the fact that every single time we talk about the budget, we always say we need more nurses. So last year, we expected them to do their job, plus we expected them to do the job of contact tracing, which is another full-time job. So I don't see how, and I understand that people are frustrated with this whole topic. I don't see how we could ask our nurses to do that again this year. It just is not sustainable. in my opinion, and from their expert opinions. And then the other thing they went on to say is that, you know, I talked to 3 nurses and they really felt like the kids need to be in school unless they actually are sick. So that was, you know, their expert opinion on that. So anyway, that's my concern. Ms. Babb?
A couple things. I mean, I do believe that it is the Knox County Health Department's job to contact trace. I think we kind of went above and beyond last year, but that is what they are charged to do. That is their job. I do think we need to be cooperating with them. So a couple of questions around that, because I do think some things have changed, and I think that's where our parents are very confused about what our role is. So my understanding, and you correct me, is that as we are finding out about teachers and students having COVID, we are letting the health department know, because that's the big concern I'm hearing from parents is the health department. You know, I had a friend who went back to work from having a diagnosed case, called the health department. It hadn't been reported through CVS to them. So just the fact that what are we doing as far as sharing information? Because I think that's a little bit what parents are wanting to know is, what are we sharing? There was a big article in the paper that we were not giving class information. It sounds like we are. I mean, I just want to hear from y'all what we are doing.
Sure, and I can definitely address that. So the biggest thing, I know there were some early reports of, you know, specifically with positive cases. Yeah, that's two-way communication right now, right? So if we find out about a case before the health department, which it happens frequently, then yeah, we would certainly communicate that, and that's how we're trying to, really in an effort to maintain the cleanest data set that we can, right? So, you know, in a perfect world, you know, we'd get that information from the health department and take action, but, you know, the volume of tests and things makes that pretty difficult, right? So we share that information back and forth. It gets reported to us, we're going to report it to them, so that they have access to that information specifically. You know, our expectation for staff from the beginning of the school year is that we would share any directory information with the Department of Health if they asked for it, right? If for us, really, that's anything that's in our student information system. I know there's been a lot of questions specifically surrounding seating charts. Seating charts were not an established expectation at the start of this school year for teachers. We didn't say to teachers, again, unlike last year where we said, hey, let's make sure that we're assigning seats to the greatest extent that we can, right? So kids had assigned seats in the cafeteria in all their classes. I don't speak for transportation, so I don't know if they had them on buses or not. But those existed on a large scale because that expectation was established with staff on the front end. We have no expectation that staff would maintain seating charts. And as such, if a seating chart doesn't exist, there's not a seating chart to be shared. But what I can guarantee you is that if we get a call and the health department asks us for a seating chart or a class roster, and that information, we have that information, there is no reason that we would not share that with them. So if they've requested seating charts and they've been told no, it is because we don't have them. If we have that information, that is information that we would share with them. We would happily share it. So that directory information would also include phone, email, and address information. I've learned not to refer to that as contact information because that gets misinterpreted as we've identified you as a contact. But we would share any and all of that information with the health department. Again, Lisa Wagner and her team are working to make our sharing of that information as efficient as we possibly can. And it is an ongoing process because this process is different than it was last year. Because last year, we were collecting our own information for us to use to identify the cases and close contacts ourselves, right? So certainly, you know, we're going to continue to work with the health department. We've talked to Dr. Buchanan and her team on Tuesday. I think we talked to them today, and we got another meeting with them tomorrow. So certainly, we have not cut each other out of our lives or anything like that, which I know seems to be an opinion, but we do continue to work with her team and value that partnership.
Okay, and I guess another question I have, and a parent actually sort of spoke to it, is do we have any control as Knox County School System of whether a parent is actually quarantining their child when they've been contacted by the health department?
No, ma'am. Currently, we have no way to track who is quarantined and who isn't. We have asked the health department if it's going to be possible for us to get that information, not necessarily so that we can police it, but more so that we understand what of our absences are actually tied to COVID and which ones, and have an idea what ones are not. But up to this point, if you asked me today how many we have that are in quarantine, I can't tell you that.
Sure.
Because I don't know.
I mean, the one thing I would say, like this year compared to last year, and I mean, I have to think most of us, I mean, what I was hearing from parents first semester before it became the great anti-mask debate was parents upset about the over-contact tracing last year. You know, multiple kids going home multiple weeks and not getting sick. And I'm not going to say that nobody got sick from being contact traced, but a large majority were not getting sick. And I think that's what we kept hearing as the board, or I was hearing from my friend especially, just the frustration of the amount of kids sitting at home totally healthy. I feel like this year it's almost and I have to say it was mostly high schoolers I was hearing from, high school parents. This year it is completely the opposite. It is totally elementary school parents I'm hearing from, and it's almost like they all want their kids to be contact traced. I mean, it really is. I mean, and it is just, I don't know if y'all are all seeing that, but that's kind of my experience this year. Is it's like the total opposite of what we had last year, of people being mad about contact tracing and overdoing it, and this year the underdoing it, and I don't know the answer to it, but thank you for some explanation.
Thank you. Ms. Christie?
Yeah, just to speak to a little bit about the story about the not sharing seating charts, and maybe you can address this in your phone call tomorrow. And it's probably just a miscommunication, maybe somewhere in the health department. But I do know of a situation last week where a teacher called to report a positive case of one of her family members. And because she wanted to expedite the process, she offered a seating chart in that phone call to the health department. And they refused to take it. All they wanted to know was if the child plays sports. And maybe that's something you can ask them about, and maybe that's some kind of miscommunication with internally at the health department. Obviously, that's not something we have any, but it might be that we've been offering these and they've been refusing them. And maybe that everyone's not aware of that in the leadership at the health department.
Sure, yeah, I mean, I can definitely ask about that specifically, yes.
Thank you, Ms. Christie. Mr. Watson?
Thank you, Madam Chair. I think some of the reason why we're getting so many questions about this is because how much more transmission there is with the Delta variant in kids. I mean, we didn't see near the number of kids getting infected last year as we have this year. So just to be clear, the information that we would provide, should we have it, to the health department is directory information, a seating chart, and is there anything else in that list, if we had it, we would provide?
I can't think of anything offhand that would be included in our SIS that we legally would, you know what I mean, that they would need, that we legally wouldn't be able to give them.
Right.
I'm trying to think of an example. We've tried to provide principals with examples of things that we will share, but you just listed all of them. So, you know, I can't think of anything we would say, no, absolutely not, as long as we don't cross that line into we're actually doing the contact tracing.
Right. So I'm only asking you this because I told you in advance I would, so I know you're ready, even though it's 11 o'clock. Is there anything that you feel like we can do to improve what we're doing in contact tracing?
You know, I think that our primary objective, and this again is something we've been working on in an ongoing fashion, is to become more efficient. How can we get the information that they request to them faster. I know Lisa Wagner worked with the epidemiology folks over at the health department to develop a spreadsheet and do a couple things to try to get that information faster. I know that we worked to identify specific contacts within each school,
Right.
Using our school nursing staff, again, in an effort to just become more efficient and become faster. The issue is essentially what you just said, right? We're dealing with the situation where really and truly, if we activated our nurses tomorrow to go contact trace, we're still not going to catch up, right? We're dealing with a different situation
And that's
entirely.
exactly what the health department today told me too. I called them and asked that very question. If our nurses were doing it with you, and they said we would still be behind without a doubt. The one thing that they stressed was information. So as I'm hearing the discussion, the only thing that I really have question about and wondering why is contact tracing by definition hinges on information that's available, right? You can't do contact tracing unless you have information about who people have been in contact with. Is that fair to say?
That is correct. Part of contact tracing, however, is identifying who people have been around, right? So once I get into,
Right, you're making-
Christie and I, now I'm contact tracing for you because I've told you who they've been around. I've done that investigation.
Right, right, because there's the investigative side. But the investigation the more information that's available in the investigation, the quicker can potentially occur, right?
Absolutely, yeah. So the more information, the more accurate information that we have,
Yeah,
that we can share with them, the faster we share it, the better position they're in to conduct the investigation, yes.
So my only question then is, if we were doing seating charts last year, and I know some of that had to do with distancing, we had 20,000 kids out in virtual, and there was more room to do that and all those types of things. Are we unintentionally hamstringing the health department's ability to do that quickly by not asking our teachers to do seating charts?
I definitely don't think that was the spirit of not requiring teachers.
Well,
to
that's why I said unintentionally. I didn't
yeah,
think it
I
was
mean,
the spirit of it.
Certainly, we want teachers to have the autonomy in their classroom to manage it as they see fit. Last year was an anomaly, so we asked them, hey, make sure we need everybody to have seating charts. It's certainly, again, having seating charts in cafeterias and other common areas would, in my measure, be an anomaly. So, I think that as we launched the start of the school year, looking at the information that we had available to us in terms of what it looked like with the spread of COVID-19 in our summer programs, we also had summer camps going on for extracurriculars and saw very little spread of COVID-19. So heading into the school year, none of us were necessarily thinking, man, we need to make sure every single teacher has a seating chart, because that's not really a practice that we would have had in the past to enforce that, other than, again, last year doing it.
So I agree. I think during this summer, I love not being masked, and I was around a lot of different places, right? Things were very different. And if you look at the data, it tells you that too. But we also have said consistently in Knox County schools that as things change, we would adjust as well. And I think one of the things we might want to consider is asking our teachers to do that, because there's no doubt that the health department, it is their job to contact trace, but they are very, very behind. And I would think that they could do that more efficiently and effectively if they had that information. So, thank you.
Thank you. Ms. Owen?
Thank you, Madam Chair. Is there anything to prohibit our teachers from telling their class if they have tested positive? Let's say I'm a teacher and I test positive. Can I tell my students?
I'm not aware of a policy or anything. I'd have to defer to Mr. Dupler to see if there's anything that would prohibit that.
And if I can tell you why I'm asking, I've heard from lots of teachers who are very distressed because, they've tested positive. They've been told by either a supervisor or their principal that they are not to tell their students. They've been told, we're not contact tracing, you can't talk about it. And so they want to tell their students that they've potentially, that they've been exposed, and they're being told that they can't. And so I'd like some clarification for our teachers on whether they can or not.
Like I said, I can work with Mr. Dupler and and see if there's anything specifically that would prohibit it. I guess, you know, if we look at it as something other than, again, this anomaly that's COVID-19, I guess my question would be, how appropriate would it be for the teachers to share any of their personal health information with students, right? I know that obviously COVID-19 is a different thing, but I think the question that you're asking, I think I would have to give it a little bit more consideration, to be quite honest, because I don't know, you know, if we were just talking about a general health condition, would that be appropriate use of instructional time or school resources? And my gut answer on that right now would be probably not. But I also recognize that COVID-19 is an anomaly. So I think that's something I'd like to discuss maybe more with Mr. Dupler.
No, I'm thinking that it wouldn't be school resources because they are already at home and, you know, they have that contact information. If I were a teacher with flu and I thought that I had exposed students, I think I would want to tell them too. And I don't think we've ever told teachers that they couldn't do that. And something just to consider, I know that the health department can use non-medical volunteers for contact tracing, but they are so far behind that they are not even currently able to contact those volunteers. If it would be possible to use some kind of ESSER funds to hire some temporary clerical help that we could maybe loan them as we do with other things to help with their contact tracing, I think that would be significant. So, thank you.
And Mr. Myers, you may not know this, but I would assume that the health department is probably getting additional federal funds. Do you know, any idea?
I don't, to be honest. You know, I know that based on some conversation we've had, I know they're you know, trying to build out their staff with additional folks, but beyond that, I would have to definitely defer to somebody from the health department.
Okay. I mean, I worry about with seating charts. That's one more thing to put on teachers, so I don't know. That would be a concern, I think. And I think it's important to note that we have about 1% of Knox County residents are COVID positive, and that's the same percentage that we have in our schools. So at least it's comparable. I mean, I think last year our numbers were lower than the community. So it's the same number. So it's a little reassuring to me that at least we're not higher than the community at large as far as a percentage, but, okay. Any other questions or comments on this? Okay.
Thank you.
Thank you. So we have another meeting, which I forgot for a few minutes, and now I'm reminded. So, oh yes, we'll adjourn that one. Sorry. Okay, now, before we get into this, I have a question for board members. Would you like to take a few minutes break, or would you like to just quickly go through this? I'm not sure how many questions people have on this agenda, so I hope not many. Because we're going to talk about it again next week, too.
Yeah, there's another opportunity to
Right,
ask
so
questions, so.
can we super fly through it, do you guys think, or tell me? Because I'm fine to take a break, but just,
I'd say let's rock and roll.
I'm sorry?
Let's do it.
Okay, let's just do it, because seriously, we can come back and talk again next week about this. Okay, a few announcements before we get into it. Let's see. Okay, our next policy review meeting is scheduled for September 22nd at 1:30. The location will be announced as we get closer to that date. Board members, also just a reminder that our annual workshop is approaching on September 23rd and 24th. And I believe Ms. Coatney's already sent out an email requesting topics if you'd like to have something considered for that agenda. If you would get those to her by this Friday, September 3rd, so that the agendas can be set and staff members can be made aware of those as soon as possible. And are there any requested changes to this work session agenda? Okay, do we have a motion to approve? Okay, we have a motion by Ms. Satterfield, a second by Mr. Watson. Any discussion? All in favor? Aye. Any opposed? Motion carries. Okay, do you have a report, Mr. Superintendent?
Yes, ma'am.
Thank you.
Do. I'd like to move away from the traditional report, I guess, that we've done in the past, and just talk about this evening for just a few minutes for us to remember a former KCS student who died last week while serving his country. Army Staff Sergeant Ryan C. Canals, a 2016 graduate of Gibbs High School, died in a terror attack in Kabul, Afghanistan on August 26. I'd like to extend our deepest condolences to Ryan's family and friends and to the Gibbs community. Also like to express our gratitude to Ryan for making the ultimate sacrifice on behalf of his country. He is a true hero and an inspiration to us all. Thank you, Madam Chair.
Thank you, Mr. Superintendent. Okay, we have items and contracts. Any questions on 1, 2, or 3? Okay, 4, 5, or 6? Seven, 8, or 9? 10, 11, 12? 13, 14, or 15? 16, 17, or 18? Okay, 19 or 20? Fantastic. Board policies, these are all second readings, so I'm assuming that we are all good here. Anyone? Okay. Grants, any questions on A, B, or C? D, E, or F? G, H, or I?
Quick question.
Yes, ma'am.
It's just on those, the ones about, I think it's C, there were 2 different ones about the carryover funds. If somebody can just kind of explain how that works. Sorry.
Dr. Reisbeck and Ms. Satterfield, do you have a
Just wanted
question?
to make sure
also?
you were awake.
Raising the roof. Celebrate.
Oh, you celebrated a little too soon, my dear.
So thank
Go
you,
ahead,
Ms. Babbitt.
Dr. Reisbeck.
Thank you, Madam Chair. Thank you, Ms. Babbitt. So these are 21st century grant dollars that come that do after school programming, enrichment, tutoring, those sorts of things at the schools. And sorry, I'd have to look to see the schools again. I think it's Pond Gap, Inskip, and
Christenberry.
Oh, God.
Good memory.
11:15, I remember, okay. So the reason there's carryover dollars is those were dollars that were used last year. I mean, it's kind of an ongoing program for them. With fewer students there, fewer teachers, that's who we pay to do that. Fewer teachers were needed, so there were carryover dollars. So this is both the approval of this year's money for the program as well as the carryover dollars that we didn't spend last year.
Okay, thank you.
Thank you so much. Okay, everybody good on, that's okay. Everybody good? Grants, now you may celebrate, Ms. Satterfield. Okay, any questions on the 2 contracts? Mr. Watson?
I just want to make a comment on the contract with Adrian Burnett. If you read the detail, Johnson Architecture actually went above and beyond to ensure that they didn't just use a straight percentage increase, but they actually tried to do it to minimize the impact of the increase for us. So I just want to give a shout out to Johnson Architecture for doing that and being thoughtful about Knox County schools.
All right, thank you. Okay, any other questions on, any other questions on A or B in the regular items?
Oh, I'm sorry, that's where I
That's
thought we
okay.
were. So,
That's okay, that's all
yeah,
right.
yeah.
Okay, and then the last item, C. Yes, Mr. Watson.
Just, I want to make reference that the $2,090,000 is a higher number than what's in the detail, but that the remaining part of that detail will be provided next week. So if anybody noticed that there's a $200,000 difference, it's because the detail's not there.
Okay, so we'll have more information on that.
Yeah.
Okay. Any other questions on this? Okay, and let's see. We do not have public forum. Anyone signed up, correct? We would let them speak if they were here, but, okay, and there's board forum. So, okay, Ms. Satterfield.
Thank you, Madam Chair. It's just on my heart to lift up. I just want to, for just people in the community, like we've been working really hard as school board members. I'm kind of envious of the other elected body at this moment. So I just want to just appreciate my colleagues, even if we don't don't agree on some things and a lot of things, but I see the work that everyone has put in across on this board, and so I just want to appreciate that and acknowledge that.
And thank you for saying that, Ms. Satterfield. I actually meant to say that at the beginning, and I didn't, but thank you for saying that. It's really true. Especially the last few weeks, this board has really been a little crazy busy, so thank you all. Thanks for saying that. I'm sorry, Mr. Jen, I did not mean to skip you. I apologize.
No, that's okay. No, I just wanted to make a quick comment. I believe September does start Suicide Awareness Month and prevention. So I'd just like to say to all the students out there, like, if you are going through difficult times right now, you matter. You are loved by our community. You are loved by your friends, by your family, and do not be afraid to seek help. Do not be afraid to go talk to somebody if you need that. Just do what is best for you to ensure that you are in the right place mentally to go forward in your life and to succeed in your life.
As chair, and I can just sit over beside the superintendent and Ms. Henderson, and that will be quite nice. So I know we're all going to be rearranged. Maybe I won't. Yeah, I don't even know where we'll sit, but we'll figure it out. So anyway, but thank you all. I appreciate the opportunity to chair the last couple of years, and so with that, I think that's the shortest work session we've had in a while, and we are adjourned. Thank you.